1 live.
All right. Good morning. Apologies for starting a little bit late, but recognizing a quorum of commissioners, I call the November 14th, 2024 meeting of the Cannabis Control Commission to order. This meeting is being held hybrid pursuant to Chapter 22, the Acts of 2022, and is being recorded. Commissioners Camargo, Concepcion, Roy, and myself are participating in today's meeting. All votes taken today will be by roll call. We have a full agenda today that I will generally summarize. We will start with opening comments from commissioners, approval of 3 sets of minutes, then the acting executive director report. We'll present the AED and commission staff report before we proceed to staff license recommendations. Our acting ED is out of the office today, so as a team, we will do our best to go through the acting ED's report and commission staff report. There are 7 change of ownership recommendations, 50 license renewal recommendations, 5 provisional license recommendations, 9 final license recommendations, and 1 responsible vendor training recommendation. There are 3 items in the commission discussion and vote section today. Calendar year 2025 public meeting schedule discussion, legislative strategy work group discussion, and lab shopping discussion. I will ask that commissioners wishing to comment or ask questions during any part of the meeting to raise their hand to be recognized. With those initial comments, I will turn things over. Next item is, commissioner comments and updates. With those initial comments, I will turn things over to commissioners for any comments and or updates. Commissioners, we will go in alphabetical order. As chair, I'd give my comments last, but if we go alphabetically, I'm still last. But we will start with Commissioner Camargo.
Hey, good morning. Buenos dias. Only, I guess, comments from me is I want to remind our delivery operators and our lab operators, or folks that are out there, that the regs have not gone into effect yet. And I'm sure there will be a bulletin or an announcement the day that they do go into effect, and that folks should still be having 2 agents in the car. So I want to remind folks about that. And also want to remind folks that on December 5th, we will be unveiling what social consumption will look like for Massachusetts. A lot of questions, a lot of thoughts, a lot of work. But I invite folks to be present on that day. We'll have it hybrid as well, but want to, like when you think about social consumption and you think about cannabis culture and gathering and, what it really means, I just hope that we can see folks here live and in person. So I invite our staff and folks out there that want to, get a peek at what this will look like. And, we're working towards that. So I think that's it, Commissioner Stephens. Thank you.
Okay. Thank you, Commissioner Camargo. Commissioner Concepcion.
Good morning, and thank you, Chair Stebbins. I'll be short and sweet. This is, although we had a executive session last week, today is really my first public meeting back at the commission, and I am really, really excited to see all the work that's coming through the pipeline and the work that continues to unfold. So I look forward to hearing more about the social consumptions, working groups efforts, and hearing feedback as well. The other thing I wanted to say is I just really want to extend my appreciation to a number of people. I won't name names, but the commission staff have gone above and beyond. And so I just want to give them my heartfelt thanks. And lastly, I am very appreciative of the IT team and the ability to join you all today, even though I wish I could be there in person, but just having the opportunity to come in and see your faces, even though they're small on the screen, but also participate. So thank you so much. And thank you, Chair Stebbins.
Thank you, Commissioner. Happy to have you with us. Commissioner Roy.
Thank you, Chair Stebbins. Good morning, everyone. I want to thank the Massachusetts Cannabis Coalition for inviting me to be their featured guest for a fireside chat with former Commissioner Kay Doyle last Friday at Holy Cross College in Worcester. It was a very well-attended event, and we covered a lot of important topics that are of pressing importance and concern in the Massachusetts cannabis industry. I want to thank Joint Committee on Cannabis Policy Chair Dan Donahue and Chair Adam Gomez for attending my portion of the program and for providing their insights as well during their discussion. I also want to thank everyone who provided testimony in person, virtual, and written at the Commission's ITL listening session on November 7th. The Commission is committed to and continues to make great strides to ensure products are safe and accurately tested and labeled. If you have not noticed already, you will begin to see significant steps towards identifying those who may be responsible for any data manipulation, whether in potency and/or contaminant reporting. I want to thank the I&E and data teams for their hard work to make potency information available on our website for the public to see, referred to as Phase 1. Phase 2 will consist of the publication of contaminant reporting for further transparency and for the public to readily see, for example, total yeast and mold counts. Today, our I&E team will also introduce another step in an effort to reduce and ultimately eliminate any potency inflation or lab shopping that may be occurring. Recognizing there are many honest brokers in the testing space, and we thank them, our team is fully committed to identifying any and all bad actors. Pivoting to the equally important topic of cannabis worker safety, the Commission is in the process of creating and deploying a Commission tip line dedicated to handling tips around worker safety, public health, public safety, public welfare, equity, and or any regulatory or statutory violations. I look forward to when we are able to announce in the near future the tip line is no longer a concept, but fully functional. I want to thank the folks at EON for providing the Commission with suggestions and recommendations around the implementation of the tip line. Yesterday, you may have also seen the Commission has taken further action to help protect Massachusetts cannabis workers, issuing a bulletin formally identifying ground cannabis dust as an occupational hazard. Under this new bulletin, licensees who process marijuana are advised to protect employees from hazards associated with cannabis dust exposure by using engineering controls such as local exhaust ventilation, administrative controls such as limited employee exposure to the workday, providing personal protective equipment, the creation of a hazard communication program, and the development of safety data sheets, to name a few. This formal recognition of cannabis dust as a hazardous chemical is in alignment with the Department of Public Health's Fatality Assessment Control Evaluation Report and Occupational Lung Disease Bulletin. I want to thank the Commission staff who worked closely with OSHA and DPH in the development of this new worker safety bulletin. I also want to thank cannabis worker safety advocate Danny Carson for all their tireless work on this critically important issue. Thank you so much for my time today.
Thank you, Commissioner. Couple of points I want to raise this morning. I apologize, I'm going to be a little lengthier than usual. This past October was National Disability Employment Awareness Month. And I had the opportunity, along with Commissioner Camargo, to hear state leaders and advocates discuss how to bridge the gap between residents who have disabilities and employment opportunity at an event hosted at the State House by the Commission on the Status of Persons with Disabilities. The Cannabis Control Commission, as everybody knows, annually reviews Massachusetts licensees' efforts to hire and recruit a diverse and talented workforce. With more than 700 operating marijuana establishments across our state, there are opportunities for residents of all abilities to work in the many different facets of the cannabis industry, and a chance to join the $7 billion adult and medical use cannabis industry. Earlier this year, the Commission hosted a presentation about Massachusetts' own disability employment tax credit promoted by Massability. The state tax credit supports employers, including cannabis businesses, who prioritize hiring employees with disabilities. Additionally, the Massachusetts Office of Disability supports trainings to better educate residents and employers. There's also an online guide called A Guide to Creating Inclusive Workplaces at mass.gov. Is a tremendous resource, and also the Commission provides guidance on diversity plans to also help our licensees comply with our regulations. The Commission's the Commonwealth's, not the Commission's, the Commonwealth's Executive Office of Labor and Workforce Development's Department of Economic Research is another great resource that tracks employment data for people with disabilities in the Massachusetts labor force. What I found interesting is, did you know that the 5 cities with the largest working age population of individuals with disabilities are also Commission designated disproportionately impacted areas? Boston, Worcester, Springfield, Fall River, and Lowell all collectively account for nearly 100,000 working age people with a disability, or 20% of the total working age population of folks with disabilities. As I review license renewals, I do see licensees continue to make efforts to recruit and hire our veterans and our neighbors with disabilities. I'll talk about this and my thoughts on this when we get to our discussion about the 2025 calendar. Secondly, I want to thank Commissioner Roy and our team, as she pointed out and just recently talked about, our most recent quarterly listening session with our independent testing labs. Thankful for all of the suggestions and ideas that were put forward by our licensed labs. I'm considering how we might be able to address those, as I know we're also in the final stage of bringing on a new director of testing. I'd like to also announce that our next quarterly listening session will be organized by Commissioner Camargo and will be focused on the medical cannabis program. I know Commissioner Roy has done extensive work in this area as well, but we want to hear from our patients, our medical providers, our MTC licensees, and our team. So that'll be part of our calendar as we look ahead to 2025. Finally, I want to offer my thanks to my colleagues. This is my 3rd CCC business meeting since I was asked to serve as acting chair. I just want to take a moment because I want to express my unbelievable amount of faith and trust in my colleagues and appreciate their collaboration, their professionalism, their work, and the leadership you have all been providing. We all know this is not an easy job, and there are always a lot of eyes on us, but I just want to offer my thanks to my colleagues. So that said, let's jump into our work on today's agenda. Just give me a minute. All right. Our next item, we have 3 sets of minutes that are up for approval. These are from our meetings from August 22nd, September 12th, and September 27th, 2024 public meetings. Those were all included in your packet. Hopefully everybody had a chance to look at those. I would seek a motion to approve the August 22nd, 2024 meeting minutes. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Roy?
Second.
A motion been made and seconded. Any comments or questions on this set of minutes? Seeing none, I'll do a roll call vote. Commissioner Camargo?
Aye.
Commissioner Concepcion?
Our computers.
Oh, thank you. Commissioner Roy?
Aye.
And Commissioner Stebbins votes aye, 4 in favor, none opposed. The next set of minutes is again from the September 12th, 2024 meeting. I'd seek a motion to approve the September 12th, 2024 meeting minutes. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Aye.
Second.
Second, sorry. I'm sorry, voting on it. I'm sorry. You're ready, you're ready.
Jumping the gun, you're ready.
Sorry.
Motion been made and seconded. Any further comments or question on these sets of minutes? Seeing none, I'll do a roll call vote. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Computer's restarting, she said.
Okay.
We could take the vote, right, with 3 of us? Or, well, she moved it. Might have to, oh, she.
Yeah. Sorry.
See the dog, my dad and my dog, it just like, it was so nice and awful fun. I wish you would really communicate with some moment about this. Oh, yeah, I'm sure some sorry. So sorry. I don't know. Yeah. And it's yeah. I think seriously, yes. I mean, she hasn't done the first thing computer routine, but it could take 5 or 10 minutes to clear. So, what to do?
If you want.
Yeah.
We do it.
We are going to see if we can do this. Commissioner Concepcion is
Wasn't in time.
rebooting her system, rebooting her computer. We're kind of caught between, we made a motion and starting to take a vote.
We just withdraw it and do it over. We can withdraw that and we'll do it over just to keep moving.
All right. We will seek to make the motion again. I'll entertain a motion to approve the September 12th, 2024 meeting minutes. Commissioner Camargo, do I have such a motion?
Get it right this time.
Commissioner Roy.
Second.
Awesome. We'll do a quick roll call vote. Commissioner Camargo. Commissioner Concepcion, silent on this one. Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. 3 in favor, none opposed. I don't know how we say that, 1 not participating, I guess. She didn't recuse or abstain, so. Okay.
It's just people can't hear us. You finished that part, Commissioner Stebbins? I think it's September 27th.
I think we're just trying to bring up volume, Jeff.
Folks hear us? Testing, testing.
Say they can hear us.
Someone send us a smoke signal.
We can hear you.
Oh,
Okay. Commissioner Roy,
you can hear us.
and I vote aye. 3 in favor, none opposed. Sorry. Moving on to September 27th public meeting minutes. Commissioner Roy, do we have a motion to approve the September 27th, 2024 meeting minute?
So moved.
Commissioner Camargo, do I have a second?
Second.
Okay, motion been made and seconded. Any further comments or question on these set of minutes? Hearing and seeing none, Commissioner Camargo, Commissioner Concepcion, not abstaining, not participating in the vote, Commissioner Roy.
Aye.
Yep.
Yep.
Yep. And Commissioner Stebbins votes aye, 3 in favor, none opposed. All right. All right. We are going to move on to the acting executive director and commission staff report. Our acting executive director, Chief People Officer Debbie Hilton Creek, is not with us this morning. So we will do our best to work through her presentation. Might be some of these that we'll move past to next slide, please. Okay. Is this you? I will turn it over to our Chief of Staff, Andrew Carter.
Thank you, Mr. Chairman. So I would like to introduce our Manager of Constituent Services, Kate Fisk, who is leading an effort from the Constituent Services Department related to our medical use program.
Morning, Kate.
Good morning. Thank you so much for having me, commissioners. I appreciate it. The constituent service team at the December 13th public meeting is going to be hosting an in-person registration event. This is the first time that our team is going to be doing this. We're going to be offering qualified patients who have received a certification from a healthcare provider the opportunity to come meet our team in person here at the office at Union Station. The opportunity for hands-on registration where we can assist them in person. They'll be able to work with us here for an opportunity to help them upload documents, work through the process, answer any questions about anything on their mind that we do over the phone that sometimes is unattainable for certain folks, or just they would prefer an in-person approach. We'd be happy to help them here. So we're going to be doing that here at Union Station from 10 to 3 on December 13th. Folks who are interested should be coming with an active medical certification from their certified healthcare provider. They should be bringing their identification documents and a proof of residency. That will be for patients. We will also be happy to help caregivers if they're coming as well. When they leave, we'll be happy to help them as long as they can become registered through us. We'll send them with their temporary card in hand so they can purchase immediately. And we will be happy to help them with any questions that they have while they're here. And if anything leading up to that, they can check our social media for additional information, and then our website as well.
I think you said December 13th. Did you mean December 12th?
I did.
Okay.
Thank you.
Just want people to show up on
Thank
the
you.
day and
Thank
not
you.
walk into an empty train station.
Use my misspeak. December 12th.
No, that's great work. Congratulations. I know Commissioner Roy is regularly out on the Council on Aging Senior Center tour with Kathy Oliver Jones, the director, to talk about the opportunities and how folks can register to be an enrolled patient. So certainly appreciate this idea. It'll be great to see some folks and have a chance to chat with them as they come in for the registration process. Certainly encourage you to think about how we can bring this great service out to other parts of the Commonwealth as well.
Absolutely. We have a plan. We have a vision for that, I should say, and we'd love to see this move around and how we can service patients in the community as well.
That's awesome.
Fantastic. Yeah.
That's awesome. That's great. Commissioner Camargo?
Have we thought about doing it at the Boston office as well?
We certainly can. This will be our first event, so we'd like to maybe take the temperature and see how it goes, and then maybe get a flavor for if that would work as well. Yeah,
Because we should.
agreed.
Yeah. And I think there is an incredible roster of folks that we can potentially partner with that are out in the communities that could really help us generate some turnout and generate interest. I agree, Boston would be a great spot. Our building's a little tough to get into with all the security passes and stuff like that, but.
Or even like, yeah, I mean, Commissioner Stebbins, we've talked about this before, but we have so many community partners throughout the state. I'm thinking Springfield and some of the sort of chamber of commerce. They have different offices throughout, throughout the state. But yeah, I mean, obviously it's your first one, but of course I'm already thinking across the state, right? So yeah, congrats and looking forward to it.
We'd love to hear more about the partnerships. We'd love to engage those and how we can access them. We'd love to hear more.
Commissioner. Roy?
Yeah, thank you. And thank you, Kate. This is very exciting news. And as Chair Stebbins said, Kathy Oliver Jones, Director of Constituent Services, and myself, we've gone around the state. And we have this presentation and Kathy's like my secret weapon out in the community. And she always brings, the paperwork, and we primarily talk to older Americans who, grew up in a time where their most of their lives that cannabis has been not a legal industry. So they are very kind of curious, and we get so many amazing questions, and so many folks want to learn more. So education, and this is you're providing education and you're providing information. It's critically important. So thank you for this. This is exciting. Hopefully the first of many to come. And you had mentioned it's on our social media, but sometimes like my mother's not on social media. So for example, are we doing anything else? Like, could we email something to, let's say, the councils on aging, perhaps, so they could get it to their membership, because not all the seniors are on social media.
Sure. So we would love some thoughts on that. We had talked about maybe partnering with councils on aging, or maybe some of the senior centers you had maybe partnered with previously. We talked about maybe doing some like flyers to hang in person around. We wanted to make sure we were within the proper scope of how we could do that, and making sure we are hitting the right demographics as well. So open to any suggestions, really.
Like, I don't know if there's a local chapter of AARP or something we could reach out to, and I don't know if they get federal funds, so they might not be able to, but I'm just throwing some ideas out there.
We had recently partnered.
Please.
We had recently partnered with DPH, so we were thinking that we would maybe engage them around some of that as well.
Right.
Yes, and Commissioner, happy to brainstorm offline with you as well and utilize your contacts so that we can have the widest reach possible.
Awesome. Thank you. Good.
Also,
Commissioner Concepcion, I seen you logged back in. How are you? I'm not sure how much of Kate's presentation you caught, but want to offer you the opportunity to ask any question.
I'm filling in the blanks now. So I got the date, the time that it's in Worcester. I don't have any questions right now, just because I just logged in, so I want to hear more context.
I have a question.
Commissioner Camargo?
Yeah, and maybe we can just talk offline, because obviously this is the first time you guys are presenting to us. But I'm just thinking about non-English speaking folks, right? Especially for me, I speak Spanish as my first language, but just thinking about, educating the community in terms of what this is and what it means. A lot of folks do not know how to become a patient, or how to, all that good stuff. I won't even get into it. But, just when I know this will be a first time, but when we think about that, I think Commissioner Roy, you had a great, idea in terms of thinking about the councils on aging, obviously throughout the state and different cities. But yeah, just also thinking about non-English speaking, residents and community. So again, first, and congrats, Kate, because I know you've been doing this work. I always see you back there going through envelopes and, doing all the constituent stuff, like, I know you do more than that, but I'm saying, like, I see a lot of the mail and everything that you do. So thank you. And it's good to see you in person. It's good for you to, just show us a lot of the work that you're doing on this. And I know that Andrew has been supporting you and the team on this process. So thank you. This is a big deal.
I couldn't do without my team. They really are the wheels of this. They really are. This is their event, and really, I couldn't say thank you enough to them.
Yeah, that's awesome. Congrats.
Just want to speak to your bilingual. So we actually have a service that we can contact if someone wants to come here and spoke a different language. We could use the phone and contact them, and we can do the service for like a whole host of languages. So anyone can come and we'll help them out.
Can we make sure that, I'm sorry, Commissioner.
Go ahead.
Oh, can we make sure that people know that?
Yeah, we sure can.
So whether, again, social media, whatever emails you guys are sending out, and if you guys send us a bulletin, like, an email, like a like a newsletter, then we can send it out to our network too.
Okay.
You know, but make sure you guys put in there that translation services are available.
Sure, yeah, that's a great idea, thank you.
Yeah.
We do offer our paper applications in Spanish. It's a little bit limited, but we do offer that
Yes.
specifically, and then we can do the phone for
Yeah.
like a whole host of languages.
Yeah, yeah. And there's a lot of languages. I'm using myself as
Yeah.
an example because I speak Spanish, but yeah.
Thank you.
Commissioner Roy, did you have something else?
No.
Okay.
Fantastic, thank you very much.
Commissioner Concepcion.
Commissioner Concepcion, sorry, go ahead.
No problem. Kate, it's good to hear you. I can't see you on my screen, but it's good to hear you. So this is something that's come up in the past, and Commissioner Roy sort of alluded to this too as well, you know, in terms of when she goes out and speaks to the community, mainly seniors. Do we have information available about the demographics for who's actually utilizing the medical use program?
Hi, Commissioner, welcome back. We do, we have
Turn that.
We do have, through Tableau, which we have here in-house, we have some really nice infographics. I
Mhm.
don't have them handy right now, but I can certainly share them at some point moving forward in regards to our age demographic, location demographic. We have it broken down now by who utilizes our paper applications versus who utilizes our online applications. Our data team is really helpful, and we can break it down in different ways as well.
Okay, I think that would be helpful. I know there's been some fluctuation in terms of the utility of the program and how many people are there, but I just know, I'll say for myself, it will be helpful just to have that information.
Sure,
Are
we
you
can get that
able,
for
I know you don't have the exact numbers now, but are you able to kind of give us sort of an estimation, you know, is it more people of a certain age, or is it sort of sporadic and spread out?
Hopping into Tableau now.
I mean,
Go
Mr.
ahead.
Chairman, Commissioner Concepcion, I think we can circle back with that information if you don't mind. Because I'm looking at our licensing slides, which I do believe generally includes information as it relates to our medical use program, but
I don't believe it includes age.
Correct, yes, I think it only relates to patients. So we have approximately 90,000 patients. Certified active patients are at 84,644, and then approximately 6,500 active caregivers. But the breakdown, we're certainly happy to pull the data and then circulate with the commissioners.
Okay, that would be helpful. I'm thinking of a few different reasons why, but I guess one I'll share now is just in terms of the way that we are providing information, the way that we are, you know, distributing not only resources, but doing our outreach, that would all be helpful. And I just think, you know, in terms of our overall understanding about the program, that information would be helpful also. Thank you.
Thank you.
Awesome.
Awesome, great news. Thank you, Kate.
Thank you very much.
Yeah.
Appreciate it.
Thank you, Andrew.
Celebrate the little wins.
Yeah,
It's a big win, I'm sorry. It's a big deal. Thank you. Thank you.
anything else you want to share? Okay,
Actually, I
Commissioner,
just have a thought, and thank you, Commissioner Camargo, for sponsoring the next listening session, which will be around the medical program and patients, and maybe, and do we have a date on that yet or no? Not
we
yet.
do.
Okay,
Yeah, we don't.
no, but maybe that's another opportunity
Absolutely.
to have the staff on site.
Sure.
Okay, great, awesome. Thank you. Thank you.
Well, I was gonna say to Commissioner Roy, again, because we're in public meeting and so
Let
awkward.
it out.
Yeah, we let it out. But I know that you and I have talked about medical reciprocity. And you and I should probably just check in on that. Because I think you're gonna sponsor, I don't know yet, but we've been talking about it, right? So I'm focused on social consumption right now, but I think that you and I should probably talk. So that when it's time for us to bring that up, I mean, I think you and I have been a huge advocate of that. So, yeah.
And this really is our only opportunity, not to sidetrack us, but thank you for bringing that. And it's been a priority of both of us for a long time. And there's over 24 states across the country that accept when our medical patients visit those states, they accept our medical cards, but we don't reciprocate
That's
in
right.
kind.
Okay.
And so Massachusetts is a tourism state.
Yep.
And think of the folks that come into Massachusetts who are medical patients from other states, and we don't recognize their cards.
Yeah.
And it's my understanding, and I spoke with former Commissioner Kay Doyle, she tried to champion this as well. I believe it's a legislative fix, but that doesn't mean we can't opine on it. And it doesn't mean we can't discuss it and share our support through our legislative and, executive outreach strategy, and that we could say that we are in favor of this.
Yeah.
So I think it's pretty, I mean, I don't want to speak for everybody, but I think we're pretty much all in agreement that,
And I think that, and you and I talked about this too, is that we should probably, I know that we're going to talk about next year's priorities, but we should probably put it through our legislative process here.
right.
So that we can all vote on it, have the conversation, and then, our government affairs team and everybody else can kind of help us to start having those conversations.
Yeah.
At the State House, but I think it's a good time, and we're going to have a listening session at the beginning of next year. So,
Exactly.
yeah.
Yeah. Thank you for bringing that up.
No, of course, yeah. I just, there's so much that we're doing behind the scenes, but we're not talking about it. So with all this, I think it's important for us to kind of just bring it back up.
Mhm.
This is our time and opportunity to do that.
So, thank you.
All right. Okay. I see one of our constituent service team members here. Hi, Holly. No, don't turn around. It's you. All right. Okay, we'll move on. Thank you both. Go to the next slide. All right, we are moving on to our equity program and community outreach. Public meeting presentation. This is being presented by Celia Williams, our Director of Equity Program and Community Outreach. I saw her up a minute ago. There she is. Morning, Celia.
Good morning, Chair Stebbins. How are you today?
Living the dream.
One day at a time, right?
Good morning. All right, do you want to take us through your presentation?
I do. Before I get started, I wanted to say thank you, Chair Stebbins, Commissioner Roy, Commissioner Concepcion, and Commissioner Camargo for having me this morning, giving me some time. I'm going to try to be very mindful, very demure, because we have a packed schedule today. But I have the opportunity to go over what my programming, my department, and my team, my staff, and my colleagues have been working on today. So I want to thank everyone for all their hard work. It's been a year, right? It's been a roller coaster for me professionally and personally. And so without you guys, without the commissioners, you chair, and the support of everyone here, the work that I accomplished would not be possible. So I want to say thank you for that. I appreciate everyone. Before we get into my presentation, this is just an overview of what the Equity Programming and Community Outreach Department has been doing, what we continue to do, and what we aspire to do. I want to take this opportunity to make sure that I refine people's mindset about what our department does, what the social equity program is, and what it is not. I think that there are some misconceptions that continually arise as I'm internally or externally doing outreach or having conversations or supporting people. So I'm really excited for my presentation today to really get into the nitty-gritty of what my department does, what the social equity program is, and some of the things that we intend on offering very, very, very soon. So again, thank you for my time. Next slide. So this is a great segue for me because this is my team. I'm happy to say that we are fully staffed currently. I do envision, more opportunities for more staff in my department, but right now it's myself, Celia Williams. For those who don't know, I'm the Director of Equity Programming and Community Outreach. I work alongside Dara Sands, our Manager of Equity Programming and Strategic Partnerships, Stephen Carousel, the Manager of Community Outreach. Definitely want to make sure that I highlight that Stephen Carousel started with us as a project coordinator, and through his excellent work, his initiative, being a self-starter, has been promoted to the Manager of Community Outreach. We have Akila Armstrong, always keeping me accountable and keeping my projects moving. So I thank you for that. She is our project coordinator. And then we have Frank Espinal, our newest project coordinator, who's been with us for about a month now. I know for Frank, it seems like it's probably been forever, but he is really onboarding and really jumping in, boots on the ground, learning our programming, getting ready for community outreach, and learning all things equity. So I'm super excited that he has joined our team. And so what you're looking at is what the Equity Programming and Community Outreach Department is comprised of. Next slide.
So Leah,
Oh,
sorry
yes.
to interrupt you, but before you start your presentation, you may have to get closer to your mic
Okay.
because we can hear you, but it's just not the best.
Oh, I apologize.
Now it's perfect.
Yeah, I was just turning it up. If you,
Oh,
if you
no.
have some more audio problems, Commissioner Camargo, please let me know.
Yeah, right now you sound like you're underwater.
Yeah, you're a little.
Okay, hold on.
That's
I
better.
apologize. I'm sorry. How about this? Is this better? No?
Yeah.
Yes.
Yeah.
Yes. We're good. So I won't move. I'm going to stay right here. Apologies. Thank you for letting me know. My next slide, we're getting into our department objectives. And so this is what my department is really the core of the department and what our mission really is. We are looking for a community. We are doing community outreach initiatives to make sure that we are prioritizing disadvantaged groups, making sure we're engaging with industry stakeholders, and providing industry updates with regards to the educational resources and training opportunities that our programming is offering. We're engaging in strategic partnerships to make sure that we reach everyone across our Commonwealth. Equity reaches everyone. We do have groups that we prioritize, but we would be going against what is the core of our mission if we didn't include everyone. So making sure that we reach out to our women, our veterans, and those communities of people of color that have been disproportionately harmed. That is a part of our strategic engagements. We're also looking for opportunities to recruit minority women, veteran-owned businesses to make sure that they have the support that they need as they're moving through either the licensing process or are already operational. And then we have our equity programming. And so the objective of that is to make sure that we're growing our resources and evolving with as the industry is, and providing all of the training and technical assistance programming that we can to our approved social equity participants. To date, we're going to go ahead and get into how many participants we have. As everyone is aware, we had recently opened our cohort of applications. So this is a point of, this is going to be a lot of points in my presentation. And so at this point in the presentation, I want to remind people that our cohorts are application periods. The reason why I want to reframe everyone's mind around what a cohort stands for is because when we think about the resources that we provide, I am now standing in completing 4 cohorts of application periods. But as our technical assistance and training grows, everyone that is an approved social equity program participant is invited to receive that new curriculum. And so everyone, whether you're in cohort 1, 2, or 3, there are things that change and evolve with the industry, which you are welcome to come participate and get that information and get the resources that we have. It's not closed off to any application period. So we just completed an application period for cohort 4 applications, which closed on April 30th. To date, we have 1,101 participants that have been accepted into our social equity program. Next slide.
So Leah, quick
Yes.
question.
Can you please go back to the
You gave us the
slide?
total number of participants. How many were accepted in this most recent cohort?
Give me one moment. I have that here.
Sure.
I want to make sure the number is correct. I'm going to give that information to you now, but it's later on in the slide. For cohort 4, we had 229 approved social equity applicants.
Thank you.
You're very welcome.
Sorry for jumping the gun.
No worries, no worries. Next slide. So these are the goals. I kind of touched on this a little bit earlier in our earlier part of the presentation when I first got started. But these are really the core pillars of the things that we are looking to make sure that we provide in our programming and evolve through programming. One is reducing the barriers to entry into the regulated cannabis industry. Our second goal would be providing professional training, technical assistance, and mentoring for individuals and businesses facing systemic barriers. For those who are aware and those who aren't aware, we have very strategic eligibility criteria to be approved into the social equity program. And so with that, providing that technical assistance and training program to that group of people who are eligible is very, very important. We're promoting sustainable, social, and economically reparative practices through the regulated cannabis industry in Massachusetts. Making sure we do that through technical assistance, through support, through educational materials, through networking, through the community outreach that we do. That is how we continue to support and engage these communities, and we will continue to do so. Next slide.
Oh,
Right.
sorry, hang on.
I'm so sorry. I
Celia,
can't see you guys. I apologize.
It's
Sorry.
okay. I think it's
Celia,
me.
hang on.
Even.
Commissioner Concepcion has a question.
Just a really quick question. Director Williams, it's good to see you.
It's good to see you.
I had a question about that second point around what the social equity program provides, you know, the services, the mentorship, the training. Is that continuously available? So if you were someone who came in cohort 2 and we're now on cohort 4, can you still have access to that? I just think that's something that's important to sort of highlight for anyone who's watching, but I also just for clarity about who has access to these resources.
Most definitely. So our technical assistance, and I'm going to touch upon that later on in our presentation,
Okay.
but our technical assistance and training materials and education that we have taught previously is available 24/7 through our educational management program, which is Talent LMS. And so as we update, remove, and add things to that system, whether we're having live coursework or not, 1 through 4 has access to that technical training system. So yes.
Okay. And
So
that
although
includes, because
go ahead.
go ahead.
So although
Well, I was
we're
just
not
thinking-
providing year-round like live technical assistance training, because well, I'll get into that later on in the presentation. That is something that is not available all the time, but the recordings of the technical assistance and training live programming that we did previously is available, as well as the coursework and the assignments.
That's perfect. Thank you, Celia.
You're welcome. All right, so we are going to get into my next segment in our presentation, which is our social equity program. Our social equity program is a facet of what the equity programming and community outreach team manages. Through our social equity program, I'm proud. I think that everyone in this organization and our agency is proud to be the first statewide program of its kind. Giving the technical assistance and training, giving the support and the community outreach that we do across our Commonwealth. We have tailored programming for a diverse variety of interests. Noting here, and I think that it might sound a little redundant as I go through our programming, is that the social equity program is not a licensing program. It's a technical assistance and training program, providing people assistance and resources and guidance through the regulated industry, no matter what your interest is. Yes, do I have a lot of people that come into the program and are looking to be licensed? Definitely. I have people who are just looking for a job, how they're going to get into the industry. I have people that are just curious about the industry and want to know if this is a career path for them. I have people that have transferable skills and are looking for what those leadership and those executive opportunities are. And then just people wanting to excel in whatever their entrepreneurial interest is. And then we cannot forget about our ancillary businesses, which support the cannabis industry and make sure that businesses can continue to operate and move forward and offer those great services. So there's a variety of interests that we cater to in our program. And through our programming,
Celia, quick question. Because I've had the opportunity, I know other commissioners have had the opportunities to go to your informational events. You do a great job because you bring in licensees that have been in that space who effectively can tell their story of getting to where they are. The one in Roxbury was compelling, not only because you had licensees who have been through the process, sharing their stories. First of all, we appreciate the time that they take away from actually running their business to kind of, extend a helping hand. Do you see other opportunities for these type of informational sessions with not just license holders, but, folks that are working in the industry to share their experience, how they might have learned about opportunities going through the RVT program, kind of building that, individual registered agent kind of connection with some of the folks that are thinking this through, thinking about entering the industry. Do you foresee any opportunities to build on the programs that you're currently doing and engaging registered agents to also tell their story?
Yes, definitely. So I think that that's a great question. Thank you very much, Chair. So I've been fortunate enough to actually have that type of presence in a lot of the outreach that we do and that we have done. Through the community outreach, when we opened the application period, we did 6 application periods just to make sure that people had the support. I'm big on making sure that I reach people where they're at. Meeting people where they're at is very, very important. And so we went across the Commonwealth. Definitely want to make sure that we touch base in DIAs. And for those who aren't familiar with that is, I apologize because I'm not only talking to our commissioners, I'm talking to our constituents. So area outreach initiative, and even in the Faces of Equity campaign, that docu-series that we did prior to launching the application period, we engaged licensees. We've engaged people who are working in the industry. I have had delivery operators. I've had delivery couriers. I've had people who luckily I've been also able to partner with, and thank you very much. Let me extend some gratitude and thanks here to Ryan Dominguez. I've had an opportunity to partner with him. He brings different resources and a community that I can bring into our networking events. And these individuals have gone through expungement, been able to talk to the people who have attended these events on how you get through that programming and what that looks like. And so I've been able to bring different perspectives in a variety of different situations that people have gone through and how the programming has helped in a variety of the community outreach that I have been doing. I've also, want to commend Constituent Services and our Chief of Staff. I want to commend our Chief of Staff and Constituent Services for their outreach to the medical patients and our senior community. I've had the pleasure of also partnering with Commissioner Roy and her great work, making sure that we get awareness and resources to that community as well later on in the presentation. But since we're here, we're also doing, a RAC card for those who haven't seen it, a resource that can also be available to that community that will make information with regards to the medical program accessible when we're in the community as well. And so we have done that community outreach and had those varied perspectives, and we continue to do so. As Stephen Caracello, our manager of community outreach, is planning, we plan on getting diverse stakeholders to be able to give their perspective and their journey, whatever that may be in our industry as well. Are there any more questions?
Yeah, seeing none, keep going.
We're looking to build sustainable pathways into our industry for long-term success, right? It's getting the goal when I think about the programming and the resources that my team and our agency provides. It's not only getting into the industry, it's how do we foster sustainable presence within our industry. And so when we get into looking at the curriculum, the evolved curriculum that has been built, you'll see that the mindset is not only how do we support you to enter the industry, to understand how you can have a place in the industry, but also fostering support for you to understand what it means to sustain your presence in the industry. As it as prices go up or prices go down, or you have different business needs, your staff is growing. We want to make sure that we're also fostering what that means when you open those doors, and seeing what those different opportunities are and being open-minded, right? We want to think beyond, where you're currently at and getting into the industry, but what is the downstream effect of that and how can you prepare for that? So that you will see in our presentation how that curriculum and the support that we try to provide, whether it's through technical assistance or community outreach, we want to make sure that people understand the journey and how they're going to keep staying on that path and be successful. Next slide. So as I was saying earlier, when we're talking about our technical assistance and training, we have tailored track selections, aligned with our approved participants' interests. We have, like I said previously, we have a varied interest of what people want to do in the industry. And so I have a lot of people that come into our program, are approved, and don't know what it is that they want to do. So we take these phone calls, we take these emails, and we coach people and kind of make them understand what it is that we offer. So ensuring that we are providing that support, not only to say, here's a platform, have at it. My team and I make sure that we provide that support so people understand what track and what the curriculum is that we're providing and how it can help them. Through these efforts and the community outreach that we have, we want to make sure that everyone understands that we are looking to empower an industry through participation with our participants, with our stakeholders, with our licensees. The work that we are doing, it is a collaboration. It is not just one program that is responsible for making sure that equity has a presence in our regulated cannabis industry. We do that with partnerships. I do that across our agency. We are responsible for it. Our licensees are responsible for it in a variety of ways. Our municipalities, are responsible to make sure that we are holding equity in the forefront of all of the things that we do. We said that it's a priority, and so through empowering an industry, through the contributions, through education, resources, different programming, and legislative, changes, the regulatory process is what I'm trying to say. As we evolve regulatory practices, that is all with the mind of making sure we empower equity within our industry. Also building employment pipelines. I'm super excited as we move through the later part of our presentation. As chair, you understand, and I've actually talked to all of our commissioners about this, that looking for a way to make sure I listen to what is happening outside. When I go into the community, I hear people say that, how do I get a job? Like, how do I find these jobs if I don't know how to get to them? Or I have licensees saying, like, I haven't been able to fulfill X, Y, and Z because I don't know how to do it. And so I'm super excited to be able to present that bridge that we are going to implement for licensees and approved social equity applicants, as well as the general population. It will be available too, but we have a prioritization within that application to make sure that we're bridging the gap to employment opportunities. I'm going to take this moment and I'm going to say it again, is that we have a platform that we want to intend on rolling out soon that you'll hear about later, but that is also a collaboration. The tool is only as good as the people who use it. So we're going to make sure that we're appropriately communicating and advocating to both applicants and approved social equity participants, as well as licensees, how to use this portal. But for its success, everyone needs to, be a part of it. Next slide. As we touched on earlier, this is an overview of our cohort. This is the question that I get asked a lot, and so I'm super glad to be able to present this today. As this slide you're seeing is an overview of what our application period has looked like, as well as approved applicants per cohort. I will quickly go through first the application deadlines, as I think that this is a question that comes up a lot, so I want to make sure that we get through it in our conversation today. These are the application deadlines. Typically, a social equity application cohort period is held for 3 months. And this is the deadline to apply. So cohort 1, the deadline to apply was June 1st, 2019. Cohort 2 was May 1st, 2020. Cohort 3 was November 15th of 2021. There's a note here. It's a little bit of a small font, but if you look down, it also mentions what I'm about to say, is that the difference, I get asked a lot what the difference is between, what happened. Your application period, you did this awareness campaign, you went out into the community, you did all these application periods. The difference is that the close date for cohort 3 was extended to receive more applicants. So that is the boost that you see in the numbers. So for cohort 3, we have 450 applicants. The application period includes an additional 3-month extension. I can't speak to why the extension took place because I did not facilitate that. I had just came into the equity department when that application period closed. And then we have cohort 4 that closed on April 30th, 2024. And as I mentioned earlier, we have 229 approved applicants in that application period. Were there any questions on this slide?
Commissioner Roy has a question. Go ahead, Commissioner.
And thank you, Celia.
No problem.
My question, and you might have this further in the presentation, and if
Okay.
you do, just let me know.
Okay.
But with cohort 4, the 229 folks, so I've gotten calls from some of them, and I realize that we don't have a date certain when the in-person training will commence again, but you had mentioned that the existing materials are available 24/7. Have we reached out to these 229 folks to send them the links to these materials? Or if we haven't, can we do that? So at least they have availability and accessibility to something short of having the in-person training?
Commissioner Roy, that's a great question. Thank you very much. And we have. As we went through the application period, I organized the application period that my team, once we had a schedule, right? We had a lot of applications. And so as we reviewed those applications, let's just, at the end of that week, let's just use this example, Monday through Friday. Friday, we would review all of those applications. What was approved in that application review period for that week would have been enrolled into Talent LMS. Upon enrolling into Talent LMS, my team sent out an email to the registered email address that was in the application, and it identifies that you have been enrolled, you have been approved. They get the first approval notification. The second notification that an approved applicant would have received would have come at the end of the week after they were approved. So actually everyone has received access to Talent LMS, has received an email and an approval email that automatically comes from Mass CIP. But to that point, if the people that are listening, or the people that you have reached out to, if they send an email to equity@cccmass.com, myself and my team manage that inbox. If you cannot access Talent LMS, please feel free to send an email and we will reset your password and get you right into that platform.
Thank you, Celia, and that's great news. I'm wondering, so it's called Talent LMS, is that what you said?
Talent LMS, yes.
And so is that like one portal where all the materials are found in that?
Correct. It's a learning management system.
Okay.
And I actually, reviewing the system, I have yourself, Chair Stebbins, Commissioner Camargo, and Commissioner Concepcion. You have all been enrolled into that since I've been into this program. And so if you also wanted to take an opportunity, if you need your password reset, I'd be more than happy to do so. But you can also, you have access to the system to see what the participants also view.
Okay.
Keep
So
going.
you read my mind. Thank you. So if you don't mind, if you could reset, speak for myself, I would like to noodle around in that platform. And
No problem.
okay, awesome. So if folks reach out to me then and say, I got accepted, but I don't know how to access it, just refer them to your team?
Yes, please, definitely.
Okay.
And we also, my team is also, we take phone calls, we do emails, that my mindset is when someone emails me, if it's a question that's too intricate, like we have their information in Mass CIP, we will give them a call as well. We'll ask them what is the best time to like reach out to them, and we provide that support. So not only will we get them enrolled, sometimes they need help, you know, getting around. I think that it's a very easy system to manage, but picking your courses, how you go through the coursework, if you have a problem going through the coursework, we give that support as well. So please direct them to us.
Great, thank you.
No problem. Was there any more questions on this slide?
No, I think you can continue.
Awesome. Next slide, please. This is a demographic breakdown of participants by race and ethnicity within our cohort. This represents all cohorts 1 through 4. As you see, we do have a diverse backgrounds from everyone, but the goal of the program is to make sure that we are hitting those communities and those peoples that have been most disproportionately harmed. So the approval within our program, as you see, we have 52% Black or African American descent. We have 29% white or Caucasian, and we have 20% Hispanic, Latino, Latinx, or Spanish have been identified. And then the percentages for all the other ethnicities are listed on the slide deck as well. This is to also make sure that we are fostering that commitment to make sure that we are also accessing those peoples that have been most disproportionately harmed. It is communities and peoples that this affected the most, and families. And so making sure that we are paying back and moving forward those communities for something that is now regulated, not illegal, repairing those harms is very important. So I'm very proud of this demographic slide. Were there any questions here?
I have a quick question.
Yeah.
Thanks for sharing this. At some point, I'd love to see the geographic distribution of everybody that's participating in the program. Oh, I'm jumping the gun.
I got something for you.
All right, never mind. I tried to steal.
Don't you worry about
It's
it.
not intentional. I'm not trying to steal your thunder.
It's
Go ahead,
okay.
Celia.
Was there anything else for this slide?
Yeah, I do have a comment, but I'll wait till after the next slide.
Okay.
Thank you. Next slide, please. This slide, I wish I could have gotten this a little bit bigger, but the way that the graphics are, this is the best that I could do. But the concentration of population of approved participants in the distribution of across our Commonwealth is listed here. We have a diverse approved population within, and I'm bad with geographical locations, so apologies if I get this wrong. I'm very directionally challenged, but we have regional diversity within Greater Boston, Western Mass, and South Shore areas within our Commonwealth. We are spread out, but we do see where the concentration is. Were there any questions on this slide? Chair Stebbins, did this adequately answer your question, or was there some more information that you would like?
No, this was the slide I was looking for. Margo, you have a question?
I just have a more comment, Celia, not really for you, but kind of just for us commissioners. I think every probably chairperson that has been at the commission has dealt with a question from our legislators, particularly from the Black and Latino caucus, as to how many African-American, Latino folks own licenses in Massachusetts, how many are participating. And, we hear it constantly. Rep. Holmes will, anytime he gets a chance to see any of us, I think he asks any of us that. And, when I look at this, and again, this is more for commissioners, but, there's a lot in our program when it comes to social equity and what it was in the beginning, what it is now, the future of it, and I know that we're going to get through this presentation, but when I look at this and I think about the breakdown of SCP, and then I think about it ethnically, and then I think about it in terms of disproportionately impacted folks, it doesn't match, right? It just, the license numbers don't match. And a lot of things that I hear, and Commissioner Roy, I'm glad that you shared that people have called you from this cohort, because it also shows that people are joining the program not just to get a license, but to learn the training of it. Because I think there was some like, I don't want to say this, but you know, I don't know what we sold people in the beginning, you know, in terms of dreams and hopes with the social equity program. And for me, I've known it to be, in the beginning, I was like, well, how come we don't have more, you know, folks that are owning licenses, and how come we don't have more cultivators that are SEP? And now we have the trust fund. You know, I've been here 4 years now, but, you know, so I say this to say that, I mean, and I've said this before, and I know that people don't like this, but, you know, I was like, you know, when are we putting a pause to licenses, right? And allowing equity to breathe, and some of these folks to, you know, somewhat catch up. But the other part of it is that we need to make a concentrated, intentional, and strategic effort to look at our social equity program, right? And not just a program, but you know, what is this really like? What do all those dots mean? Does that just mean that I applied and I live there? Or am I actively trying to be a registered agent? Am I actively trying to run an ancillary business? Because I think that a lot of folks think that this is, oh, you're gonna join, you're gonna get a discount, and you're gonna end up being a licensed owner. And I think what we're seeing is that folks are trying to get the training to do different things. So I just hope for us that we, you know, and this stuff takes time, but that next year we can think about our economic empowerment. I've said this before, they're called economic empowerment participants. They're way past participants. That's almost disrespectful to call them participants. They're licensee owners, you know, and our social equity program itself in terms of the life shelf of it and what does it mean. And I know that, Talia, I think you're going to get into this, but what does it mean forecasting? Because when I look at the license numbers and I look at these numbers, and then I think about, okay, so I could probably, I'm a little rusty right now, but I know throughout the state, the Black and Latino owners, you know, at least 51%. And again, it doesn't match with, you know, some of these numbers. So, and I know it's been a struggle. I know this is not an easy thing, but I really think that we need to, as a commission, look at, you know, license types, numbers, thinking a little bit creative, a little bit radical. People may get upset, but you know, I've said this before, like I feel like we need a pause at some point, but I'm saying that to us again, and we got to think about it. We just got through chapter 180 and we just got through the regs that we did recently. We're going to see a lot of these equity applicants pop up during social consumption, because Commissioner Stebbins and I have spoken to so many folks who signed up for the program, you know, 5-6 years ago, because they've been waiting for social consumption. So again, I think we just need to have a very concentrated effort when it comes to, you know, these numbers, our licenses, the program, and everything else that we call sort of equity next year as a priority. So I think Commissioner Concepcion had her hand up.
Thank you. Commissioner Concepcion, go ahead.
Thank you, Chair, and thank you, Commissioner Camargo. I was writing notes as Director Williams was presenting. I didn't want to get ahead of the presentation, but you just struck on a few things that I did have in mind in terms of questions. And I think because there's lack of clarity, at least externally, about how we measure success in the social equity program. And understanding that it goes beyond ownership. So there's ownership, there's employment, there's the ancillary services. So I hope, and if we don't have that in this presentation, maybe we can revisit it, just having a standard in terms of the way that we're measuring success, and what the numbers reflect in terms of all those different avenues. Because when we do have those conversations externally, when we're talking to, you know, the legislature, I think that it's easier to when you think of SEP and the success, you go straight to ownership. But there are other ways to really identify and understand, of the people who've gone through the program, are they active in the industry? And if so, where are they active?
Yeah. And can I just, if I can, say something to Commissioner Concepcion?
Yep.
Commissioner Concepcion, hi. It's good to see you. It's good to have you back. But yeah, I mean, again, talking to us commissioners, I love how you just said it, Commissioner Concepcion. There is a lack of clarity externally in terms of what this is. And I think, Salia, you said this in the beginning of your presentation in terms of sort of refocusing us on what this program is and what it's not. And I think that all of us have to do a better job externally of figuring that out because we get the calls all the time, and especially, there's so much misinformation right now. So Commissioner Concepcion, thank you for putting that so clearly. But again, I think that's part of 2025 goals for us to really understand that. And whether it's a internal public education campaign, which it sounds like this is Salia, the work that you're doing today is almost a public awareness and educational campaign for folks to really understand this, but also, we need money. We need money. We need funding to be able to move this program forward and to build it out and, to give folks the training and the technical assistance, well, kind of same thing, but, to be able to do this and not, again, Commissioner Concepcion, to your point, it's more than ownership at this point. It's hard. People can't even get into this business. So I'm gonna stop now because I'm a little amped. And then we won't leave here today. So thank you. Thank you.
I appreciate Commissioner Concepcion and Commissioner Camargo. I appreciate, that I think it was feedback, questions. It definitely gave me some notes. It's great to be able to actually, talk to everyone in this forum. I totally agree. It's like how, as you see that the program has evolved in my journey, luckily I've been here with my journey as I came into the department and where we are today. And it was really rebuilding it, right? Rebuilding it, relaunching it, getting it out into the public, getting my team out into the public to reaffirm that faith in us, that this is what we were going to do. We had a little bit of a pause, right? Transition happens, change happens, people come and go. That is not something that is new, not something that change management is something that I'm familiar with, both in this sector and the private sector. But it's how you move forward through that, right? And so we've picked it up, we've dusted it off, we've evolved it. And what does that success look like? Everyone's success is different, but working on identifying how I can measure that is something that you will see that I'm trying to do later on in the process. Like that, to your point, that does take funding, but I am dedicated to what I'm doing. My team is dedicated to what we're doing, and we are going to work within the means that we're given, but we're not going to stop the work. And so I've taken notes to be able to see, like, how can I do that? What does a pause look like? Is that evolution through some of the curriculum? We want to set some standards. You'll see that later on in the conversation. But I wholeheartedly agree with both of the comments and or suggestions that I've taken away from your feedback.
Okay, keep going, Salia.
Chair, I can move on? Okay, thank you. Next slide, please. So we're going to get into technical assistance and training. A lot of the things that we have kind of breadcrumb to get here. So our social equity program, we know that it consists of technical assistance and training. It's a resource that I'm super, super proud of. And I think to the point of Commissioner Camargo earlier, is something that was previously underutilized. I do see a lot more people in, especially when you guys have public meeting, Commissioner Roy, when you mention it, Commissioner Stebbins, when you are in the community or you're in your events and you mention it, I'm getting those emails of like, oh, you know what? I think I lost my password. And so they're getting in and getting interested. So I thank you for always advocating for the technical assistance and training program, because I think it, outside of the benefits that we will get into that are offered under the social equity program when you are approved, technical assistance and training is a diamond. Next slide, please. Under the social equity program, technical assistance and training program. Oh, I can't even talk today. We have 4 tracks. We kind of breadcrumbed this earlier. We have the entrepreneur track, which is the infamous track where people are looking for licensure or ownership. Someone is coming into the program and they're like, I want to be an owner. Well, that's what their aspiration is. And the reason why I say that at that point is because some people move through the curriculum and then they identify that, you know what, this just might not be for me. And that's okay. It's not like, and I guide people to understand, like, I'm very transparent and I'm very, like, to be in a mindset of reality. It's expensive, it's hard, you have to network, you have to really dedicate a lot of this, a lot of what you have going on into this. And outside of the people that come into the program and that are well versed, and this just goes into the demographic conversation that we were having earlier, is that I also have people that have families, that have jobs and going to school, and they're also trying to do this programming and find their place. And so when we're talking about measuring success, you have to understand that people are also still living life, right? And dealing with life is lifing. And so that's a process too. And so to get to that point in entrepreneurship, you gotta kind of like fit that in your life. And how does that work? And I am proud to say that when I'm in the community, I've worked with different people that I've been able to see through this journey. And you know, Denisha Cohen, I think she may be on our agenda today. I'm super proud because when I first met her in one of our community outreach programs, she was just trying to figure out how to get licensed. And through this programming and through, like, I didn't have a lot to offer her outside of the resources and the connections that I have, but I'm super proud to see that I believe that she's on the agenda today. And that is the pathway. It took time, and she has different things going on and was able to move through it. So we want to meet everyone where they're at. Whether your interest is product manufacturing, delivery, retail, cultivation, we have track-specific work that will allow you to understand what that is, how you'll be able to move through it in a regulated industry, and let you brainstorm with some of the vendors that we have about how you can evolve that business for you. We have our core track, which is people, as I said earlier, looking for that executive track, for that leadership track. Those are your HR professionals. Those are your accountants. Those are your attorneys, your lawyers. Those are your diversity, equity, and inclusion officers. That is a transferable skill from whatever sector you in. We need that in the cannabis industry to support our businesses. So we provide educational technical assistance for that. We have entry and re-entry. These are for our citizens that are re-entering the workforce. These are for people who are looking for, individuals who are looking for, entry-level positions. And there's nothing wrong with starting somewhere, being great at that and moving up. And so when we get into our curriculum, you will see that I have infused, how do I start at like a bud tender, but where is my path forward, right? And so that has how that curriculum has evolved. So I'm very proud of that track. This is our next, last but not least, ancillary track. And I think that there's I've been putting a lot of focus into this. Thank you, Commissioner Camargo. Thank you, Chair Stebbins, for really collaborating with me on how we can evolve this. So I'm excited to get into that. I know that we are normally used to it being called ancillary track. I'm also trying to make sure that I'm meeting people where they're at and they understand what that means. That's an integrated business solution. And so as you see our materials get rolled out, as you are exploring Talent LMS, you will be seeing it referred to as Integrated Business Solutions Support Pathway. Ancillary businesses, these are your cleaners, these are the people who support your trash, this is your DJs, these are your event planners, these are hiring services, HVAC. I know that you'll probably get into what are those air filtration systems? Like, who does that for you once you start getting into social consumption conversations? These are your integrated business solutions. These are the people that help your business going. And so I'm excited to be able to support, this pathway as well. Were there any questions on this slide? Next slide, please.
Keep going.
I'm sorry. Next slide, please. So as I was saying earlier, we have customized curriculum tracks tailored to the interest and career goals of people within the regulated industry, making sure that they have a personalized experience depending on what it is that they would like to explore. Through our expansion in evolving our curriculum, I think this would touch upon a little bit of what we said earlier. Where are we measuring? A lot of conversations and getting into the community. I understand. I have come to an understanding that some people are like, I want to get into business, but like, where do I start? Do I need a business plan? And some of these things are fundamental. I do have people who come into Talent LMS, and the way that it was built out previously is that you can just kind of like cherry pick and pick around. So this launching of our new cohort of of our new technical assistance training program, we have required learning tracks. And so when you log into Talent LMS now, you will have to take those foundational courses that you need to be able to get to your specific track focus. Your essential learning pathway is just that core industry knowledge that you need to know. It's the introduction to the cannabis plan. It's business plan creation. It's navigating the municipal process, post-community agreement fundamentals, financial empowerment, and predatory lending. These are some of the courses that you will find in your essential pathway. It's that packet of information that you need to start moving to the next business. Once you complete your required foundational knowledge, Talent LMS will then move you to your next pathway, which is your business expansion pathway. Under that education, you will see raising capital in our cannabis industry, accounting and taxes, impactful cannabis, which would go over positive impact plans. We have branding, marketing, sustainable operations, agent recruitment, training, and workforce diversity. Those are what you will see in your business expansion pathway. Once you get through these sets of core curriculum, then you will be able to move through your desired curriculum interest track. Well, that would be track focused work. And so that is a new updated program design. I want to make sure that like people are going through the program and you have the correct path. I have people that just jump into the track specific work, but you're missing those essential keys and those essential points that you need to be there. So I'm very proud to be able to move through the required work and designing a certificate that will say that you completed, your essential pathway, your business development pathway, and then you'll be able to go and move on to your other curriculum. So I'm excited for that pathway and see how impactful that will be as people are learning. Were there any questions on this slide?
Commissioner Concepcion.
Thank you. Director Williams, I just wanted to circle back to that last statement. In terms of you identifying if someone who's been accepted and it's on a particular path and you see that they need to actually go into a different direction. I just want to understand, so if someone goes in and let's say they're under the entry level track, but you then determine that they should be under, the entrepreneur business ownership track, that's able to happen. So you can transition to a different track. Okay.
Yeah. Because the idea is no matter what track that you pick, you need these fundamentals to understand. Like even if, let's just say, right, you're on the ancillary track, you're an integrated business solution. I have worked with people that have just started their business, right? And so how do you engage with a cannabis licensee? If you come to me and you want to be my integrated business solution, I do want to see your business plan. I do want to see what your goals are. I do want to see how you can support the industry. So and you also need to know, what's happening in the municipality. So doing the required path work is beneficial to everyone. But once you get through that, you can choose your path and you can change it. And so the part that is required is just that core curriculum that you need to know. It extends beyond the cannabis industry, but it is for our regulated industry, right? And then if you want to move around or if you want to explore and learn all of them, you are free to do so.
Okay. Thank you.
You're welcome. Chairman, move to the next slide. And this is just this slide.
Celia?
Yes.
Celia?
Can you hear me? I'm sorry.
No, we can hear you just fine.
Okay.
I'm gonna ask that we just take a quick 5-minute break. Is that all right? We'll come back and pick up on this line. We'll recess for 10 minutes. We'll come back at noon just to give everybody a chance to take a break, but thanks. We'll pick up on the the slide. I think that's in front of us.
Yes.
When we come back at 12 o'clock. Thanks, Leah. Appreciate it.
Thank you. No problem. Thank you.
Thank you.
Did I do something? Okay, how do I?
Make sure Celia is still with us. There she is. Thanks, Celia, for letting us take a quick break. Go ahead and continue.
Thank you very much. And I apologize. This is my annual update, so I do apologize that it's a
Don't apologize.
It's a lengthy update.
Don't apologize.
Don't know what slide number it is, but this slide is it's advanced too far.
You want to pick up on this slide? You see the one in front of you, it's titled Technical Assistance and Training Update?
Now it should say, I would like to pick up at the slide that says updated program design continued. So
Here we go.
yeah, right there.
There you go.
So we touched a little bit on this. I'm going to try to be respectful. I know you, again, you have a full agenda. And so we touched a little bit upon this, the different pathways that we have. The leadership and executive pathway, that is our core track. Pathways to employment, that's our re-entry and entry track. Again, tailored to supporting those entry-level positions for people looking to get into the industry, but also supporting what that growth is within those employment opportunities. And then we have our integrated business solutions support pathway, also known as our ancillary track, and that's empowering our entrepreneurs that aren't licensed facing, but they do support our licensees and our cannabis establishments. So fostering innovation and creating opportunities within our cannabis space for these businesses. Next slide, please. So we had talked about this a little bit earlier when we were differentiating, what our program is and what our resources are and how we support our communities. Individuals who apply for the social equity program have benefits that come along with the technical assistance and training. We have our benefit. I think that Commissioner Camargo had mentioned earlier, discounts and such. And I think that a lot of people focus on those things. As you are approved into our program, your benefits start immediately. You have access to free technical assistance and training courses right now. To piggybacking on Commissioner Roy's comment earlier, there are 48 courses that are available within the Talent LMS training system that have been taught. That would be our core curriculum and our advanced curriculum that supports our licensees that are already operational and how we support those businesses and give them resources. So that's all found in our Talent LMS platform. In addition to that benefit, we have expedited licensing application review. We have waived license application fees. This excludes the cost for background checks, but we have the waived licensing application fee. We have waived metric monthly program fees. Again, this has some exclusions to it. We have a 50% reduction for annual renewal of fees. There is currently a 3-year exclusive access to the social consumption license type, as well as the delivery license type. With regards to the delivery license type exclusivity period, we'll be talking about that later on in our presentation. We have the application pre-certification, as well as exploring the opportunity for enhancing the social equity benefits. That is a bullet point that I put in this slide deck because I do want to ask for a conversation. And I'm not really sure. I apologize if I'm not doing this correctly. But Chair Stebbins, I wanted to ask if you can engage with our commissioners about maybe exploring a working group that I would be able to participate in with maybe the commissioners who are interested, exploring how do I enhance these benefits. The reason why I'm asking this is because as I'm in the community, as my team is answering emails, as I am engaging with our commissioners and yourself, Chair, I hear people saying, well, we're not doing enough. I've evolved the curriculum and I don't have a bag of money, as everyone knows. I don't have all of this real estate to give anyone. I have to work within the confines that I have, and that is the benefits that are under this program. And so I want to explore what it would look like if I waived licensing application fees until you commenced operations, and possibly what a tiered like licensing, waiver would look like. That would give me the ability to alleviate some financial stresses that I do hear that people have along the journey. People are trying to establish their businesses, but still, as they're trying to get across these barriers, they're not saying that we are creating one, but then they have to worry about, oh, I'm still in this process of trying to get myself together, but I also have to renew so I can keep moving. Can I alleviate that by evolving our benefits? And so I respectfully would ask if this is something that the commissioners would take up or allow me to take up as a working group to just explore expansion of what these benefits would look like. And so that's what that bullet point is. Was there any questions about our benefits in my request?
No questions. Keep going, Celia.
Thank you. All right, next slide, we're getting into our technical assistance and training update. So this has been a big conversation. When is our new technical assistance and training update training program going to be starting? I think I want to do a flashback to our previous public meeting when we were going over what our funding was looking like, and some of the constraints that we are having. And so that does affect me. That does affect the programming that I'm able to execute and provide to our population. When we're talking about what the social equity program is, I support approved social equity participants. I support economic empowerment applicants. I support or am going to be supporting social equity businesses, minority businesses, women businesses. I support all of these different people, and that's what that funding does. It allows me to evolve the curriculum and give the resources and the support and the outreach and get into the community and see what people need and how I can meet them where they're at. So in a previous public meeting, it was noted that I was unfunded. Through working with our acting executive director, Debbie Hilton Creek, and our finance team, Lisa Schleibel and Mark McDivitt. Apologies if I said anyone's name wrong. We were able to have conversation, and they identified that I do have a budget. So it is not in a large budget by any means. So what I am going to do this year is I'm doing a cross fiscal year technical assistance and training build out. With the idea that I am building out the new curriculum that we have been talking about now with our vendors that have been awarded. And then I will be launching our training thereafter. So orientation is slated for July and August of 2025. And then live instruction and technical assistance is slated to start on September 8th through July 18th. The way that the curriculum is going to, people who have been in our courses and our classes, I want to let you know, if you're listening, I hear you. I've evolved the programming. So the way that this is allowing me to give better resources, we can teach a class, we can do lectures and discussions, and then thereafter we're going to have a follow-up class where people are able to come with their questions after they do their assignments. Where were the hurdles? What did you do? How did you have any questions as you built your business plan? And so we're being able to teach and support people through this next model. Although I was a little bit down not being able to do it sooner because of the financial constraints that we currently have, but I'm excited because it allows me to work with the vendors and build a very comprehensive educational platform and resources and live training. I am also hearing people. I want to make this hybrid, so I'm looking at what that hybrid is. It's meeting everyone where they're at. Some people learn very well in a virtual environment. Some people need to actually have these conversations in public. And so now that we are in a different space within the world, I think that we can do a hybrid model where I can meet everyone in the middle. So I'm also building out what that looks like as well. And you, in curriculum announcements, you'll be able to see, what that is and how you can attend.
Chair Stebbins, sorry, Director Williams.
Go ahead, Commissioner.
No worries.
I wanted to, we overlooked your request. Director Williams.
Oh, okay.
So
I
I
didn't
know
know how
where
that
that was
worked.
the
I'm sorry.
previous side, but I know you just had a request of the commission. I want to just get some additional context and allow you to expand on that because I don't think that we've answered the request that you had.
Thank you.
Okay. I mean, you're welcome. But so
Okay.
you are requesting for a working group and just kind of explain that over again.
So I'm looking for, apologies, can we move to the previous slide? Just so the benefits could be up. Great, thank you very much. So my request to the chair and the commissioners is to start a working group. I think that a lot of conversations about working groups start here. So respectfully, I just wanted to make sure that I asked, our commissioners and chair if I could start one. I want to explore how we can expand the benefits. These benefits were created by the previous colleagues that were in that were running the equity program and community outreach department, and we developed these. And these can, as I'm evolving the curriculum, I can also evolve these benefits. And what does that look like? I want to do that strategically and thoughtfully. I know that I have had this conversation with a variety of people across our agency as well as commissioners, and I understand that some of these reductions, they are coming out of the commission budget. What does that look like? How is that conversation going to evolve and analyze that? I also know that some of this stuff may hit the marijuana regulation fund, if I'm saying that correctly. And so these are monies that aren't going in there, but there's a lot of money in there. We're talking about a population that I'm serving that I personally do not feel that that's going to put a dent in the revenue that we generate. And so how can I better help and assist the population in moving forward through the benefits that I have? And I wanted to engage in conversation with everyone strategically and thoughtfully about how this evolves.
So it's sort of an assessment of the needs of this population.
And then, right.
Okay. And then is this something that you picture as being a staff-led? I know there are staff-led working groups. What is the role that you're asking of commissioners?
I want to make sure that I bring something to the table about that makes sense, right? I know that learning through the processes and working with our chair and our commissioners, this is how this process evolves. Initially, when I was thinking before making this request, I was just going to put forth, what my recommendation is and just say this is how the benefits are going to evolve. But that's not thoughtful. There's both sides that I need to think about. And working with the commissioners and staff, I could be the project lead. I don't have any preference if you guys think of it being different, but I want to make sure that I'm thinking about all the things as I evolve these benefits, and get your perspective on where you think that this would be most beneficial. I'm thinking about helping, our constituents, our participants. I'm thinking about being impactful throughout the Commonwealth. And it's also touching on that point that Commissioner Camargo made earlier about, and as well as yourself, about what is our benchmarks, how are we measuring success? This is a way that I can push success forward, but I want to work with you to make sure that I'm evolving this in a correct way. I don't want to be detrimental on any side. I want to be empowering and impactful throughout the process.
Thank you, Director Williams.
Commissioner Roy.
Chair Stebbins.
Go ahead.
No, I guess my follow-up, and I can hold off until Commissioner Roy offers her comments as well, but I wanted to hear some of your thinking in terms of, what this should look like and the resources, so on and so forth. But I'll pause there and, hear
Okay.
Commissioner Roy.
All right, we'll come back to you. Commissioner Roy, go ahead.
Chair Stebbins. Director Williams, so thank you for explaining the request. And I'm also wondering if, while doing that, simultaneously, as part of that process, we should take a holistic view at the social equity program. And what I mean by that is the parameters. So folks in the past have told me, well, I grew up in a DIA, but I moved out and I experienced the harms growing up, but I was able to move out, and that excludes me for the program. So maybe we look at that. other folks have said it wasn't a parent or a spouse, but it was a sibling. You know, maybe we need to look at the family criteria and expanding the number of DIAs as well. And to Commissioner Camargo's point of pressing the pause button, you know, we really need to look at, we have people stuck in the queue. They're stuck. We have a gentleman here today who I'm so happy for, who is in the final license, but it was a journey. And sir, if you don't mind me asking, how many years have you been on this journey? So since 2019, and here we are. So, you know, 5 years in a journey, and, you know, you were able to get to the next level today, and congratulations to you. But there are folks that haven't been able to do that. And I think we need to really double down on our efforts to figure out how we impact those folks who are stuck, for lack of a better term. So I think that should be also part of our holistic deep dive on the benefits as well.
Commissioner Camargo.
Yeah, I think to my comments earlier, I think that, you know, Celia, I hear your request, and your request might be a bigger request than what you're asking. And I think that that's sort of my comment that I said earlier, where it's like, we need to look at this program, not the program, but we need to look at, you know, equity overall, and particularly, you know, SCP licenses, economic empowerment licenses. You know, Rob Kelly, he's sitting in the audience. He's from Springfield. His company's Black owned, all minority owned. You know, I think you got approved on 2021 for a host community agreement in Springfield. You're from Springfield, right? You're SCP cohort 1. You're here today. I don't know what your financial, you know, journey has been, but you know, I think to Commissioner Roy's point, it's a bigger ask. And again, I don't know if we, you know, take a pause on the request. My answer is yes, right, on the request. But I think that you do need to develop the working group that will then work with commissioners to look at this, you know, at a higher level for 2025 as a major priority. You know, we've had a lot on our plate, but I think it's time. I would love to just pause anything non-equity license, pause it, right? And allow equity licenses to move forward. That would be my recommendation, right? But you know, I think we need to look at this overall and make it a commission priority now going into 2025, having a new executive director, you know, all that other good stuff. So, but you know, those are my comments as it relates to that piece. But this is really good, Celia. I know you were apologizing earlier for being a little lengthy, but we haven't been able to have this conversation because, you know, you've been in the position, you know, building the department, getting everybody on board, understanding it for the last 2-3 years. So it's good to see this work coming out of it. And, you know, I know that there's people in the industry that want to participate with us. You know, I just got a message during the break. Hey, we're out here. How are we helpful? You know, can we mentor folks? Can we, you know, so it's a lot, but I think that this needs to be a commission priority 2025.
Yeah. Thanks, Commissioner Camargo. Commissioner Concepcion, I wanted to kick it back to you.
Thank you, Chair. My question was just about your thoughts. I mean, in terms of the request and the formulation of a working group.
Right.
Yeah, and thank you for bringing us back to that. And happy to offer my thoughts, and certainly taking into consideration your comments, Commissioner Concepcion, and my colleagues here in the room. I had actually been thinking about, after this quarterly listening session on medical, doing the next session, which I would lead on social equity and our equity programming. I certainly encourage you, Celia, to begin to build out a working group charter. You can have 2 commissioners, whoever you want to approach, no more than 2, because we don't want to violate the open meeting law.
Yes.
And, you know, and I think, to the comments in the room, thinking about it a little broader than just, you know, the incentive question or the program question that you had. I think you've heard some some interesting comments from my colleagues in terms of a more thorough review or a more holistic review and assessment of equity and where in the programming that you're doing. I would encourage you, as you're thinking about a working group charter, certainly to include our CFAO. You know, this is a budget issue, as I would look at it that way. And obviously, you know, not to volunteer anybody on our team, but certainly, you know, our government affairs and policy folks who are connecting with our local public officials and our state legislative colleagues. If you were looking for the green light, the light just changed. You have the green light. Don't drive too fast, but you know, certainly appreciate that request. Commissioner Roy.
Yeah, I just had an observation and thank you for supplying us with the curriculum overview. And there's a lot on there. And, you know, I just see an opportunity if we revisit this list, how we leverage and maximize our partnership with the Executive Office of Economic Development and the Social Equity Trust Fund. And I'm looking particularly at the Business Development Expansion Pathway, which is a required curriculum pathway. And, you know, obviously capital is the biggest barrier. We hear it time and time again, and I see you have raising capital in the cannabis industry. So I'm wondering if there's a way someone from, you know, the Executive Office of Economic Development could teach a class about the trust fund, or we can provide technical assistance on how to apply for these grants and these no interest loans. Because, you know, the first round were immediate needs grants, but now with getting 15% of the marijuana regulation fund, these grants are substantial. These are game changing. Some of them are $500,000 grants. So how do we weave that new opportunity in and teach folks who might not know how to apply for a grant or a loan to help them?
Right. You're reading my mind, Commissioner.
Oh,
good. Thank you
Yeah,
very much.
good.
I think that you hit on a lot of different points. First and foremost, thank you very much to Commissioner Concepcion for reeling it back. I didn't really know the appropriate way to ask for a working group, so I'm so excited to have the green light. I think and I do agree with everyone's comment about, you know, how do we look at it at a holistic view, and how do we widen that lens on how we, you know, look at these benefits, our eligibility. Our eligibility is strategically the way that it is because of the community that we are trying to impact. I know that just revisiting that comment, there's other work that hasn't been done because we haven't gotten funded. We had a previous public meeting conversation where it was from my recollection, please someone correct me if I'm wrong, where we were going to be able to engage with a research facility to really relook at what those DEIAs look like, and if expanding them or keeping them where they're at or decreasing them wherever that may land, because I don't know what that looked like. But that also takes funding to be able to do that research into those communities. Also keeping in mind that those communities do not look the same as they did when they were being disproportionately harmed, and we need to take that into consideration. And so I'm happy to explore that, but I do know that work lies in a different realm. And it is larger than what's happening in this group, but I think that it is an important conversation for us to pick up, especially when we get funding to do that work. Because this board did allow for that to go through in our previous working group, which was Access and Equity, when they did that work and was presented along with our chief of research at that time. And so I know that work is pending, so I'm excited to see how that evolves. When we're talking about working with EOED, I'm excited to do that. I do know that their application period is evolving, but I also, in this conversation, which is good because I have a lot of people listening, is that making sure that people understand that there's a differentiation. So I did do a community outreach event engagement. Commissioner Stebbins, thank you so much for attending. And that was to support applicants. I know that their period that they opened was about 3 weeks. And so my team and I, alongside with communicating with EOED, along with my traditional and digital communications team, Director Mary Alice Curley and Director Anne-Marie Burt, we put together communications to let people know that we're going to be in the community and we are going to use this application and guidelines that EOED has put forth and help you figure out where you fit and answer the questions to the best of our ability. EOED did provide me with an FAQ list to help me facilitate that community event. But I think as I was in the community and as I stand in our public meeting today, EOED and their processes and how they run that fund, how they administer that fund, how they disperse those funds, that is the responsibility of that executive agency. So I just want to make that clear, right? Because I get a lot of questions. There's a lot of information written about, how are we pushing the success of that fund? And I'm here to support and educate people in any way about how that fund is, when they're going to be opening that application period. Is it quarterly? Is it annually? I don't have that information yet, but as soon as I do, I will make sure that I'm blasted. One, make sure that you guys are aware of that information and make sure that I get it into the community and support their efforts in any way that I can. And so I was talking with our vendors earlier this week. I welcome that curriculum and that education here as they build out what their program is and how they're going to be administering it. I will definitely support it in our curriculum. So thank you for that.
Thank you.
Thank you. Thank you, Celia.
You're welcome.
Celia, I will just flag for you, and obviously you'll hear more about it in the coming months when we roll out our social consumption regulatory framework, but we're going to put you on the hook for some input with respect to that process and program, since it will impact our SEP and EE participants.
Awesome. I can't wait to do that work.
All right. Okay.
Next slide, please.
Keep going. Oh,
I think
Commissioner Roy has a question.
I'm so sorry,
On this,
Commissioner Roy.
on this slide, I do have a question. Thank you, Chair. Director Williams, just on the last bullet, the key dates. How are we communicating these dates to the 229 folks in cohort 4?
And so when the communication goes out, it goes out to all cohort participants. So that goes to my earlier point that the technical citizen training and orientation that I give, it is to all approved social equity participants. So 1,101 participants will be getting email notifications. I'll be working with our traditional and our digital team directors to use all of our social media channels. I will do engagements, we answer emails, any avenue that I have to blast this information, as well as to their personal emails. They will get notification, everyone will get notification of where this is. These are going to be in-person orientations. I'm with the hopes of, one being out into the community and the other one being held in Worcester. Please don't hold me to that because I don't have that information locked down. But when I do, I will utilize our communications team, all of our media channels, and I'll be emailing directly to all approved social equity participants this information.
Thank you.
You're welcome.
Okay.
Next slide, please. On this slide, we'll see I just wanted to give you an update that we did complete our RFR process in the beginning. It closed. I want to believe I didn't put the close date here, but our RFR process was open for a while for a variety of different reasons. But when that process closed and I, came back present to work, we really got into contracting and going through all of those vendors. So we have awarded 4 vendors. I apologize. We have Greenlight Business Solutions. We have worked with in the past. We have Cami Flower LLC, the law offices of Sean Coleman PC, and Signal Hill Group. The reason why it is very important in the past, and hats off to Greenlight, my previous technical citizen training program was taught by one vendor, which did a great job. But what I did get is feedback from that we want, versatility within the schedule. Is there any way for hybrid options? I didn't really learn well, in the what do you call this? The virtual model. And so I want to be able to meet that. I also know that I have people in our programming that have different perspectives, different learning styles, working with different people, having, you know, a legal, a lawyer, an attorney, that's probably the correct word. An attorney as an awarded vendor comes with a different lens when we're talking about contracting, post-community agreements, predatory lending. So I am giving the availability to people to learn in different ways and from different people with a flexible schedule. Afternoon, I'm looking to do building up a schedule for holding some courses on the weekend, making sure that people can get to our classes and get this information and engage with our vendors and get the biggest bang for my buck. Any questions on that information before I get into the big one?
I don't
So
see
what I do envision, I'll do them really quickly. I think I've said this throughout. It's always about evolving and making sure that we have better resources for our approved participants. So I'm looking to explore in my 3 to 5 year strategic plan, what does e-modules look like? You log in, you can do this training while you're on the job. What does e-modules and continuing education look like for RBT? I've had those conversations. That is not something that is housed in my department, but would love to work with who's running that RBT training here and just seeing how we can improve that and make that more effective. And certificated learning opportunities. I hear a lot of feedback from individuals and my commissioners and chair about how can people put this on their resume. And so I think that expanding those educational offerings is amazing. I do want to make sure that I caveat that I can't do that without money. Building e-modules, creating a certificated learning program and courses and following an academia year, I need resources to be able to implement that here and to build it and to execute it and keep it moving forward. But I do want to let my commissioners, chair, and constituents know that that is something that is on the forefront of my mind about how I bring that service to you.
So Leah, just thank you for your thoughts on that last point. I couldn't agree with you more. I have sat through 2 RBT presentations. And my comments have nothing to do with the great trainers that we select to do this type of training. But the training has become, if I can use the term, a little bit stale. And I truly buy into this notion of the RBT should be more along the lines of workforce and professional development. How can we continue to help build out the expertise in the learning opportunities for folks both in the equity program as well as licensed agents across the state. So I know you and I have had a conversation on this, but I think there's a tremendous opportunity that, again, maybe Massachusetts can kind of lead and set the bar where it comes to continual learning opportunities and training opportunities for folks that are in the industry. So thank you for bringing that point up.
No problem. Thank you. I also look forward. There's so many things that I want to tackle, and you guys definitely know how I am. But that is something that I'm thinking, and I've taken back from the feedback, so I appreciate it. Yeah. Next slide, please. So we're going to get into our equity program and community outreach annual activities update. You guys you have participated with my community outreach. I think that a lot of constituents have seen me and my team out into the community. So I'm excited to talk about this. At the top of my slide is the Faces of Equity campaign. I'm very proud of that campaign and all of the stakeholders that helped me launch that Faces of Equity campaign. I think I wanted to just take a moment and remind people of what that was. The video the docu-series that we had put out, and I'd like to name it that way. I would have made that video an hour if I could have, but we captured what we could in a 10-minute docu-series, and that basically reminded people. I wanted to launch the application period, reminding people why we are here, where we started, and highlighting those participants that have gone through the program and what stages are they at. When you look at that video, you have someone who wants to be a licensee, that was wanted to be a licensee. You have someone who was an ancillary business. You get different perspectives of how it has affected and where we're at and where we want to go. So I'm very proud of that campaign and that video that we put out. We did our application clinics. A lot of our commissioners, I think everyone, and including our AED, participated in our application clinics and supporting people and getting their feedback and helping them through the application. Seeing my staff work and like log people on and register and show them how to walk through the application step by step, it was a beautiful thing. We did our marijuana community outreach initiative. So we, like I had mentioned earlier, we developed a rat card resource. This is one of those things when we're talking about my department does community outreach. I want to make sure that I am representing everything that this agency does in every constituent that we serve. So I know if you have or have not come to one of the tables that I set up, I have information about our program, expungement, employment opportunities. So I have a rat and how to contact us. My initiative with this outreach initiative that we currently have going on, which you can expect, is that every department within the Cannabis Control Commission will have some type of resource card that will either be able to be utilized internally or externally, which represents what our departments do and how you can contact them. So I'm proud to say that the medical outreach card is done. It provides patients, caregivers, and community members with education with regards to the medical use program. So this would be a resource that you could use, that my team would use if we attend, a senior center. It is vital to understand what it is in some simple terms and how you can get the resources you need. So I'm super excited, and I'm pretty sure that as the constituent services team and our chief of staff go into the community, this will be something that they can utilize as well.
Celia, before you go to the next page, because
Yes.
you talk about the Faces of Equity campaign, which was a tremendously moving piece, if I can call it that. The entire campaign. Folks at Emerson University in Boston picked up on the awareness of the campaign and actually had a class for their graduate students that, I know Anne-Marie was here a minute ago, but Anne-Marie shared kind of how the campaign came together for a group of students that are thinking about effective communications and getting out a message. So the whole campaign got noticed far beyond just,
Yes.
our four walls.
Thank you. And to that point I strategically looked at the areas that we serve on our DIA list and what that transit system is. It was beyond the video. If you take the bus, you would see that our campaign and our messaging was in your communities to make sure that you understand that, this is us and we are you, and we're here to support you on whatever your journey may be. And that takes time, and it's the work that you guys do at this table. It's the work that we do in this agency. So I'm so glad that it extended beyond our walls. Next slide, please. So this is just a quick overview of some of the outreach that we've done. So I'm gonna I guess glaze across some of this stuff, but like I was saying earlier, we did a supportive outreach for the the Cannabis Social Equity Trust Fund. Just supporting people about the application period, giving them answers and frequently asked questions with regards to what the eligibility is, what the criteria is, and that was supported from the Executive Office of Economic Development. And so just really enhancing and uplifting and amplifying their message and trying to get this information to as many people as possible. My communications team, Director Burt and Director Curley, also helped me announce this through our social channels so people knew that the application period was open. It did close on October 17th, but I know that they're in their process of reviewing those applications and really excited for when they're going to open their new application period. So I can't wait to support their next initiative. Other engagements that we've attended that I had said at the top of the meeting, we've gone to the Taunton Health Fair and engaged with seniors alongside either Director Kathy Oliver Jones and our Commissioner Roy. We've gone to these events. We've done Boston Cannabis Week. I participated going to different dispensaries, checking them out, getting information, seeing how they operate, seeing what some of their pros and cons and where some of those pain points are. Black Cannabis Week. We hosted a table at NECAN. where people can come and get resources alongside all of the other opportunities that that event hosts. So that's just a glance at some of the things that we're doing in the community, and we do, and engage way more. I try to make sure that my team is engaged and has a pulse on what you guys are doing in the community and supporting and amplifying whatever it is, your initiatives and in your events as well. Next slide. The launch of the premier virtual platform, Chair Stebbins, this will be exciting. I think it's exciting for everyone. If I could just give me one moment, I'm gonna go off camera. I apologize.
No worries.
So the launch of premier virtual platform, this is something that I worked alongside. It was, I want to say that it was Chair Stebbins, baby and little seed that you planted for me. And I'm so glad to be able to tell you how it's going and how it's evolved. I know that in a lot of different meetings, it's like, it's coming, it's coming, it's coming. It's here today. So Premier Virtual, this is going to be our Equity Works Career Hub. We're going to be empowering careers and cultivating equity. When we launch the Career Hub, the goal is to provide networking and career development and community engagement opportunities. This is a platform that will be, once it is launched, we're going to house the platform on our website. I'm still working with our IT team and our director of digital and creative services to just figure out what that looks like, and all of the branding, all of those different things. We will have career booths. What is exciting about this platform for people that do not know, and again, it's bridging those opportunities of employment. It's bridging a networking board for ancillary businesses. I'm going to roll it out in phases. There'll also be a municipal, equity board where you can highlight the areas of opportunities within municipalities. And so it's going to evolve into a great tool. You can hold job fairs. You can do hybrid interviewing. So we can do something like this. You can interview and hire on this website. You can registrants will be able to upload their resumes, create bios. Also, upon registration, identify that you are an approved social equity participant, an economic empowerment applicant, or a social equity business. We will get into that later in the slide in our presentation about the update with regards to social equity businesses. But all of this, the platform will house all of those things. We are building it out. We have got most of the things that we need in the platform to launch it. I will make sure that you guys also have access to it and are able to move around and see in it, so no worries there. The first phase will be a communication that will go out to licensees. I will need to engage with licensees to create their specific hiring booth and then train them on how to be able to utilize this platform. This platform, for any questions that it does have metrics that I can pull out of it. So I'll be able to see which licensees are using it the most. I'll be able to see who's hiring, who's interviewing, who's holding job fairs. And so I'll be able to, once we launch it and really get it moving, and as we manage it, I will be able to come to you and have a follow-up conversation with what those metrics look like. Are there any questions?
Commissioner.
Yes.
I'm curious to get more information on this platform. Is it open to the general public? Are we charging licensees for this? The audience? Yeah.
No, yeah, great questions. So the way that the platform is going to be set up is that it's, as I had mentioned earlier, it's going to be on our website. So the registering and entering the platform will be available for everyone, right? The way that it's going to be built and give priority access to jobs is when you register, you identify whether you're a SEP, EEA, or SEB. Hopefully everyone knows what those acronyms are. My team will verify that, and that will give you priority access to the job fairs that are going, priority emails about when they're being held, dedicated hours to be able to interview. This is a free platform. So licensees will be able to utilize this. They could literally utilize this for a career hub if they're looking for that population that I continually hear that they can't reach and aren't seeking these opportunities. And so it's free for licensees. It's free for registrants. So there's no cost to that. We also provide support. So if you register, oh, I don't know how to put my application, upload my resume or whatever, we're going to provide that support as well. My team has been learning this platform so we can actually support the people and the licensees as they move through the platform.
Go ahead. Keep going.
And thank you for that. And who did we contract with for this?
Premier Virtual.
Oh, that's the name. Oh, okay. That's the name of the company?
So the name of the company is Premier Virtual.
Okay. Okay, I just didn't know if we were just saying it's a
No worries.
virtual platform. I didn't know if that was the title of the company, so thank you.
No worries.
Good question. Go ahead. Continue, Celia.
Thank you. Next slide. So as the space, as I was saying earlier, as the space of the Premier virtual platform, which is going to be known as Equity Works Career Hub. So our Career Hub, as it evolves, we're going to do engagement spaces. Our team will also be in there holding just information booths about what is going on in the community, supporting, like this could be a tool, Commissioner Roy, like you were saying earlier, how do I support EOED? I could actually do this through this application. So I can get into the community, or I can hold a booth, I can blast it out through our various communication channels and say, hey, in the Career Hub, I'm holding this information session about and partnering with EOED. Please, join at this certain time, and we can give those resources through this platform as well. So it is a well-versed platform and can be utilized for different things. So we are exploring that as well. We're going to do live chats, webinars, Q&A. They have downloadable content. So it's really going to bolster the user experience when we're talking about looking for those networking boards. That we consistently hear that people are like, oh, I can't access. How do I network? How do I find these different things? There's going to be a stagnant ancillary board, integrated business solutions board where you can post what your opportunities are, what are the services that you're providing. So it's really going to be a platform that bridges all of those different opportunities. Next slide. So this, I'm gonna glaze over this because I think that we talked about it earlier with Commissioner Roy's question. So there will be exclusive access for our SCPs, EEAs, and our social equity business participants, maximizing their engagement and their potential with these opportunities through our tailored registration process, which I kind of went over earlier. Next slide. Now we are getting into our social equity business update. So I'm super excited about this. I know that this happened through our regulatory process. I know that our participants have been patiently waiting for this, and we have been building it out. So that's what we're going to get into in our next presentation. Next slide. So the social equity business update, as we know, this was promulgated, and we have a working group that is working on this. Social equity businesses are defined as marijuana establishments under Section 1 of Chapter 94G of Massachusetts law. Our commission has established a social equity business verification process to access and confirm eligibility of businesses seeking the designation as a pre-verified or verified social equity business. And so I always like to make sure that I'm meeting people where they're at. So our commissioners and our chair and as well as our agency heard what people were saying. The application period for the social equity program is closed, and through our regulatory process that you guys have completed, we have found an avenue for businesses to be able to apply for prioritization and get that equity that they need in municipalities. This is a tool that you can verify your business, pre-verify if you're not licensed, or verify that you're a social equity business, which will give you that opportunity to have prioritization in your municipalities and get access to the social equity trust fund. I'm sorry, the window's so small, so I apologize if I got that close. The overview of what pre-verified versus verified means, just to clear up any questions. So a pre-verified social equity business is a business that is not yet licensed but are actively pursuing licensure through the application process. Pre-verification provides applicants with early eligibility confirmation, enhancing their ability to engage with investors, property owners, and local officials. Verified social equity businesses. This is a business that has reached provisional licensing stage or beyond and demonstrate full compliance with licensing requirements. So you are verified, you are not in the social equity program, right? You're not an EEA, but your business could fall into that category, right? And you are licensed. This gives you an opportunity to be able to, again, engage with investors, property owners, and local officials, even if our application period is closed. Verification of their social equity business status is making them eligible for additional benefits and resources. Next slide. So the key takeaways for us launching the social equity business, the pre-verification application and our verification application is that the the social equity business process fosters equity by creating a streamlined pathway for businesses and operators and underrepresented individuals, enhancing their access to regulated cannabis industry and promoting municipal equity. So it was really important for me to have to read that off the screen so people understand what the difference is. There's a difference between being in a social equity, an approved social equity applicant, and then being a social equity business. This was a part of our Chapter 180 regulatory process to make sure that the people that needed to engage with municipalities and investors had an avenue to say that I am an equity business and you should be giving me priority. And so we have fostered that through this process. I think the key takeaway for me as well is that if you are a approved social equity participant and or an economic empowerment applicant, that you have an equity status. And so the social equity business verification process would not be for that individual. And so that is outlined in our application process. Right now, our pre-verification application is being built and will be housed in Mass CIP, but it's being built by JD Software currently. And I am developing and refining the actual verification application as we speak. So those applications should be available shortly. And we will notify everyone when that is available to be applied for in our Mass CIP application. Do we have any questions?
Commissioner Roy.
Yeah, I'm just looking at the language under valuable benefits for verified SUBs. And it reads, verified SUBs gain access to priority licensing and accelerated operational timelines. I think we just gotta be a little careful there. Possible accelerated operational timelines. I don't want to overpromise and underdeliver.
Yeah, and so Commissioner Roy, I definitely agree. I think that I can look at what that verbiage is, but when we're looking at what we did in Chapter 180 regulatory process, we did set some parameters within our municipal equity guidelines, correct? And we said that these are the things that we expect municipalities to be able to do. And so I understand that you guys approved a timeline that should be prioritizing social equity businesses, economic empowerment applicants, and social equity participants. It is the responsibility of the municipality to hold up to the regulations and the guidelines that we set forth. And so I will revisit, what this language is, but making sure, I think at this point, that people understand that it is a partnership that makes this work. It's a partnership that makes municipalities and our regulations and our guidance work.
So based on that, maybe then replace operational with licensing, because operational means, in my mind, you're open for business. So maybe licensing timelines.
Priority licensing and accelerated operational timelines. Okay.
Or possible accelerated operational timeline. We just can't promise someone that their doors are going to be open for business based on Chapter 180 and the municipal. I don't know if that's going to lead someone to open their doors. Okay, I don't know. I just I don't want to overpromise and underdeliver.
No, no
That's all.
problem. I definitely, yep, I put a note here and I will get that updated.
Thank
Just
you.
the point here is just to make sure that people understand that we have priority licensing, and even when we're talking about trying to get someone operational, we're looking at their host community agreements. You know, we have accelerated timelines for that, and these are all pieces that get you to that operational standpoint.
Yep.
But I will definitely review this language and I'll get that updated.
Thank you.
Chair Stebbins.
Commissioner Concepcion.
Thank you. Celia, that was a really good summation of the intention behind that language. So I was waiting to hear, how you describe that. I was one of the two commissioners on the working group, and that's exactly what the intention was. Commissioner Roy, I think you're on the money. I think that, making sure that we change that it sounds like a simple change, but it does have a difference in meaning. So I just wanted to say I also just agree with that as well.
Thank you.
Thank you, Commissioner. Go ahead, Slade.
Next slide. And so I touched upon this. I know, I wanted to it's way the conversation is going, but just how we're going to be interacting. I want to collaborate with internal and external stakeholders to complete the development of the application period. I am doing that through our working group. I'm doing that with reaching out to some of our departments. I'm working with our chief IT, Paul Clark. I'm working with a variety of stakeholders in our working groups to get these applications out and built out as much as possible. In addition to that, there will also be FAQs. There'll be support on how to apply to the application. I've built in acceptance letters so that you could utilize this as you're going to engage, as we have asked municipalities and other stakeholders to have priority for these types of applicants and our EEAs and our SEP participants. And so this is what that slide really means. Next slide. So just, oops, next, oh, sorry. Yes. I know I'm taking up so much of your time. We're almost nearing the end. So these are the initiatives that I have in progress, just to make sure that our chair and commissioners know what our department is doing. I think that this is a point where I just want to remind people that I am the Equity Programming and Community Outreach Department. Equity initiatives, both internal and external, are a priority for our department, supporting constituents and our approved program participants, reminding people that we have a social equity program, and then we have the economic empowerment, approved economic empowerment applicants, and they are different. That was a priority period that was legislative, and it was a great program. It was a one-time thing, and they have priority. They have benefits that we offer within the Cannabis Control Commission, but that population also needs to apply for the social equity program. So we support everyone. So I just wanted to make sure there was a differentiation there, because I think that some people have questions about that as well. We are working on the social equity business application development and rolling that out. Everyone will have information about that. Delivery exclusivity working group. It is a conversation that I know that everyone knows that is taking place. It is something that is coming up in our near future. Our working group has begun. It started with Commissioner Concepcion. Thank you very much for heading that charter. We have continued that work. I'm working with our data metrics team, Maria, our director, Sarkis. I am also working with our entire research team to pull all of those regulatory bullet points and that data together. We will be opening a public comment period, which is, I think, very important. I have done some surveys in the past. I want to say that that survey is probably at this point maybe 12 months old, right? And so that although that data is important, I think that it is very important to be able to have that public comment period now and see where people stand. That period will be held for 3 weeks. We are launching the public comment period on November 25th, and it will be going through, we will be accepting submissions and testimony, I believe that's what you guys call it, through December 13th. We plan on providing our delivery exclusivity working group. We plan on providing our recommendation, which will include all of the data, all of the legal analysis, all of the information from licensing, all of our information from enforcement, investigations, enforcement, and compliance. Like, I am utilizing all of our departments to make sure that we move a thoughtful recommendation forward. And we plan on giving that to our chair and commissioners in January of 2025. The reason why that work is very important that we're doing right now is because, respectfully, our chair and commissioners will need to take up a vote by April 1st. Keeping in mind that if we don't have a vote, it expires on April 1st. And so if we do not have a vote before the 3-year exclusivity, let me be very clear, the 3-year exclusivity will expire in April. What that would mean if we don't have this discussion and understand where we want to take the delivery exclusivity period for that license type, because again, I'm just talking about our license type, then we would be subject to opening, then we would be subject to opening, like anyone at that point could apply. I was trying to find a fancy word for it, but that's why this work is really important. I'm not going to prelude what my opinion is. I'll keep that for my recommendation. But really what this conversation was really about is our public comment period will be launching. I'll be working with our communications team, both traditional and digital, to make sure that this is advocated. I'm also working with our director, Jen Cola, and in our government affairs and policy team, pushing this out and getting this information out. He's also on the working group. And so we will be having an in-person event as well. I am planning a in-person public comment period where people can come and give their verbal testimonies. Is that what you call it? I apologize. This is my first public comment period, but people can come in person and talk to the working group and give us their testimony, and that will also be a part of our recommendation to chair and commissioners. So I think that was a very important work update, because I understand that in previous public meetings it's been brought up. What are we doing with that? Where does it stand? And so I just want to make sure that yourself and our constituents know that we are actively working on that and plan on giving our recommendations so our chair and commissioners can do their work. The equity, we're doing an equity update to our website. That's included, information for the social equity business, any changes that is coming out of our recent regulatory process. To note, I forgot to say that all of the work that we've been, thankfully, that you guys have been doing, like when we're talking about delivery operator, social consumption to becoming, all of that stuff, as it rolls out, we will make sure it's incorporated and taught and updated in our curriculum. I apologize for not saying that earlier. And then I had said earlier that we're doing an agency-wide informational rat card campaign. I want to give grace and thanks to my communications team, both traditional and digital. They copy edit all of my stuff. Everyone, I move it around to different departments to get the information that they need. Our director Bird puts it together and makes it razzle dazzles it and makes it beautiful for me. So it is a collaborative event for me, engagement for me to be able to provide this resource. And I know that everyone's plate is full and they prioritize this for my department. So I want to give thanks and appreciation for that. And next slide.
Celia, before we
I'm
move
so sorry.
on. That's okay. Before we move off this, obviously the work of the delivery exclusivity working group is extremely important. It's going to be a big decision for this commission to make. I'm looking at your public comment period though, and you have the public comment period starting during Thanksgiving week. And I know you have a 3-week public comment period, but I'm almost afraid we might be losing that first week, people being away for the holidays, spending time with family. Is there any drawback to maybe pushing it out to the week following Thanksgiving Thanksgiving. If you still wanted to do 3 weeks, you're still finishing up before the Christmas holiday. I personally would just have some concern that you wouldn't have people focused on beginning to weigh in on that first week.
So I definitely agree. I feel like my team, so I'm open. So first and foremost, respectfully, Chair, I'm open to feedback and about our public comment period. Let me give you some context around why I picked the date that I did. Looking at the calendar, we did go back and forth on where we landed on the 3-week period. Everyone knows me. It doesn't take that much to send an email. I think that it like for me, respectfully, it doesn't take that much to give an email. I also want to give people space to consume what is to come. I know that there's going to be a social consumption conversation happening on the 5th. So even if I push it back, I'll be getting in the way of that conversation and that work, and that will be on the forefront of people's minds. I am going to do reminders weekly about our public comment period, and please submit your testimony. I can do as much outreach as possible, but you guys, excuse me, respectfully, the chair and the commissioners, you guys have a lot of work that is forthcoming. And in addition to that, there have been hurdles within the process that I wanted to get this information to you sooner so you could review it and deliberate it. But with the timeline that I'm giving you, if I push anything back, that is going to give you less time to make a determination by March. With this timeline, I've provided you at least 60 days to have as many meetings and individual conversations or time to sit with it or talk to your stakeholders to be able to have, hopefully, a vote about where we're going to go with this in enough time before it expires.
No, I mean,
that's the reasoning behind the timeline.
No, and I appreciate that explanation. Fair enough. I just raised it as a concern. Commissioner.
Celia, we're receiving a question. Would you consider having any external stakeholders as part of that working group?
Oh, I'm so sorry. Like a part of our internal working group?
Yeah, well, yeah.
Which working group?
So the one on the exclusivity period.
I may not be answering this question correctly, but our internal working group will be comprised of our different departments here. When we're talking about engaging with different external stakeholders, I have done that through surveying, and it will happen through the public comment period. But working specifically with our internal working group, I have not done that.
Okay. Okay. I know. It was just posed to us a question around the delivery exclusivity work group initiative, and I know in the past I've had working groups where I brought in external stakeholders for that outside perspective.
Okay.
So I just didn't know if that's something you would consider, or I'm just posing the question. That's all.
No worries. I definitely think we're in a space where I'm working with Commissioner Concepcion on this work, so I think that I could engage like the working group and her perspective at this kind of like late juncture in what we're working on. But I've engaged. So I don't want anyone to think that I haven't gotten an external perspective. I have engaged in separate. When I was talking about the surveying specific to licensees, I've engaged people just in the general community, and then a specific, as you will see in the data that you receive, a survey with specific information and open feedback on this as well to the different groups individually, whether you are a licensee, whether you are in our program, SEP, EEA, or just the general population. I've done that type of work, but I don't know if I can explore getting an external person in at this point.
And I appreciate you getting their perspective, and we will for the public comment. It's just a suggestion. Something that I did too in the past was you can have a special guest come in during a working group, meeting. We've done that too in the past. Just and the only reason I'm bringing it up is because it was posed to us.
No worries. I do have a follow-up question if it's appropriate. I'm sorry.
Yeah, go ahead.
Go ahead, Celia.
When we're talking about inviting special guests, and this might be a question for someone else, so I apologize if it's not in the correct context. Is there a specific process that I need to follow to get that type of engagement internally?
Can I jump in, Commissioner Stebbins?
Yeah.
So Leah, we all got an email right now from David O'Brien that says, "Good afternoon. Is there any external participation in the delivery exclusivity work group? As the only industry organization that supported the commission policy when you launched it, you will recall the Commonwealth Dispensary Association sued the commission over the policy. We are eager to advocate for that policy to continue to enable delivery licensees." So Commissioner Roy's sort of, speaking on behalf of that, right? And I read it out loud into the public because all our emails are public information anyway. So, that's the kind of conversation. So you definitely, if you don't invite them to the table, you don't have to. So this is us just giving you recommendations.
Okay.
Commissioner Roy's perspective on special guests, I think, is kind of to David O'Brien's sort of email and comment is, there are some working groups that are out there that are doing a lot of work with their membership. So maybe just reaching out to them and inviting them to the public comment period could also be helpful. So I think that's
Okay,
a little bit of it. Yeah. And the other thing too is, and I see Commissioner Concepcion's hand up, I'm okay with the November 25th. There's been a lot of conversation today around this.
Mhm.
We got to get it out, push it out, put it
Okay.
into a newsletter, use the media to help us. People have been waiting for this for
Yeah.
years, and the industry is nervous about what is going to happen. For us to vote on this in, March or April is very late. We need to vote on this at the beginning of the year. So I'm okay with that.
Thank you.
Commissioner Concepcion, did you have it?
I just had a response to Director Williams in terms of the process for inviting an external person into a working group meeting. I've also done that, I guess, in all 3 working groups during the Chapter 180 process. And it's really a conversation within the working group and coming to an agreement. Sometimes it's really the heads of that working group who will initiate that and say, we want this person to come in. We think it will be helpful to our process. And then there was something else I wanted to say, and this is a topic that was brought up earlier, but I just started jogging my memory around the discussions. When we were talking about SEBs and the use of operational versus licensing, that was an intentional word that we incorporated because licensing is something that is under the exclusive purview of the Cannabis Control Commission. So even though you can go through a local process, it is the Cannabis Control Commission that licenses businesses. So before we make any changes there, I just wanted to add a little tidbit to talk with legal about sort of what that phrase does and how we avoid any sort of misconception. So that was the other thing in my mind, because I had to kind of go through the different conversations that were happening at the time.
No problem.
Thank you, Commissioner. Or GC also had his hand raised.
Thank you, Mr. Chair. And speaking of legal, I did want to just add, as we're talking about timing here, that to the extent that there are going to be regs necessary to be promulgated to effectuate this, I want to make sure that we're building in enough time to get that done before the April timeline. So to the extent that you're talking about, the discussion is about pushing back comment period and that sort of thing. I think we're already operating on a pretty tight timeline, so I just wanted to throw that in there just so that we have enough time to make sure that all the legal background work is done on
An
time.
excuse to step away from the in-laws, I got to work on some comment. Yes, there you go. Have your turkey and send it in.
Thank you
Thank you.
very much.
Thanks, Leah.
Thank you. No problem. And I just want to reiterate, I thank you for, letting me know how to bring in special guests. And Mr. O'Brien, I openly invite you to the public comment period that we are going to hold in December. And that notification is going to go out, and I welcome you to come and give your testimony and your feedback, and it'll definitely be incorporated to the purview of the working group's recommendation.
So Leah, before you move on, Commissioner Roy had another.
I jumped
I'm so
ahead.
sorry.
I have a question on the very last slide, so we're not
Okay.
there, but when we are, I do. Thank you.
Okay.
You have commissioners that read ahead.
I read ahead.
Except me.
Haven't had lunch, or
Go ahead, Leah.
So this is This is, oh, we can go to the next slide. You didn't really jump too far, Commissioner Roy.
Yeah.
I believe this is my last slide. And so again, this is just overviewing some of the initiatives that the equity programming and community outreach team had in progress. So it would be community engagement. Community engagement is really important. This is budget dependent, and so I'm trying to work with what I have. And what, like, I know that we're advocating for more, but just to understand that these valuable benefits and getting into the community and understanding what each community needs. Every community is different. Each person in the program is looking for something different. So making sure that I'm out there and understanding and getting that feedback, that's how I evolve this programming and make it beneficial. This programming is a legislative mandate. That's amazing. This is not something that we are doing optional. So I take community engagement very, very seriously, because that is how I've been able to bring some of the team, definitely the manager of community outreach, Stephen Caracello, about what that strategy looks like in our communities, in our DIAs, in our senior population, in our patient and within our medical program, making sure that that community outreach and our presence is there. People know that we're there to support them. Guys, have these conversations. It's a long, hard journey. We're trying to make that easier, but we can't make it easier without getting out into the public and knowing what those pain points are. So I'm excited to be developing what that looks like for 2025. Social, I got the green light to start the working group on the social equity program benefit enhancements. So I can't wait to start working with different stakeholders, and I would love, whomever would like, to my two commissioners or chair that would like to work on this engagement along with people internally and hopefully maybe some external stakeholders as well. But I look forward to getting that work done. And then we're doing right now, we're in the phase of contracting, creating statements of work and doing our contracting. So I'm working with our legal team and our procurement manager with regards to our technical assistance and training development. And then we will kick off building that tailored curricula to our participants and rolling it out as outlined in a previous slide. And I know that that was a long slide in a presentation, but I really wanted to I haven't had the opportunity to talk to our constituency, to talk to our chair and commissioners about the work that I've been doing. I know that I've been alongside you in our community. I appreciate your support as we push this initiative forward. Always understanding that equity is a journey. It's not a race. Think like, how long did it take for us to get here? And I'm here and my team is here for the long haul. I'm not going anywhere. I'm dedicated to making sure that we have an impact in this industry. And I'm proud of the work that the agency does to keep moving that forward. And that is the end of my presentation. Thank you so much for my time. I know there's a question, so I was just trying to wrap that up.
No, thanks for the Commissioner Roy has a question.
Director Williams, to you and your team, I want to thank you for the presentation today. And I just want to go back to that first bullet there, community engagement planning. And I appreciate and agree with your philosophy, meeting people where they are. You had said that earlier in your presentation. I wholeheartedly agree with that approach. And with community engagement planning, I'm wondering if it's possible, when you know that your team is going out in the community, we can have work with our comms team to place it on the calendar on our website. We get a lot of traffic to that website, and if you know you're going to be at the Taunton Health Fair or wherever it may be, the Charlton Council on Aging, if we can have those in that calendar, so folks can see that it's open to the public, the legislature can see where your team is, like people can see where they are, as opposed to just when we get these updates, let's promote it. So if that's possible, I think that'd be a really good thing.
I definitely agree. I definitely would love to amplify it on the calendar. I do want to make note that our communications team, both Director Burt and Director Mary Alice Curley, they make a point to put these in newsletters and blast email communications currently. So I think just adding it to the calendar will amplify the work that they're already doing, because we are getting those out. Internally as well, I'm always thinking about making sure that everyone here within our departments, although we do our siloed work, and I hate that word, right? We can't move anything without moving it together. If I do something, Leo looks at it. If I have to do something like get it pretty, then digital and we all work together to move this work forward. And so if you guys want to take a look, and this is just for us, if you want to take a look at the internal Cannabis Control Commission intranet, for those who don't know what that is, because I'm speaking to everyone in this forum, that's just our internal internet. If you go onto the equity programming community outreach tile, anything that I know that the commissioners are have confirmed that they're going to be attending, or any of the events that social equity is planning to do, is also on our intranet. So internally, people can know where our commissioners are, what are their efforts. Maybe they can attend as well. So I would love to take that work and amplify it on our, figure out what that looks like to amplify those opportunities on our calendar so that our external stakeholders know as well. And with that being said, anyone that has any questions related to everything equity, community outreach programming, social equity program questions, eligibility, social equity business, anything that we can help you with, please email us. I have a policy that we return emails within 48 to 72 hours. And if you don't receive an email from us, you will definitely receive a phone call. So we are very responsive to all questions that we can answer. I just want to make sure that I keep it in the purview of what's in my department. I do refer questions to licensing or to enforcement because that is where they lie. But you will get answered. So please reach out to us if you need anything.
So Leah, thank you so much. Appreciate the presentation. Appreciate the comments and questions from my colleagues. It's a lot of good work going on. I'm glad you had a chance to showcase everything that your team has been doing and plans to do as we look ahead to 2025. So thank you very much.
Thank you so much for my time.
Thank you so much,
Of course, Leah. I'm gonna recommend, with my colleagues' indulgence, we are going to take a quick break for lunch. However, I would suggest, and then we'll come back and pick up on the remaining items under the acting ED's report before we get into licensing decisions. But I know we have someone here that is waiting on his approval for a final license. I would ask if we could take item number 8 out of order and vote to approve the slate of final licenses under staff recommendations on final licenses. If that's okay with you, Commissioner Concepcion?
That sounds good.
For 7, Commissioner Stebbins.
Looks like number 8 on the script I have, number 7 then.
Oh, sorry.
We have a slate of 9 recommendations for final licenses. I would seek a motion from Commissioner Camargo to approve the slate of final license applications. Do I have such motion?
So moved.
Commissioner Roy, would you second that?
Second.
Okay, motion made and seconded. Any further comments or questions on our list of final licenses?
I just want to say to Robert Kelly, who is in the audience, I know your journey has been a long one, like a lot of folks, but once we approve this, I just say congratulations. Thank you for coming today. And, I mentioned it earlier. I think you're Black owned, veteran owned. You all local folks from Springfield. I know you went through the process twice in Springfield. I think the first time you guys weren't selected, and then the second time you were selected. So I know it's difficult. I just want to say thank you. And I think to my comments earlier on SCP and what it looks like, you're part of cohort 1. And you're now finally opening your doors. So congratulations today. And my vote is aye.
Commissioner Concepcion?
I will say ditto on the congratulations. I wish I can be there in person to shake your hand and tell you congratulations. And aye.
Commissioner Rowe?
Yeah, I just want to say to Mr. Kelly, congratulations. I know this was a long journey, and I am sure you will make a great mentor to folks with lessons learned along the way. So congratulations. Oh, aye.
Very good. Before I vote aye, also, see him around the pillar. Congratulations. I know we're taking up this item quickly, so Mr. Kelly can get back to Springfield, but I also want to note that one of the licenses that we are approving for final license is actually the Commonwealth's first marijuana research facility. So first one in the Commonwealth. So we congratulate the folks on Curaleaf, and again, congratulate our team for moving this first in the Commonwealth license through for final approval today. And I will vote aye as well. So 4 in favor, none opposed to our slate of final license applications. It is 1:25. I'm going to suggest we take 15 minutes. 15-minute break, and we'll reconvene at 1:40 and get through the rest of our business. Thanks, everybody. Okay. Thank you. We are back. Commissioner Concepcion, just want to make sure you're with us and you can hear us okay?
I'm here. Yes, and yes.
Awesome. Thank you. All right, we are going to quickly go back. We have some items still under the acting executive director and commission staff report. Item number 5 under that report is regulatory implementation update. I see acting deputy general counsel Michael Baker, acting deputy general counsel Baker. I'll flip it over to you. I will tell you that Commissioner Camargo already warned people not to follow our new regs until next week. So, but not to steal any of your thunder, but before you start, I do want to offer my congratulations, thanks to you on a lot of great work, getting those published in time, working through and reviewing the material with the folks in the Secretary of State's office. So we met the deadline for November 8th, and we're on track for November 22nd. But I'll turn the floor over to you.
Thank you very much, Mr. Acting Chair, and the rest of the commissioners for having me. Yes, a lot of my thunder is stolen. It was a very brief update that I had here. So, but it's very important information to get out there. So I'm happy that we're all on the same page. So we were able to file on November 6th with the Secretary of State's office. So as we indicated before in the last public hearing on regulations, we will be promulgating them on November 22nd in the Massachusetts Register. So that means that everything that we had just done in the prior regulatory round will be effective again next Friday, November 22nd. So that's all the delivery changes, micro business, telehealth, physicians and nurse practitioner amendments. Please let us know if you have any questions on that. You might, if you're a licensee, you might want to look at your SOPs and whether there's anything that is required updating. And once those are finalized with the Secretary of State, we will post the new versions of our regulations online on our website. So that's all I have for you. Please let me know again if you have any questions on this stuff.
Question.
Commissioner Camargo has a question for you. Don't go away.
Mike, I know you just said what you said. If you were talking to a licensee, what would you say in terms of the process? Because even though you just said what you said, folks are still going to be like, does that mean at what time can I start with one driver? So what is the process? So on the 22nd, they'll be promulgated. Does it go into effect at 9 in the morning, 5 o'clock in the afternoon? Do they have to wait from an email from us, like clear instructions?
Yeah, sure. So we'll provide more information on that when we announce it on the 22nd, but obviously I can't provide legal advice for each licensee here, and I don't think that's what you were expecting. But
no.
Ultimately, once it's published in the register, it is effective. So I'm not sure exactly when the Secretary of State's office will put that online.
Okay.
But ultimately, again, the date will be on the 22nd. So all of those amendments that we had just made, that I just kind of summarized briefly, those will become effective and enforceable under the law. So licensees, again, I would just flag, would want to review their own internal policies and procedures to update those amendments. So that's, the extent that I'll go there. But we will have more information coming out on the 22nd. And again, the new regulations we will be posting subsequently.
Okay. Any other questions for our acting deputy general counsel?
Applaud him for all of his hard work and effort to make sure we stayed, the train stayed.
Commissioner, turn the mic on.
Sorry. Oh, thank you. Oh, yeah, I just want to applaud you, Attorney Baker, and the team for all your hard work and your effort to stay on that timeline. And I know that was aggressive, and I'm sure there were a lot of nights and weekends put into that. So I just want to thank all of you.
Yeah, Mr. Acting Chair, if you don't mind, of course, happy to work with you all on that, and the rest of the team behind the scenes as well. I appreciate everyone that put an effort forward to get that over the finish line. And I look forward to working with you all in the next round on social consumption and other policies. So thank you very much.
I will also add my thanks in particular to my colleagues, to Commissioner Concepcion and Commissioner Camargo, who worked on the delivery regs. Commissioner Roy, you partnered with me on the changes to the micro business license type. And obviously to a lot of the patient advocacy organization that weighed in on the telehealth provision, as well as thank the many licensees and stakeholders out there who participated in the process of providing commentary and feedback as we went through the regulatory process. But happy to have these kind of off our plate and taking effect shortly. And again, thanks, Mike, for the great work that you did and the entire team. All right, we will move down to our licensing data and updates. I know, Olivia, you're with us, but I think you're going to let Jamie help out in this part of the presentation.
I'll do the licensing data and then she'll do the license recommendations.
Okay, great. Hi, Jamie.
Good afternoon.
Welcome.
Good afternoon, everyone. I guess I'll jump straight into it. We are all familiar with these slides, just sort of showing an update in the licensing data compared to last month. We have 2 applications awaiting first review, 10 in the supplemental review queue, 5 for provisional license consideration. This should say 9 for final license consideration. However, at the time the data was created, there were 7 in the packet. So we have 9 for final license consideration and almost 644 certified active patients. There are no questions. We can go to the next. This slide, as you know, just kind of shows the stage license applicants are in the licensing process. And what we highlight here is the commence operations. As you can see, there's still a steady increase month to month. I think it's a little bit lower than last month, but it's still around the 20% mark. So there really isn't any considerable change. Here's our wonderful, huge tracker of all things licensing numbers. Again, not much change compared to last month's numbers. As usual, we can see the marijuana cultivator, retailers, and product manufacturers are leading the way in licenses out there.
I'm expecting at our December meeting, we'll have that research facility all the way over in commence ops, or at least in the final license piece. Okay. Appreciate that. Any questions on this slide? All right. Continue, Olivia.
Okay, this actually was a slide that was requested last month to see kind of a breakdown of active license by type. So here you can see all our license types by provisional license, final license, and commence operations. And as you can see, we have a total of 890 active licenses by type, broken down by type. Any questions?
Okay. Continue.
Wonderful. This is an update on the expired provisional approvals. So just to give a quick recap, as we know, we had identified 120 that were provisionally expired, the approval had expired. We had sent out an email kind of gauging folks to see who wanted to have continue in the licensing process, and we have received 30 responses to that email. To date, we have 1 provisional license that were issued from those 30 that sent the email. I will go over to the next slide before questions, just because it's tied into this one, if that's okay.
Of course.
So from the 30 that initially said that they were interested in pursuing, we received 13 that actually applied. From those 13, again, 1 has actually gone through the entire process, paid the fee, and received provisional licensure. 4 are currently in the application complete status, meaning that right now they're just awaiting background checks and fingerprints, so that they're getting closer to the to the end. If you'd say, and 8 are reopened, so they're in the RFI stage where we're requesting additional information. We've also broken it down by HCAs just to see how the HCAs are playing into the process. So we received 2 compliant HCAs, 3 HCA waivers, 4 non-compliant HCAs, and 4 applicants did not submit HCAs at all. Any questions?
Any questions? Okay. Continue.
Great. Moving on. All right, now here we are to our wonderful HCA data. As you can see, the numbers are increasing. We are now at a total of 614 applications that we have received. And from that, we have roughly about 321 that have been found compliant. And now the number of towns, I believe it went up 20. I think we were at 75 in October. Now we're up to 96. So it's wonderful to see. Soon we're going to run out of space of listing everyone, so I think it'll have to go into its own slide. What's that? Sorry.
I'm sorry.
Go ahead, Commissioner Roy.
You said it's going to need its own slide.
Right. Yeah.
All the towns.
So any questions on this slide?
Just for me, again, I continue to be impressed with the number of communities using the compliant model HCA as well as the folks using the model HCA waiver.
Yep, agreed. It's wonderful. I mean, it's wonderful to see it's, a tool that we've provided, and it's wonderful to see it being used. And it definitely helps people advance in the process. So I agree. Next slide. So we currently have reviewed 573 HCAs, 41 are currently under review, and to date we have issued 444 host community agreement determination notices. With extensions, now we are up to 768 extension requests received, so people are using the extension process. So that's great to see that they're taking advantage of that. 58 have received pre-approval. 710 have been granted extensions, and the average number of days is still around, 93. I believe that's usually the market stays around at.
Okay.
Any questions?
Seeing none, continue.
Wonderful. I think this may be the last slide. Yep. Now I will pass it over to JB.
Okay.
Thank you, everyone.
Thank you, Olivia.
No problem.
All right, Jamie, welcome.
Thank you. Thank you for having me again.
All right, we will proceed with staff recommendations on changes of ownership. We can go through these. Anything, Jamie, you want to start off with?
I wanted just to say thank you to all of the presenters that we've had here today. Specifically, Celia and Kate for their presentations and that highlighted their interesting and impactful work, in addition to what they and their teams do every day. And then additionally, thank you to the Chief of Staff for being a strong support for all of us. He just demonstrated that earlier today as well. And then I just want to thank everyone involved with putting together the public meeting data. I'm going to step on my own foot here. I'm sure I'm going to miss someone, so I apologize, but I'm kind of including the IT team, the data team, members of investigations and enforcement, government affairs, communications, legal, and everyone else that I inevitably forgot to mention. I apologize. But that's how I wanted to start that off. So
Yeah.
I can jump into the change of ownerships if you are ready.
Let's go.
All right, there are 7 changes of ownerships and control requests for consideration today. The first licensee is GTE Brockton LLC, doing business as Boterra. They are seeking a change of ownership and control of 1 adult use license and are requesting to add 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay, thank you. Any questions or comments on the first change of ownership? Seeing none, I seek a motion to approve the change of ownership for GTE Brockton LLC, doing business as Boterra. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Concepcion?
Second.
Motion been made and seconded. Any further comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo, Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye, 4 in favor, none opposed. Okay, Jamie, next one.
The next licensee is GTE Franklin LLC, doing business as Boterra. They are seeking a change of ownership and control of 1 adult use license and are requesting to add 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval to be subject to the conditions before you.
Okay, any questions on this change of ownership? Seeing none, I'll seek a motion to approve the change of ownership of GTE Franklin LLC, doing business as Boterra. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Second.
Motion been made and seconded. Any further comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo, Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins votes aye, 4 in favor, none opposed. Okay, Jamie.
The next licensee is GTE Taunton LLC, doing business as Boterra. They're seeking a change of ownership and control of 1 adult use license and are requesting to add 1 entity to the license. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay. Any comments or questions on this change of ownership? Okay, seeing none, I'll seek a motion to approve the change of ownership for GTE Taunton LLC, doing business as Boterra. Do I have such a motion, Commissioner Roy?
So moved.
Do I have a second, Commissioner Camargo?
Second.
Motion been made and seconded. Any further comments or questions? Seeing none, do a roll call vote. Commissioner Camargo, Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye, 4 in favor, none opposed. Okay, go ahead, Jamie, number 4.
The licensee here is Holistic Industries, Inc. They are seeking a change of ownership and control of 5 adult use and 2 medical marijuana treatment center licenses and are requesting to add 6 individuals and 6 entities. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay. Any questions on this change of ownership? Okay, seeing none, I'll seek a motion to approve the change of ownership for Holistic Industries, Inc. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Concepcion?
Second.
Motion been made and seconded. Any further comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo, Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye, 4 in favor, none opposed. Okay, number 5, I&I Rose Garden LLC.
Yep, the licensee here is, like you said, I&I Rose Garden LLC. They're seeking a change of ownership and control of 1 adult use license and are requesting to add 2 individuals and 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay, any questions on this change of ownership? Seeing none, I'll seek a motion to approve the change of ownership for I&I Rose Garden LLC. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Second.
Motion been made and seconded. Any further comments, questions? Seeing none, I'll do a roll call vote. Commissioner Camargo, Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye. 4 in favor, none opposed. Okay, Jamie, next one.
The licensee here is Richards Flowers LLC. They are seeking a change of ownership and control of one adult use license and are requesting to add one individual. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay. Any questions on this change of ownership? Seeing none. I'll seek a motion to approve the change of ownership for Richards Flowers LLC. Do I have such a motion, Commissioner Roy?
So moved.
Do I have a second, Commissioner Camargo?
Second.
Motion been made and seconded. Any other further comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye. 4 in favor, none opposed. We'll move on to the last one. Jamie?
Okay, the licensee here is Smithers AMS LLC. They're seeking a change of ownership and control of one adult use license and are requesting to add 2 individuals and 2 entities. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay. Any questions on this change of ownership? Seeing none, I'll seek a motion to approve the change of ownership for Smithers AMS LLC. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Concepcion?
Second.
Motion been made and seconded. Any further conversation or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo,
So, aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye. 4 in favor, none opposed. All right. Thank you, Jamie. We'll move on to our renewal roster.
Mhm.
Yes, there are 45 adult use renewals and 4 medical marijuana treatment center renewals for consideration today. Commission staff recommend review and decision on the renewal applications before you, and if approved, request that the approval be subject to the licensee remaining in compliance with the Commission regulations and applicable law.
Okay. I didn't have any recusals or any conditions on renewals. I do have 3 conditions I would like to propose for 3 of our renewals. I'll go through those quickly. The first one is Green Stratus Corp., license number MRR 206852. Proposed condition is within 30 business days of approval of application for renewal, contact CCC Licensing Division and clarify goals number 2 and number 3, and consider updating licensee's positive impact plan in accordance with 935 CMR 500.1011A11 and 935 CMR 500.1034B. Just for a quick clarification, there's multiple goals under 2 of their strategies under their positive impact plan. They've noted that goals 2 and 3 have had no progress. We're just trying to clarify which goals 2 and 3 they're referring to. But I also believe this licensee has been in operation since 2021 and might just want to consider updating their positive impact plan. The second condition I'm proposing is for Massachusetts Green Retail, renewal license number MRR 207031. The proposed condition is within 30 business days of approval of application for renewal, Contact CCC Licensing Division for an update to report any totals for veterans, residents with disability, and LGBTQ+ residents under licensee's diversity plan in accordance with 935 CMR 500.101 1C8K and 935 CMR 500.1034B. Again, just a brief description of the reason for this condition. They have goals set in their diversity plan for hiring from these target populations, just did not offer any reports or totals on those populations in their diversity plan update at time of renewal. And the third one is for New Green LLC, license renewal number MRR 207014. Within 30 business days of approval of application for renewal, contact CCC Licensing Division and report on program number 3 with licensee's positive impact plan in accordance with 935 CMR 500.1011A11 and 935 CMR 500.1034B. Again, just a brief description of the reason for this condition. They are doing some great work on goals 1 and 2. What I was looking for is information and update and progress on program number 3 under their positive impact plan. So if there's no other condition, we can seek approval of the list of renewal licensees, again, subject to the conditions articulated by Commissioner Stebbins. I will seek a motion to approve our renewal licensees 1 through 50, subject to the conditions on those licenses articulated by Commissioner Stebbins. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Concepcion?
Second.
Okay, motion been made and seconded. Any further comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo. Aye. Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. 4 in favor, none opposed. All right, we will move on to provisional licenses. Oh, sorry, Commissioner Roy.
I just had a comment.
Yes.
About the renewals, and I just want to highlight Alternative Compassion Services, Inc. In reviewing their positive impact progress report, I'd say they exemplified a best practice in that. It was the most thorough I've ever seen or read. And another highlight is all their new hires were from ADIs. And they've had employees Braintree, Brockton, Fall River, Quincy, and Taunton. And they really had spreadsheets and charts of their impact in the community and in what they've done. So I just want to highlight them and commend them for what I saw and read on their impact, positive impact progress report.
Thank you, Commissioner. All right, we will move on to staff recommendations on provisional licenses.
There are 5 provisional licenses for consideration today. The first is Altai Alternative Care, Inc. I'm sorry if I mispronounced that. The proposed location is 267 Amherst Road, Suite 2 in Sunderland. They're seeking a marijuana retailer license, and the applicant received expedited review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Okay, thank you, Jamie. Bear with me for a second. I did have a proposed condition on this provisional license applicant. My proposed condition is prior to final application for licensure, consider revision to positive impact plan goal number 2 and consider identifying the disproportionately impacted area designated communities where applicant plans to hire in accordance with 935 CMR 500.1011A11 and provide an update to the CCC licensing division. Again, what struck me was certainly their interest in recruiting and hiring from DI communities. But I think as all of us have seen in the past, usually when we see a provisional application, they've identified what communities they feel they're in close proximity to and how they're going to focus their efforts. So just asking Alternative Care to provide us some more detail. Any other comments or questions on this provisional licensee? Okay, seeing none. I'll seek a motion to approve the provisional license for Alternative Care, Inc. Provisional license application number MRN 285705, subject to the condition proposed by Commissioner Stebbins. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Second.
Motion been made and seconded. Any further comments or questions on this provisional licensee? Seeing none, I'll do a roll call vote. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye, 4 in favor, none opposed. Okay. Number 2, Jamie.
The applicant here is Lucky Green Ladies 408 LLC. The proposed location is 408 Old Colony Road in Norton. They are seeking a marijuana retailer license and received expedited review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Okay. Commissioner Roy, I believe you have a condition on this provisional license application.
I do. Thank you, Chair. For Lucky Green Ladies 408 LLC, prior to final licensure, please ensure full compliance with all consumer education material requirements in accordance with 935 CMR 500-146 A through J, including the phone number for the Massachusetts Substance Use Helpline.
Okay. Thank you, Commissioner Roy. At this point, I'll entertain a motion to approve the provisional license for Lucky Green Ladies 408 LLC, number MRN 285151, subject to the condition from Commissioner Roy. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Second.
Okay, motion been made and seconded. Any further conversation or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo. Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye, 4 in favor, none opposed. Next one.
The next applicant is Maruti Wellness LLC. The proposed location is 266 Washington Street in Attleboro. They are seeking a marijuana retailer license and received expedited review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Okay. Commissioner Roy, I believe you have a condition
I
for
do.
this license applicant.
Thank you.
Go ahead.
For Maruti Wellness LLC, prior to final licensure in accordance with 935 CMR 500-146G, please include the phone number for the Massachusetts Substance Use Helpline on your consumer education.
Okay, thank you, Commissioner Roy. I also have a proposed condition for this license applicant. My condition reads as follows. Prior to final application for licensure, contact CCC Licensing Division with an update to confirm your training and recruitment partners and eligibility to support your activities in accordance with 935 CMR 500.1011C8K. Again, just kind of a quick explanation. In their diversity plan, they talk about seeking support from our state math higher career centers, which still at this point, I don't believe can support their training and recruitment partners due to federal funding of our mass higher centers. So just invite them to update their diversity plan with that respect. If there's nothing else, I will seek a motion to approve the provisional license for Maruti Wellness LLC MRN 285001, subject to the conditions outlined by Commissioner Stebbins and Commissioner Roy. Do I have such a motion, Commissioner Roy? Do I have a second, Commissioner Camargo?
Second.
Motion been made and seconded. Any further comments or questions? Seeing none, do a roll call vote. Commissioner Camargo. Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye, 4 in favor, none opposed. All right, number 4, Jamie.
The applicant here is Red Barn Growers LLC. The proposed location is 1 Cabot Street, units 5 and 6 in Holyoke. They are seeking a marijuana microbusiness license for cultivation only and received expedited review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you, Jamie. Any comments or questions? I didn't have any conditions for this license applicant, so. Oh,
Just a quick comment that
Sure,
is a
go
micro
ahead.
business. We don't really see a lot come through, but perhaps with our new voted upon enhancements to that license type, maybe we'll start to see more.
great point. Thank you. With that, I will seek a motion to approve the provisional license for Red Barn Growers LLC, license application number MBN 282429. Do I have such a motion, Commissioner Camargo?
So moved.
Do I have a second, Commissioner Concepcion?
Second.
Motion been made and seconded. I'll do a roll call vote. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. 4 in favor, none opposed. Okay, Jamie, number 5.
The last applicant for provisional licensure today up for consideration is Webster Cannabis LLC with a proposed location of 4 Town Forest Road in Webster. They are seeking a marijuana retailer license and received expedited review. Additional information is contained within the executive summary for the commission's review and consideration. Therefore, commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Okay, Commissioner Roy, I believe you have a motion or a condition for Webster Cannabis LLC.
Sure. Thank you. For Webster Cannabis LLC, prior to final licensure, please ensure full compliance with all consumer education material requirements in accordance with 935 CMR 500-146 through J, including the phone number for the Massachusetts Substance Use Helpline. Thank you.
Okay, any other comments or questions on this license application? Seeing none, I'll seek a motion to approve the provisional license for Webster Cannabis LLC, license application number MRN 285091, subject to the condition outlined by Commissioner Roy. Do I have such a motion, Commissioner Concepcion?
So moved.
Do I have a second, Commissioner Roy?
Second.
Motion been made and seconded. Any further comments or questions? Take a roll call vote. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. 4 in favor, none opposed. All right, we will move down. We already took our votes in action on final licenses. We'll move on to staff recommendations on responsible vendor training.
There is 1 responsible vendor trainer for consideration today. The applicant here is Seed Talent. They are seeking a 2-year certification to provide basic core curriculum training in the responsible vendor training program. They intend to provide a virtual training environment. Therefore, commission staff recommend commission approval subject to the conditions before you.
Okay, any questions on the responsible vendor training applicant? Commissioner Roy.
I want to echo your sentiment from earlier that we're one of the few jurisdictions that even require RVT, but we're at a point where perhaps it's time to evolve it. I think you used the word stale. And I have had conversations with I&E. I think they are making efforts towards this because it is under I&E now, and look forward to that day where, and I'm grateful for the advanced core curricular and then delivery curricular, but perhaps, you know, obviously we're going to, social consumption is going to be a big area where we're going to need it, and maybe more license type specific would be great moving forward, but I just want to echo your earlier sentiments, Chair Stebbins.
Commissioner Camargo?
I agree with Commissioner Roy.
Good. All right. Any other questions? If not, I will seek a motion to approve Seed Talent as a responsible vendor trainer. Do I have such a motion, Commissioner Roy?
So moved.
Do I have a second, Commissioner Camargo?
Second.
Motion been made and seconded. Any other comments or questions? Seeing none, I'll do a roll call vote. Commissioner Camargo. Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
And Commissioner Stebbins votes aye. 4 in favor, none opposed. Jamie, anything else?
No, thank you so much for having me again today, and I look forward to presenting next month as well.
Okay, well, you're welcome to stick around, but I know you probably have other things you want to get done today. Thank you, Jamie. Appreciate it. Olivia, thank you for allowing Jamie to join us. And Jamie, we'll see you next month too. Oh, she already jumped.
She said
No,
yes.
I'm still here.
She
Yes,
said-
I will see you next month as well.
All right, that sounds good. We will move on to commission discussion and votes. The first item is calendar year 2025, excuse me, public meeting discussion. Just wanted to have a discussion with my colleagues. I want to discuss our likely 2025 calendar, which we will review at our December meeting. Obviously, we can expect our monthly business meetings, the second Thursday of the month, to continue in 2025. I do wish to continue our shift or our focus towards these quarterly listening sessions. Obviously, I think we had 3 that worked very well last year. First of all, the ones that Commissioner Concepcion led with respect to island delivery. We had another one with our outdoor cultivators. We had the most recent one led by Commissioner Roy with our independent testing labs. I like them. They give us all the chance to all be in the same room together and hear the comments as opposed to kind of breaking up 2 by 2. I think it's been more efficient that way. As I've talked about, you know, I'd like to suggest that our first one for 2025 focus on our medical cannabis program. It's great to have our chief of staff in the room who is working with the team to manage that program. I think it's important to hear from our patients, our registered physicians, our MTCs who are in this space, as well as our internal team. I do have some suggestions or ideas for other quarterly listening sessions and certainly welcome other ideas, but that's the one I want to start off with in 2025 and get your thoughts. Anything, Commissioner Concepcion, any thoughts you might have on this topic?
Have a few, but I just think, you know, I've been very transparent in terms of my own sort of health. So I'm just a reminder that there will be a chunk of time that I will not be available. So I just want you guys to keep that in mind because I have to give birth. So that was just that little tidbit that I'll put out there. Otherwise, I wholeheartedly agree with you. I think I've said this in the past. We get so much from those hearings. You know, it's having that really in-person engagement and having opportunities to not just speak to people, but, you know, sit back and listen to the real world impacts of our regulations, our other conversations, and getting that feedback as we continue to really respond in a meaningful way to the needs of our stakeholders. So I just wanted to say, I'm glad that that's continuing to happen. And I just want you all just to be mindful that it will likely be 3 people, you know, from January until, you know, so I will say that.
Well, we know if you have any breaks in your schedule and want to join us for virtually for any of these conversations, you know we welcome that.
Absolutely. And I do watch them. So even if I'm not there, I'm watching. But thank you.
Thank you, Commissioner Concepcion. Commissioner Roy.
And thank you. And I do agree wholeheartedly. I think these are enormously beneficial. I look forward to the medical cannabis one, but I thought we were going to do a B2B third-party transporter. Is that?
Yeah, and I wanted to stop just at, we had this, no. Wanted to think through our, quarterly listening sessions. I do want to offer us the opportunity to what I would consider smaller meetings focused on meeting with, particular licensees or stakeholders. And to your point, during our recent regulatory work, we talked about other transporters, third-party transporters, folks with who have that endorsement as well. We currently, I believe, have 9 or 10 licensed transporters. I think that's a small enough group that we could get them all into the room at one time. And continue to gather some information and feedback and hear from them. So again, looking ahead to the calendar, again, I know that's one we had talked about. Certainly invite my colleagues to think of other opportunities or other groups that we might want to have conversations with, but certainly invite some conversation around that. Commissioner Wright.
Thank you. And, it's great we're meeting with license types, but this suggestion was brought to me. Perhaps listening session with the Cannabis Advisory Board, because we're kind of siloed in these different subcommittees and we don't really have an opportunity to all of us to meet and engage with them together. And in all honesty, I feel they do have a little bit of a sense of frustration with some of the recommendations they put forward. So I think this would be a wonderful opportunity for all of us to be in a room, and Commissioner Concepcion, if you're not here watching with us, to meet with to have a listening session with our members who volunteer their time on the Cannabis Advisory Board.
No, I think that's a good suggestion. We are siloed. We're each kind of assigned to, particular subcommittees. Certainly we can listen to the full meetings of the CAB, but I think having, to your point, more thoughtful conversation with the members of our CAB, as you pointed out, they're volunteers that contribute their time and their expertise. And, we also are anticipating the arrival of our new ED, who actually steps in as chair of the CAB. So we want to be mindful of that as well when thinking about scheduling. But I do like that idea. Listen, again, just some other thoughts around our 2025 calendar. I fully anticipate, we're going to wrap up our work on governance. I do want to thank my colleagues. I know you've been working to help resolve and flush out some questions around the remaining pins that we have, and we hope to get back to that soon. As we also look ahead to 2025, I do want to build in some time for us to discuss policy work. We will already be doing some regulatory work around social consumption. I would like to all of us have and consider the opportunity to review, update, maybe think about modernizing some of our other regulations. You've heard me talk about badging requirements. I know my colleagues have also talked about other regulatory requirements. I want to put a caveat on that is we realize regulatory work requires time of our staff and resources. That's been evidenced by the additional work that we're still completing around Chapter 180 even. It's not a flick of the switch process, in terms of, voting to change regs, but we know behind the scenes, there's a tremendous amount of work that goes into it on behalf of our team. But I also believe our team should have the opportunity to share their insights with us because they live and breathe these regulations on a daily basis. So again, inviting any conversation or thoughts all of you might have, but that's what I'm looking ahead for with respect to our 2025 meeting calendar. Commissioner Mark, go ahead.
To your question, I agree with all of the commissioners' comments. And I think I said this earlier, sounds like Celia will start working on a charter for the working group. It sounds like you, Commissioner Stebbins, mentioned that, we would be hosting a conversation for our equity space. But I also want to like caution us, but also being mindful that every time we have these listening sessions, everything comes up. And it overwhelms the industry, it overwhelms staff, it overwhelms us in the sense of like, how do you grab this octopus, right? And what do you work on? So, and I found that with the outdoor cultivators listening session and the lab session, right? There were some things that overlap and some things that were like, how can we change this? How can we change that? So I think, this is helpful, and I know we're going to talk about it next month, but I think we need to think again strategically, right? So I know our executive directors will be here soon, and we're, doing everything we're supposed to be doing, but strategically for us, we should think about what are we going to focus on, right? As individual commissioners, also as a team, and then what's the priority for next year? Going through the regs, when we were going through the testing lab agents, two agents in a car, it made me think that, one exercise that we've never done, because I mean, time is crazy right now, but it's like literally sitting in a room. It has to be a public meeting, obviously, but sitting in a room, going through all the regs, not just like, chapter 180 or social consumption or whatever, but it's like, we've never been able to have that open conversation, like all of us, and sort of visit the regs, so it just makes me think, right? So like, it sounds like we got third-party transporters, sounds like we got medical stuff, outdoor cultivators, labs, right? There's already, SDP, EEA, there's already 5, topics with exclusivity period. So I don't know. I just, for me, I always think like big picture, like time flies at the commission. So it's like, how do we want to spend our time next year as a team, in terms of, moving stuff forward. And I think the hard part too is that I think we're pretty open right now on what everybody's working on. But I think it'll be helpful for us as individual commissioners to, maybe work with our chief of staff from now into the beginning of the year to say, hey, Andrew, this is what I'm interested in working on, or this is what, so that you can then put a plan together and say, hey, Commissioner Camargo, you know what, why don't you partner? Commissioner Roy and I, as a matter of fact, we just had a great conversation this week. We're going to be partnering up on public awareness for social consumption, right? So, we pulled her in so that we can collaborate on that and work on it. But I think sometimes it's really hard to do. So I just think that in order for us to move the industry forward, and I know we have our new general counsel, and I know he's working on his things to do list, but I don't know. I think big picture, strategic, and forecasting, because our time is limited here as well, as the sitting commissioners right now. So.
No, it's great points by having this conversation today, and we're trying to think about how we look ahead to our calendar for 2025.
Yeah.
I just want to see us do a little bit more than or just regular business meetings. But as you point out, set aside some time, to work with our staff and maybe have some more strategic conversations.
Yeah.
I see these listening sessions, as you kind of alluded to, is where are some crossover impactful things.
Yeah.
And we're only 6 years into this industry, as we saw with micro businesses, we saw with delivery. There are some things I think we need to update, some things we need to modernize. We need to collectively have that conversation.
And if I can, Commissioner Stebbins, the other thing too is that, like, this stuff is, we're in public, right? Like, and we have to have these conversations all the time, but like, we're also allowed to have a public meeting just for ourselves to talk about priorities and strategic planning, and not even sit like this. I've vocalized this so many times, like I hate sitting like this, so it's kind of like, we can't be afraid to do our own thing, and have conversations, because what I've realized the past year, maybe year and a half, is that, maybe 2 years, we've gotten a lot better as commissioners to talk, making sure that we're using these public meetings to have more open conversation amongst the work that we're doing. So I just think there's a lot of topics at hand. The industry has been waiting for change. And, the first cohort of commissioners, God bless them, they had to put a lot of things in place that no longer work and they're bleeding people's pockets. And then everyone's looking at us like, oh, you can have a magic wand and you can take this off. So that's why my thought of like, why don't we lock ourselves up for 2 days in public and go through the regs line by line? But that's my spiel, because you asked for it.
No, it's a good spiel. It's
Yeah.
why we have these conversations in our public meeting.
Yeah.
Commissioner.
Thank you, Jared. Thank you, Commissioner Camargo, for your sentiments on that. And we do need to take a holistic view at all the regs. But I feel there was a lot of advocacy and we got delivery in a good place for the foreseeable future. Micro businesses are in a good place. Telehealth for patient access, although there's more work to do on the medical program. So those are all, I think, in a temporary good place. You're right. So,
I'm gonna wave like this.
Yep. But testing is always on the forefront of my mind. I'll be looking at that, working with our team, and some of the information. And I think a big thing with these listening sessions, our folks are appreciative of the opportunity to communicate with us, and the communication piece is huge. And some of the progress is not always regulatory in nature. And what I mean by that is, I know the ITLs have been asking for regular meetings. And we started with this listening session, but working with INE, there are going to be regular quarterly meetings with the ITLs. I think Armin, is our acting, training person and responsible for training. I think, so progress can be made in a non-regulatory way. And we're seeing that here. And I'm so thankful to Chief Kamalo and her team. They've been incredible. I've had so many meetings with them and all of our teams. But so some is regulatory and some is non-regulatory. And that's the importance of these meetings. And you're right. I wish there was a magic one.
And we talked about this, Commissioner, is that I want to make sure that I know Commissioner Concepcion wants to say, I'll just say this last thing and then I'll pass it back to the chair, is that I should be mindful that we're not having listening sessions to have listening folk. That we're not having listening sessions to have listening sessions. Come on, let's put some action in place, right? And some plans and stuff like that, because listening sessions are great, but not if we don't take the information and go back and roll up our sleeves with our team and say, hey, how do we change this? So.
It doesn't need change.
Correct, yeah.
Right. Commissioner Concepcion, I'm sorry, go ahead.
It's okay. This is what happens when I'm not in person, so it's okay. I have sort of a few comments. I'll kind of generalize it as being sort of a two-prong comment. One is, we have to talk about vertical integration.
Oh, yeah.
Mm-hmm.
This is something that has been, constantly referred to, discussed at several different, conversations I've had, at some of our listening sessions. I know our chief of staff has been really active in terms of communicating with the medical community about that as well. But I want to put that up front as something to potentially have a session around exclusively, because I'm thinking about the way that we view sort of the Cannabis Control Commission, the future of not only the agency, but the future of the industry as well, as it relates to us locally. So, understanding that there continues to be a conversation ongoing about potentially having federal legalization in the future, knowing that, some medical patients are disadvantaged because they do not have access. We also are not allowing a lot of people to enter that as business owners because they do not have that access to capital that allows them to have every segment of every license type that's required under our current requirements. So I wanted to say that's the first prong. I think that, that's something that's really important. I know I've said this in a number of meetings myself. I've talked to Andrew about this as well, but I think we should really take a concentrated effort to focus on that in the very near future. So that's one thing. The other thing that's on my mind is there's a lot of issues like this that have overlap with the legislature. So that's one of those things. And I think, Commissioner Roy, you referenced another regulatory change. You were talking about the legislative outreach strategy that would also incorporate and require some sort of legislative action. And so my other recommendation is, when we're doing these hearings, there needs to be an effort, and I will say this to the government affairs team, to make sure that we're doing that outreach to the officials who represent those districts, to make sure they know that we're there, so that when we have our conversations with whoever at the State House, we're not reiterating the information, because they have the ability to come, they know we're in their district, and they understand the issues from their constituents because they had an opportunity to be there in person. So that's one thing I also wanted to say, just, be mindful, and we need to make sure that, it is a collaborative effort, and we are engaging more so that people who are representing these areas have a good understanding of the issues and have an opportunity to come and hear us in person as well. So those were my comments.
Absolutely.
Thank you, Commissioner. Appreciate that. Yeah, I said it at the outset. This is why I respect and appreciate all of my colleagues and this level of collaboration. It's great to see. What? It's the right way to say it. Stop. All right. Thank you, colleagues. I greatly appreciate it. Any other comments on the question about 2025 calendar? Again, we'll have an opportunity to talk about this more at our December meeting. The next agenda item we can move on to. Oh, that's its own slide. Go ahead, Commissioner Camargo.
Yeah, thank you for bringing it up and putting it on the agenda. It's helpful.
Appreciate that. All right. This next item is a legislative strategy working group. Again, sponsoring this item as well. I'll be quick with this one. Commissioner Roy and I will be creating a legislative strategy working group. The purpose of this working group is to build off our legislative and executive branch outreach strategy that was formulated by our colleague, Commissioner Concepcion, and seek to offer our assistance and support to the legislature on policy matters that can continue to help effectuate the mission of the commission. I appreciate Commissioner Roy's interest in working with me. Our legislative branch and executive branch outreach was really created to allow commissioners and staff to help speak as one voice on important policy matters. I just want to bring that same collaborative effort as we look ahead to a new legislative session. Conversation has been great here today. Commissioner Roy brought up the issue of reciprocity, which might be part of that agenda, but this is just to kind of kick off the formation of this working group, and we'll be back in front of the commission when we have items to bring back to everybody to address. I don't know, Commissioner Roy?
Forward to working with you on this, Chair Stebbins. And I think this is really timely. And the reason I say that is it's building off of the outreach, and thank you, Commissioner Concepcion, for that, for the outreach, strategy that we have. And having this working group can bring things that are ripe to bring before the commission. And an example of that is I had the opportunity to speak Friday, as I had mentioned earlier, at Holy Cross. Chair Donahue and Chair Gomez were there for my portion of the presentation, and I listened to theirs. And Chair Gomez, somebody asked him about ownership and control limits in Massachusetts, and that came up last legislative session to have that lifted, and that's in statute. That's nothing that we can do. But what Chair Gomez said is we want to hear from the commission on this topic specifically. So they want us to discuss it and determine whether or not we support keeping the caps in place, the ownership and control limits in place, where you can only own 3 of a particular license type. So the legislature asked us to opine on it, so I'm putting that on everyone's radar.
Commissioner Concepcion.
Thank you. I wanted to just get a little bit more context in terms of what the working group was responsible for. How does it differentiate itself from the government affairs team, and who would be a part of the group? Just, sort of a more thorough breakdown in terms of what to anticipate and expect.
Sure, great question. Thank you. We've had a quick we have had a conversation. Shouldn't say a quick conversation. We have had a conversation with our government affairs team. We will next build out the working group charter to see who all the players internally will be part of that team. And we hope to do that over the coming weeks. And then think that does that answer your question?
Not somewhat.
ahead.
I guess I'm asking
Okay.
what is the purpose? Sort of what does it change? Like
Yeah.
what happens now?
Yeah, no, great question. I see it as building off again our legislative and executive branch outreach strategy. How can we bring issues forward? You know, we've talked about 2 here today. How can we vet those, bring those back for full commission consideration, and kind of doing it in a timely fashion, especially as the new legislative session is about to kick off. But certainly Commissioner Concepcion, because you were the architect of that original strategy, welcome your thoughts on folks that should be part of that working group. But it's really to bring those type of topics back for the commission to consider, vote on, and to follow the process of then giving us the opportunity to kind of speak as one voice as a commission on a number of topics, and we should weigh in on what those are.
Really quickly, 'cause
Yeah, Commissioner Camargo.
Yeah, Commissioner Concepcion, may I as well? Because I know you're thinking. But I had the same question that Commissioner Concepcion had, and you know, I don't know, maybe we talk about it a little, maybe in another meeting or something, just because I have a lot of questions about this. First of all, I think it's great. I think we need to be closer to the State House and have conversations, both local, you know, state government, local government, federal government. So this is great. But I think it's sort of like, okay, what's the difference between this and what we already have in place, which is our legislative process here. And I was talking about medical reciprocity earlier in terms of, you know, when do we put that through our legislative process so that we can vote on it and then be able to, you know, advocate or send a letter to the State House. I don't want to assume, but I'm assuming that this legislative strategy would become another layer to that process internally. But it sounds like you guys want to think a little bit more big picture around other issues, because it almost, I don't know if it's almost the same thing. Are you guys trying to revamp our process that we have already? Or is it just to create more of outreach and education on everything cannabis? I mean, we have the state of cannabis that was created a couple of years ago. We have the legislative process internally. So I just don't know what this is yet, but we don't got it. Again.
Yeah, no. It's a great question. My intention here is to build off that legislative process, but I haven't seen that we've had a mechanism for how do we bring up issues? How do we talk about issues? How do we weigh in? And by the way, research something fully before we bring it back to the full commission to endorse it, bless it, vote on it. So again, we have that unified voice.
I'm lost, Commissioner. So you're saying, because I feel like we already have that, right? Like if we have a legislative topic right now that we want to bring to the commission, we sponsor it, we talk to government affairs, talk to the chair, and then bring it on the agenda. So I feel like that's the strategy that we had internally.
Right.
But are you all talking about, I don't know,
It's still building off that work, but it's trying to make it one a little bit more efficient. I also think obviously with the start of a new legislative session is another good time to begin to weigh in.
I see.
But it's in my mind, it's doing it in a little bit more coordinated fashion. It doesn't necessarily require just one commissioner to kind of lead with it.
Yeah.
But it involves folks in the working group that would be part of the entire team.
So I'll just say this for me personally right now, I can't see it. I don't understand it. I don't understand it 100%. And my hamster's going just because I've worked in politics and now in policy and strategy and everything else. So I don't understand it right now, but I think what will be helpful, not that I don't understand it. I know you guys can't say too much right now because you're going to work on it and work on the working group. But I think if it's a legislative strategy for the commission, you know, maybe come back to, you know, to the two of us that are not in the working group and kind of maybe give us an update of what you all are thinking, or once the project charter is done, so that we can understand it. I'm 100% like, let's do it, but I just want to understand what it is, because it sounds like, we already have a process, but it sounds like y'all want to make it a little bit more effective, or just give it a, a fresh.
It's a little bit of giving it I don't want to call it a refocus, because you're right. I think we have a great outreach strategy in place. For me, it's always been, how do you get to that point?
Yeah.
How do you get to, here's an issue, let's talk about it. Have we thought about it? Have we researched it well?
Yeah.
Now let's bring it up. And again, we don't address particular bills. We just
right.
lay out a policy approach.
Right.
My thinking is, with the new legislative session about ready to start, it'd be a good time to reconsider some of those issues. And some of those things that collectively we want to weigh in on.
Yep.
And, the outreach approach, I think, has given us a great roadmap as to how we do it. It's that kind of behind the scenes teeing up issues, researching those issues, and presenting them again for the full commission to consider, that I want to kind of formalize the internal working behind it a little bit. So, but I hear you.
I look forward to more conversation.
Yeah. I appreciate that. Commissioner Concepcion, go ahead.
Thank you. I'm this is an opportunity to kind of go through our thoughts together. It sounds like it's an additional pass through. So I have a few things in my head. I know you and I had a conversation, and the importance of you leading some discussions as our chair. But you also have the ability to vet and create that agenda. So understanding and determining sort of what is right for a conversation and what isn't. The other thing that I am a bit concerned about is when it comes to open meeting law. So let's say that I have something in mind that I think that we need to take up. I don't really know how this construction would operate, because I then can't walk, I can't enter the working group. I can't give you like my work product. I'm trying to understand how this works, and I just see some complications.
Okay, fair enough. And again, with your work on our outreach strategy, I appreciate that input. I think where we can leave the conversation today is we'll pull together the working group charter, which we need to do, and give all of us a chance to look at that before we start to formalize it. Would that help?
I think that would help. I think it would also help to just really pinpoint what is the need? What is the need and what is the utility? I know in the past, commissioners have, diverted from our strategy, but as the way that it's outlined, I do think it works. So I guess that my question is sort of, what is the improvement? What are we trying to see as the improvement? And I'm also just thinking about the fact that each of us are, we're united as a commission, but we're all individual commissioners. And it sounds, and maybe that's just the way that it came off. It sounds like in order to get something presented on the table as a potential topic to bring up and discuss, it has to go through this working group. And if it's not going through this working group, are we then utilizing the same people, externally, if you're a commissioner who's not a part of it? So I will welcome the opportunity to see the charter, but I'm trying to envision this operating in reality.
Yeah, and certainly my intention is to not leave any commissioner voice out of this effort. That certainly isn't my intention. Again, for me, it's building off the great strategy that we do have, as I said, giving the entire commission to speak as one voice, which was, for me, the overriding goal and the great crux to the work that you did to create the outreach strategy. But thinking through how do we vet issues completely and thoroughly? How can our internal team help do that? But again, like to leave the discussion with happy to pull the working group charter together and give all four of us the opportunity to look it over. But I'm being mindful now of the start of a new legislative session, some issues that I think we want to proactively weigh in on to help effectuate our mission. The license cap issue for discussion, the reciprocity issue, things like that. So it's not, certainly don't want to design it in any way that excludes any commissioner's participation or ability to raise a policy question.
Can I just say?
I don't have additional comment. I'm just listening now.
Okay. Commissioner, come on.
Yeah, no, first of all, thank you for bringing it up now, because I think that this is exactly what we need to do, is kind of like understand what you're trying to make it. And maybe it's even the title of it, legislative strategy working group, because it's kind of like we already created a legislative strategy internally for topics. So maybe this is like a legislative, strategy group, something else. But I think it's almost even the title as well, because when I look at it and when I hear you, it's like, well, we already have this, but I know that we have limited time today as well, but I think because you two are sponsoring it, I think it'll be good to kind of get your thoughts together after our feedback. And yeah, like go at it. But I hear you in terms of getting some stuff together for the beginning of the year for legislative process.
Thank you. And by the way, the feedback is appreciated.
Yeah, of course.
So let me just pose a
Go ahead,
question
Commissioner.
to my peers. When's the last time we voted on anything that required legislate? When's the last time we asserted that?
Yeah, we haven't done it.
Yes.
Since we did whatever the last one was.
Right, a long time ago, and it was around veterans.
Right.
So
Last year.
I guess maybe based, on if the working group comes up with a plan on how we better utilize the strategy, and we all do it in public. So maybe, maybe every other month, we have a legislative strategy section on our agenda that we all talk about it in public. And anticipation of the new legislative session, or filing the budget, or making sure we advocate for social consumption, public awareness. And we do it in public, but we haven't utilized it, I think, to its fullest capacity, because we can't even remember the last time we used it.
I
think we missed.
I think
we missed opportunities. Like we've missed some opportunities because we're super busy. We had Chapter 180, stuff gets busy. So maybe if we put it in
I understand.
So maybe we can use it more.
I understand. I know. I'll go after Commissioner Concepcion.
Go ahead, Commissioner.
Thank you. So the way that it's happened in the past is, you say you want to sponsor an item, you talk to the chair about it, you work on it with the different teams here, and you develop that information, the information you believe will be helpful to the entire commission in understanding why this issue is imperative. I don't think the amount of times that we've voted is an indication of even under utility, because any of us, if this is really a priority, you take it on and you do the work, and then you bring that back. But that also, when you bring it back, it's a public conversation. It's a public dynamic. It's all of us receiving that information, all of us having the ability to ask questions, all of us seeing the work product as well, and so we can have an informed conversation and have an informed vote about it. So I guess I'm really trying to figure out how this improves the process.
Yeah, and again, it's creating that internal working group in this period of time before the new legislative session starts, to think through what some of those priorities are. And again, I hear your comments, and I want to build it out in a way, again, that all of us participate in the
Yeah.
conversation and raise
Yeah.
the topics.
Yeah. So if I can, to Commissioner Roy, I
We're changing this up.
we gotta change it up a little bit. But I get it. I understand. I understand now. And I think to Commissioner Concepcion's point, it's not that we've underutilized the process that we have now, is that individually, we haven't had a conversation about, not individually, but together, we haven't had conversations about the next legislative issues that we're looking at. So I don't have anything on my plate right now in terms of anything legislative, right? So I haven't brought it to our process. None of us have brought anything to our process because we were working on everything else. So it sounds to me, and I understand it now, thank you, like a little bit better, is that, because I know you made the comment of like, oh, we haven't used it, or we haven't used our power.
Yeah.
It's not that we, no. Yeah, we've used it because the last one that we did was the veterans, but I don't think that's anybody's fault, right? Yeah, it's no one's fault, because any of us could have brought any issue since the day that we voted on the veterans. But I think that what it sounds like to me is that you are going to think about how do we all four have conversation on what the next legislative priorities are for us to either bring through the process, vote on it, kind of what I was talking about earlier, right? The 2025 strategic plans. I mean, strategic priorities and stuff like that. So, I mean, I have faith. I know that this stuff needs to happen. So, I mean, I think when you guys go back and work on it a little bit, I think it'll be helpful. But now what you're saying, I hear it a little bit more and understand it, and I'm supportive. Yeah.
Commissioner.
Yeah, and another thing is, based on the current system, we have one gatekeeper who determines. And someone could put a lot of work into something, but one gatekeeper can keep it off, and they limit the opportunity to talk about it. But if we are able to bring stuff like reciprocity and ownership and control limits publicly, then there's four of us and not just one gatekeeper who can, like, I could have researched something for 6 months and one person can say, nope, not on the agenda. But if we are able to have the opportunity to have this discussion, then the group can say, well, no, we don't really want to do that right now, but it's the groups.
Yeah, we can vote on it too.
Yeah.
But sorry,
Go ahead.
what you're saying adds to the idea of having a public conversation by creating a working group with 2 commissioners on it. That also creates its own sort of silo as well. And I think you're referencing the chair's role, but that's why we have the chair, because ultimately the chair still has, the authority to figure out what goes on the agenda and what doesn't. The other thing is, it is really important that when we're having conversations, when there are, there's those engagements at the State House, that the chair is front and center on these as well. So, Chair Stebbins, you and I have had this conversation, but I just want to reiterate that about your position and making sure that not only are you identifiable, but you are the clear voice when it comes to speaking about the commission and on the commission's behalf too. The other thing is, so it sounds like this group would vet the issues.
No.
So that's what I'm getting confused about. It's like, so we come together, I say this is an issue that should be considered during our public meeting, and then Commissioner Roy, and then what happens after it's discussed in public with the 4 of us?
Well, I think the legislative outreach was the 3 out of the 5, if we're at full strength, need to vote in the affirmative. Or
no, I'm asking how it works with the working group.
I was asked to join Commissioner Stebbins' group, let me just say that, so I don't have all the details. But what I recommended is that the working group come back to us and with how do we be even more effective, and how do we optimize this strategy? And the governance charter says the chair isn't always the top voice, and so all of us have a voice, and
No, no, no,
But one
I'm sorry, I'll
person-
be more direct. I want to figure out how this works in reality. So you mentioned that we would have this public conversation. We would talk about the issues that we believe should be brought forward. And then what happens?
And then somebody can sponsor it and do all the, bring it back to
Yeah, just to,
agenda setting.
just to chime in, Commissioner Concepcion, again, thinking about opportunity to present issues, but also kind of the behind the scenes work, like what's all the information that we need to consider? Do we have the data? Do we have,
So Chair Stebbins,
solid? Yep,
that-
go ahead.
so that is what would happen after. So let's say I throw out something. This is something I think should be a priority.
Right.
Then you take it back to the working group and then say that go ahead. What was the next part?
Yeah, no, the opportunity within the strategy working group is what's information, what's documentation that we need to have to flush out the conversation for all of us at the public meeting. Do we have the data to back up a lot of our arguments? So again, hopefully give us a little space and when we pull the working group charter together to kind of flush it out a little bit more, but that's how I envision that group.
So if there was an issue that I, had in mind, I then cannot work on that. Like that then becomes a product of the working group. That's not.
Can I ask a question to clarify
Yeah,
Commissioner Concepcion's thought and your point?
go ahead.
'Cause I think what it sounds like, and again, you guys are, you're just introducing this for the first time, right?
Yeah.
It is not that this working group becomes the process and how we talk about legislative topics. It sounds like this group is gonna go sit somewhere, work on a project charter, think about how to use the process that we already have so that all four of us can talk about legislative issues together. And then like, hey, guess what? I wanna do, this for medical, right, whatever. So it doesn't sound, because Commissioner Concepcion asked if then we have to work through the working group. It sounds like to me, and again, you guys have to go back and think about it, but it sounds like the working group is not going to be a permanent group. It is a sort of think tank for how to not effectively, but how to sort of think through the beginning of the legislative year using the process that we already have, but then coming back and talking about it all together versus, me talking to the executive director and to you, Chair, Commissioner Roy talking to you and the ED, and then us individually sponsoring stuff and putting it on the agenda for the legislative process. So, right, that's what it sounds like. Okay, so and Commissioner Concepcion, every question that you're asking, that's the sort of, I was on the same wavelength just because obviously this is the first time that we all hear it, but I don't know if that clarifies the question that you asked, but
I think you're saying something and then what I heard was something else. So I hear
you're
what you're
right.
saying.
Yeah, I heard what you heard, but it sounds like as well that this is just a working group to figure out how to have a better conversation about some of these issues and bring them to the forefront, all of us together. So technically, example, I don't know, I'm throwing ideas out here, is, the month of January, you guys have come back, you've thought about a way and you put it on the agenda in terms of like, hey, this is how we may want to approach these issues. So I know you have to get to work on it. I just think take back some of the comments and, recommendations so that we understand it.
No, this is, again, the only opportunity we have.
Yeah, it's okay.
About this stuff.
This is important.
Public meeting.
Yeah.
My interest in this was starting a new legislative
I get it.
session. We know that there are issues that we could be asked to address. We also know that there are issues that I think we want to be proactive and weigh in on. The reciprocity piece is, just another example. But it again is not meant to in any way stifle conversation, leave commissioners out. It's to kind of just build I think, as you said, Commissioner Camargo, this point in time of the new legislative session, how can we have our voices heard more proactively?
Yeah. And this is a perfect example of like two commissioners having this conversation and then two commissioners being new to the conversation, but also knowing that we have so much stuff already in place and I understand it now. And it's, again, it's the first time that we're talking about it. So we just got to talk it through and figure it out. But here's my quick question.
Yeah.
What's your expectation for this legislative strategy working group discussion meeting? Like, when do you think you would come back with a project charter?
Hope to do that by our December meeting.
Ah, okay.
Yeah.
Okay.
Commissioner Roy, go ahead.
Okay, thank you. I think today was a microcosm of what is trying to be achieved. Commissioner Camargo, you brought up reciprocity. Commissioner Concepcion brought up vertical integration. I brought up license caps, ownership and control. These are things that may involve the legislature. And I think this just, the fact that instead of going through one gatekeeper behind the scenes and some things might never see the light of day, by talking about it in publicly and agreeing upon it in publicly, it also lets the industry know what we're focusing on and the legislature, as opposed to behind the shadow of darkness. Let's talk about it in the light. And so folks know, and the legislature knows, and people know what we're working on. So I'm just saying, take it out of the shadows, bring it into the light, and let's have these conversations can get awkward, but they're worth having. And I think it's better off done in public.
Can I just say, let's not say take it out of the shadows, because then people are gonna run with that and think that everyone's in the dark. Just instead of having individual conversations with the chair and the executive director, we have a full-blown public conversation.
Yes.
Because no one's in the dark about legislative priorities.
Yeah. Can I offer a comment?
Of course.
I think you're right, Commissioner Roy. I think that's a separate comment though, than the establishment of the legislative strategy working group. That was my comment. I just don't,
Okay.
I think they're two different things. You know, one is having the ability to have an open conversation, public facing, so people know, that this was a request, this is what a priority is, so on and so forth. And then we have a conversation about an internal working group.
I'll just leave it as greatly appreciate the feedback. Our next step is, again, to pull together the working group charter, which for folks out there who don't know what our working group charter is, it's usually a proposal to facilitate resources and staff time to focus on a particular topic. So certainly we'll bring that working group charter back to this group. Greatly appreciate everybody's input. And again, the intention here, just to give you an idea of where my mind is at in terms of, kicking off the new year, being a little more proactive when we know that there are some statute changes that might be helpful to help us effectuate our mission. So.
Well, thank you for taking it on.
Thank you. No. Thanks.
Good luck.
It's the only time we have a chance
Yeah.
to really talk about this as a group, and I appreciate everybody's input. Moving on, our last item under commission discussion and votes is lab shopping discussion that our Chief of Investigations and Enforcement is going to join us for. You can stay there. There's the seat.
I think it's.
Oh, is Tim back? Where's Tim? Sorry, Tim, didn't see you behind the pillar.
Tim, come on down.
Yeah. We're gonna take a 3-minute break while our team comes up here and joins us. We'll reconvene at 3:25. Good afternoon. We're back. We have what I believe is the last item under commission discussion and votes. This is item number 3, lab shopping discussion. We're joined by a whole slew of our team. So I'll invite you to introduce yourself. We'll start with Chief Kamala.
Thank you, Acting Chair Stebbins. Do you want us to go around the room? I'm sorry, with the introduction.
Just introduce yourself and we'll hand it off.
Yes, I am Nampolisi Kumalo, the Chief of Investigations and Enforcement here at the Commission.
And thank you, Acting Chair. Good afternoon. My name is Tim Gooden. I'm the Enforcement Counsel.
Greetings, I'm Geneve Hall, the Laboratory and Testing Manager here at the Commission.
Good afternoon, I'm Paul Clark, Chief Technology and Innovation Officer.
Hi. Floor is yours.
Thank you, Chairman. We are here at the INA department and also along with the IT department, we collaborated related to this topic related to lab shopping. We have a PowerPoint presentation today that we'd like to present to the board and also for public awareness as well. What we have been doing across teams at the Commission, we have been collaborating and working together on matters, related to testing, related to licensing platforms, related to even things like medical integration. This is something that we have been talking about for over a year now, and we're currently collaborating. The INA department is collaborating with our Chief of Staff. And then at some point, we're hoping that that's something that we'll be able to present before the board for a policy decision. So I'll hand it over to, I believe, Geneve Hall. She will be the one to present the PowerPoint. And then we'll take questions at the end after her presentation.
Okay, thank you.
Hi, so I'd like to say greetings again. Greetings to everyone in the room, the commissioners, chair. We have an ITL in the room, so greetings to you all as well, and everyone tuning in. I'd like to first thank Commissioner Roy for sponsoring this laboratory shopping matter. It's important, right, and significant. I'll get into it in a minute. So I'd like to.
Can you pull your microphone?
Oh, sorry. I'd like to thank INE, EC, and their support for all the work that we put in collaboratively to do this proposal today. All right, so as we continue our efforts, right, towards standardization, and we consider all the changes that need to be made and consider all the steps that we've taken so far, we're here to propose a policy that has to do with laboratory shopping. As a result of our ongoing and continuous dedication to the Commission's mission, to the community, to consumers and patients, we continue our work with standardization as it pertains to our laboratory processes, as it pertains to our regulations, our protocols, our testing schemes, our testing process. We continue our efforts towards standardization to improve on these systems, right? So we have systems in place, but because of our ongoing process of consistently reevaluating these tools that we have and these measures that we put in place, we're here to propose laboratory shopping and all the areas surrounding that. So with laboratory shopping, this specifically impacts our regulated products in the market. With laboratory shopping, this specifically impacts our patients and consumers. And so as we move towards standardization, we have to think about ways that we can effectively or significantly improve our management, our compliance management tools that impact our regulated products that we provide to the industry through testing. So today specifically, we're here to address laboratory shopping. I'll get into that in terms of what it means and what the notion of that is.
ultimately, we're here to ensure that our processes, our procedures are geared towards supplying, making available only adequately tested products to the market, right? We're here to ensure that we bridge a gap and we provide information and we preserve confidence to the community, to our patients and consumers as it pertains to our system that we have employed and will continue to effectively improve. So today we're here to address a proposal that we would like the commission to discuss whether the commission adopts a industry-wide practice of a la carte testing. And this a la carte testing leads to laboratory shopping. And this is among the marijuana establishments and the marijuana treatment centers. If it is adopted, the proposal, the policy, the ITLs, or independent testing laboratories, would be subjected to this change. The testing facilities in the counties of Duke County and Nantucket would also be subjected to this policy change as applicable. Before I get into, the thick of what we're doing, why we're here, and about the policy, I would like to point out that, we have several components, several pieces to our compliance monitoring system, right? We have our regulations, we have our guidance, we have, in terms of standardization as well, right? So we have our licensing team, we have our AC team, our enforcement council team, we have our testing team, and all of these areas contribute to an effective compliance monitoring system. And so when we talk about standardization, today specifically, we're going to target laboratory shopping. And that's specifically with the notion of a laboratory, a licensee using a particular testing facility for a desired outcome, right? And we see this as a result of several things. But before I get into that, I just want to say we're here because of our ongoing assessment and reevaluation of our protocols and regulations. We're here because, we've done research and we're looking into other jurisdictions and we're seeing how we aligned or where we're not aligned and where perhaps we need to close that gap, right? Bridge that gap. We are listening to our external constituents, and that's our licensees. That is our ITLs. When we have discussions, we have our listening sessions, but that was more recently. We consistently communicate with our ITLs and we get feedback from them. We get feedback from the ITLs. And also, I'm a part of the testing team. And within the testing team, we resolve metric cases. And I'll get into the metric system in a minute, right? So because we are on the field and we are assessing and looking into these metric cases and we're resolving them, we get a firsthand experience and firsthand knowledge of all the shortcomings, all the limitations, or the effectivity of this process and what we need to improve, and what is the most frequent issue related to this system, related to how the licensees are maneuvering through this metric system, which is our seat-to-sale system of record. We get to see firsthand what are all the issues that are impacting this process and the functionality or other limitations that has to do with the functionality of the system. So ultimately, we are here to just ensure public health and safety. We're here to make sure that, with our ongoing evaluation of our compliance monitoring systems, that we always visit these practical functions that we have, the tools that we have. And so although today we're speaking specifically about laboratory shopping, that's just one piece to the puzzle, right? But it's a significant piece to the puzzle because it's directly related to and impacting our tested products, our regulated tested products for adult and medical use, and it's directly impacting patients and consumers from Massachusetts. And so I'll get into that with that said. So as I said, we're here to propose. I'm here to address a proposal to the commission. And the background to that is that, all the products that are sold in the adult and medical use market are required to be tested by independent laboratories. And all of this test and data that we collect are housed, manipulated through our seat-to-sale system of record, which is called Metric.
In this system of metric, we track and trace all our regulated products from seed to sale. And according to our regulations, which is 500 N35 CMR 500 and 501, and specifically in 500 160 and 501 160, it clearly states that all of our regulated products must be tested prior to them being sold or transferred throughout the system. So it is important that we address metric, right? And all the functionalities, or if not all the functionalities, all that we are aware of, it is important that we continue to reassess the system, because this is how we conduct auditing, right? This is how we gather information. This is how we manipulate and pull reports and so on related to all of the tested products in Massachusetts. We had a configuration project back in 2021. As you can see off the slide, I might not go word for word off the slide, but we had a configuration project back in 2021. And that configuration project was basically to establish laboratory test batches within the metric system. And the reason why we employed that system was because prior to that system, we always had our testing requirements, but it was not organized or categorized in a way where there are safeguards to effectively prevent products from being test passed and transferred and sold, right? So when we talk about things that are effective, at the time and what remains now is that we allow our licensees to conduct a la carte testing, which is that they can submit a full panel and it can be broken down into different subsections, and they can submit it to several or 2 or 3 laboratories. And in doing so, you end up with a series of data sets. You end up with a series of COAs. And it makes the auditing, it makes the clarity of information, it makes that challenging, because for the circumstances in which you have several data sets pertaining to the same product, pertaining to the same batch, unless you have distinguishing features, distinguishing functionalities in metric, a lot of the information get lumped into one picture. And it is not to be considered that. Context is very important, right? So we installed laboratory batches, and what that did was to ensure that for each product type, you have testing requirements. And the system will not allow you to proceed with any form of transfer or sale unless all of the required tests are fulfilled for that particular batch type per category, per product type. If I lose you, let me know and I'll clarify, right? So you have the batches, the lab batch test installed. And so you have raw plant material. There are a series of tests that needs to be fulfilled in order for this, and it needs to be passed, right? In order for this to be transferred or sold. You have different product types, concentrates, raw plant material, and so on and so forth, right? All of this is available, just a side note, all of this is available in our protocols and our exhibits. The information pertaining to that are available on our website, right? So within the system, we find that although it was effective, right, and it remains effective, it is not optimal. And it's not optimal because we are not using the system as intended. Through our research and going back and forth with different jurisdictions and even metric, we were informed that out of the 23 states that utilize our metric system, we are one of 2 that continue to allow a la carte testing, right? So although our systems are effective, although they work, there are items that could be, or functionalities that could be optimized so that we can extract specific data and have it be accurate and reliable. And most importantly, we are able to have reproducibility, right? So when we know that we have data and we're trying to do audit, all these things are important. And so right now we have a system where, although, yes, you have safeguards in place to prevent that transferring, there are ways that I will get into that there are loopholes where if the system doesn't catch it, right, it would be a matter of an audit. or it would be a matter of investigations and so on. So we're trying to employ as much safeguards as possible because that's why we revisit these protocols, right? That's why we revisit these systems, because we see where it doesn't work. And like I said, you know, that the testing team, we consistently see these issues or see associated issues because we're resolving metric cases. And the metric cases are directly tied to the issues that are associated with product being hung up, and they need to be passed, meaning there needs to be an additional consideration, whether the processing of the sampling or they didn't, or there are several test samples out, or I will get into the examples of what can possibly lead to a test sample being hung up in the metric system. But basically, the lab test batching improved our systems where it's no longer up to the licensee to choose which test they want, right? There are test requirements for a particular product type based on a category type, and it has to be fulfilled. With that said, because we still allowed a la carte testing for the entries that are not populated based on the request made from the licensee to get the product tested by the lab, you have to have a default entry. The default entry represents the testing that the ITL did not conduct because it's a matter of the request coming from the licensee. You see? So regardless, the entries are still populated because that's what the batch testing is based on. You have to populate all of the entries in order to be qualified for transfer or sale. Hold on to that, right? When we talk about embedded action limits, right? This is also another tool that we use such that you can't just enter any result, right? You have to enter a result that's relevant to the analysis that you're conducting, and it has to be within a certain range. It has to be in a certain range so that we can be pinged, right? There's an indication or notification of a failure or passing range, and so that qualifies you for your movements throughout the system. We don't just monitor compliance data, we also monitor R&D data, and that's additional research and development work that the laboratories do, and they're also required to enter that information into the metric system. Our current configuration is as I described, where we still allow a la carte testing, and although it's effective, we do need to use the tools available to significantly improve this process because it's not being used as intended, which is where we come into the lab shopping. So we have a little map here, and we have 1,200, over 1,200 licensees, and at this time we have 13 ITLs. We put that here to basically give you an idea of where we're going, right? So the trajectory is that we always want to have a system that accommodates the growth of the industry, where we're going. We're consistently and have consistently allowed more licensing, right? So we're going to need a system that can keep up, right? That can produce accurate information, that can employ as much safeguards as possible so that the information that we have is reliable, right? So when we talk about our metric system and gathering information, right? We develop queues. Our IT team not queues, queries. They develop queries, and these queries are task specific, function specific, where you're pulling out information targeted to an answer, right? A picture that you're trying to paint. So if the information within the system is not accurate, right? And there isn't context given to the information that we're pulling. Just as I mentioned, the issue with the zeros. When I say issue, I mean the default entry that we employed in the system, because we still allow a la carte testing. If you don't understand that, for example, there could be 3 scenarios in which you use a 0, right? A 0 as a default entry because you didn't conduct the test. 0 because of a true value in terms of result reporting. And then the 0, as we have realized from doing metric cases and speaking to our ITLs and speaking to our licensees, the 0 sometimes represent a passing value, but this is not necessarily the value that they got as a result of the analysis. It's just representing a passing status. So without context and without knowing what's really going on with the functions that are required in metric, the information you gather may be inaccurate. Right? So we move on to the next slide where
Can we go back a slide?
Sure.
So I was really struck by where the circles are, and I didn't realize the lack of geographic diversity where our labs are located until today. Like I never realized Middlesex has the bulk, Worcester County has 2, Hampshire 1, Hampden 3, and Plymouth. So you have counties without an ITL. And I never realized that till I saw this. And then I see 1,233 active licensees. But that doesn't mean commenced operation, right? Because today we heard we have 711 that have commenced operation. So I guess out of that, the ones we're really focusing on are the processors of cannabis. So the folks that are growing it, product manufacturers, because so that's really the subset that we're really focused on. Is that accurate? Okay, and if I didn't know any better, I would swear you guys brought special effects because I'm smelling cannabis. Is anybody else? So I don't know. I think I'm smelling it. But anyway, so I just wanted to say thank you for that map because I didn't realize that where they were all geographically located, and I just want to thank you all for your due diligence around this. And I know you have a lot more to present. But this is such a pressing issue, not only in Massachusetts, but nationwide. And the fact that coupled with, you know, us putting things publicly on our website, right, with potency data, and then eventually contaminants and closing these loopholes. If there are bad actors, we're zeroing in. And that's important. And it's this team that's largely responsible for that. And I want to thank you publicly. I've thanked you privately many times. I want to thank you publicly. And this is just another step towards mitigating bad behavior if it's occurring. So thank you. I just want to stop you and thank you for that.
Okay, thank you, Commissioner White. All right, so I'll continue with the next slide. So when we talk about the inconsistencies, as I've begun to delve into, right, we have that also impacts our COAs. So because of this a la carte testing that we currently have, it leads to having multiple COAs for the batches that are occurring for our regulated products in Metric. With multiple COAs, you have multiple test dates, you have multiple upload dates, you have multiple report dates, right? These are all different. So ideally, we'd want to have one COA associated per batch per product type, right? This is giving clarity to patients and consumers. This is giving clarity to our process. This is giving clarity to the auditing of our information, and it impacts expiration dates. Right. So if we have several COAs with tests being conducted a month apart or weeks apart, a year apart, this is interfering with our ability to enforce our expiration dates per product, right? Because each test date is valid for a year. And so eliminating this a la carte testing would significantly minimize the issues associated with multiple COAs. Then we have, licensees possibly handpicking the laboratories that they want to use for particular contaminant tests. We want to significantly minimize this, right? Because even with this information, it is hard to, or I say there's some challenges presented when we talk about why a laboratory may be submitting several test samples to a lab, right? So like the zero default entry matter, you have several reasons. It is not non-compliant. It's not non-compliant to resubmit a test sample, right? Because you could have a failure. You could also be resubmitting because you didn't submit a sufficient amount in the first place, right? So we allow the ITLs to dictate how much samples are sent with the test sample package because they request the test type from each lab. Now, if you're requesting a full panel, it could range from 7 to 8 grams, right? But if you're not, it's smaller amount. If you have any discrepancy, you're going to have to request more from the same batch to do repeated testing or additional testing. Maybe you want to do R&D. Maybe you want to do something. The point is, when we see multiple test sample packages being submitted to the laboratory, it's not easy to pinpoint why this is happening. Is it because they're lab shopping? Is it because they're taking several tests to see which COA perhaps benefits them the most? When I say benefits, I mean potency, right? If we've taken 3 different cannabinoid profiles and they're submitted, we can choose the COA with the highest potency level, So when we talk about retesting and submitting multiple packages to multiple labs or even the same lab, this presents an issue because once again, just like with the zero default entry issue, Metric is unable to distinguish these issues, right? Metric is unable to distinguish, okay, they sent it in for that reason. The testing team can do that because we are diligent, the testing team. They're diligent, they're thorough, they go through the Metric cases and they literally track and trace, backtrack. Sometimes we back calculate just to help with the licensees and pushing them forward with testing requirements, with our weight requirements, right? Because they don't have documentation to substantiate how much samples, how much the weight of the product they sent in. There is a weight requirement, right? Our batches are supposed to be divided in 15-pound batches. So there are a lot of issues that are associated, but the point is that when they send in multiple test samples, it is hard for us to distinguish without this thorough tracing and tracking what could possibly be the issue. And so these are the things that we say are increased risk. And so if we only permit the laboratories to use one laboratory for their full panel testing, this significantly minimizes these risks associated with these issues, right? Here you have the insufficient audit capabilities. So this is where we're talking about the information that's being gathered can sometimes be skewed because of duplicative data, because of the multiple COAs, because there aren't enough functions that could isolate one reasoning or the other to submit multiple test samples, one reason or the other to have the zero entry in the system, which could also be a default entry, right? Because we allow a la carte testing. So there are a lot of issues associated with or come with the allowance of using multiple laboratories to do a full panel. Next slide, please. Okay, so the proposal that we are putting forth for discussion is such that a licensee would create a test sample and that test sample would be sent to one ITO. That is the standard. That is what we would like to do. However, we know that there are challenges associated with that, or there may be challenges associated with that, right? So the metric system is designed to offer this alternative practice. This alternative practice would be subcontracting. Subcontracting would take place in the event that the designated lab, the originating lab, the lab that received the request for their full panel test is unable or incapable, I should say, of performing the test, right? So when we move to this route, of course, we would get really prescriptive as to what does being incapable means, right? So there would be, for instance, defining criterias, right? So we're thinking you may have limitations with your instrumentation. They may be out of specification. You may require maintenance. There may be facilities issues such as power outage. Now we know that we also have a backup generator reg where you're required to have your system up at least running for 4 hours. I think even if you do experience a power outage, but we're talking about real time. You're analyzing your products, things are down. In the event that you aren't able to get up, this is like a significant issue, right? It could be a conflict of interest. It could be ethical reasons in terms of the agents in operation, and even further into operations, it literally could be manpower. Like you don't have the manpower to do the analysis. You don't have the setup or the structure to conduct the analysis. It also could be a materials issue. Materials mean or refers to supply chain issues, right? So we know that our laboratories have instrumentation, they use consumables and so on and so forth. And when we had the COVID, an instance like COVID, there were supply chain issues. So we want to allow a system where you can come in and say, this is my circumstance, it impacts my ability to do this test, with the understanding that the originating lab is still held responsible for the portions of the test that they cannot take. But generally what we would like is just one testing laboratory used for a full panel. Full panel will no longer be broken up into multiple labs, and which leads to one COA, right? One set of uploading, one reporting, And in the event that subcontractors are used to do the analysis that the originating lab is unable to use, all of this will be funneled through this one laboratory. The one laboratory is the originating laboratory. Information would be funneled through to them, and that particular laboratory is who would upload the results, right? So you have one set of data, one set of uploads, you have one COA, you have a clearer idea of what's going on with the product, with the batch, with the testing. Now, the COA that would be issued with these particular products would also indicate the subcontracting labs used to contribute to the COA. So all information relevant to the analysis, all information relevant to the process would still be indicated in the COA. And now we have enabled a function where we allow licensees to upload the COAs to Metric, right? So prior to this, we would request COAs, and if we had something or an issue to look into in terms of an inquiry or investigation, we'd have to put in an RFI or a request through email. But now we're making things more accessible, and this all contributes to our ability to audit, our ability to gather information, our ability to have reliable information and reliable data, right? We're trying to eliminate, for instance, the default entry of the 0, right? When you have laboratories that indicate or enter a default entry of 0 because of the test they didn't conduct, it has to be accompanied with a note. Right now, our metric system isn't configured where when you extract information, there's not a dependency on the notes section such that that context is captured in the information that you extract. That means it's a possibility of incorrect data. Incorrect meaning unreliable data, right? And if we developed a query to pull this information, it wouldn't consistently work across the board because context is important. All these pieces of information that led to the interpretation, that led to the extraction, right? Because we present an issue with isolating and extracting the information specific to the function or specific to the acts. So because that is an issue, we're trying to just hone in and minimize how many directions we're pulled in. This way, we have a host laboratory presenting the information and all will be funneled through that laboratory. In the event that we adopt this proposal, all laboratories would be subjected to this, but more importantly, this does not impact our testing requirements, right? So our testing requirements doesn't increase because of this change. We would still maintain, of course, when I say testing requirements will be maintained, we are consistently reevaluating our processes. So if it's a case where we need to expand on a testing requirement that we currently have in place, then that will be done, which is separate from this. But right now, if we were to employ this thing, say within the next 3 months or 6 months, the testing scheme stays the same. There are no additional tests because of this proposal, this policy change. It is just another way, a more accurate way, a more effective way, right, of utilizing a tool that is so important and significant to our compliance monitoring system.
Go ahead, Commissioner. And I have a question.
You had mentioned at the beginning of your presentation that Massachusetts is only one of 2 jurisdictions that currently have this option available for a la carte. I think Maine might be the other one. And for historical context, my understanding of that a la carte rule was when the medical program was under DPH, there were 2 labs that were operational in Massachusetts. So in order to keep the supply chain moving along, this was implemented. But fast forward to 2024 and we have 13 labs operational. So maybe the utility was appropriate then and not so now because it sounds like it's being exploited in different ways. And then we have 13 labs to handle, not even counting the labs on the island that do their own thing, but to be able to handle this. So I just want to give some historical context as I say, we're kind of an outlier with this option. So I just wanted to share that.
Thank you for that. That is true. And that is why, as we move forward, we have to adjust our systems to accommodate load, to accommodate the additional ITLs and licensees that we have that are using the system and to accommodate the volume of data that we gather based on this a la carte testing from the industry. So.
I had a couple of quick questions and this slide, and this is really helpful. help me understand as you envision it, that relationship between Lab A and Lab B. How have they built a relationship? How does Lab A assess the confidence that the work they're subbing out, right, to Lab B? Obviously, they have to vouch for it at the end of the day. They're inputting all the data right into Metric. Help me understand how you kind of see that relationship working. It's a small community of labs.
So Lab A and Lab B are similar in that they're all under our regulatory body, right? So Lab B is not a third party that is not already under our umbrella or outside of our regulated system. So Lab B is already in tune, is already aligned within our systems. We're allowing Lab A to decide which lab it subcontracts with in the event that it's unable to, incapable of performing the analysis or a portion of the analysis. So they're all held to the same standard, right? They're all within our regulated, under the umbrella of our regulated agency. The Lab A, that Lab A would have the same qualifying criteria as Lab B. So that's ISO accreditation. They'd be subjected to the regulations, they're subjected to the protocols and all of the guidance documents that we employ, bulletin notices, they're qualified to use the metric system. They're all basically on the same level. It's just that Lab A has determined that they have some level of contracting services with Lab B, such that they can execute the full panel.
Okay. The other question, maybe Paul, you can speak to this a little bit, is there's a deficiency somewhat here in Metric, right? Under the short of these changes, this qualifying field where I don't do the test, they put in a 0. Sounds like a shortfall within the metric system. Is there a possibility of changing that, or how does Metric in states where we don't have this a la carte kind of option, how does Metric work in those states that aren't doing it? Or is there a difference in their platform that they're offering it?
So thank you for the question, Chair. The short answer is we've put a request in to Metric to begin the process for what they call it, we used to be called an engineering service order, but to begin the programming process to make that change, to have a required field that would be indicative of whether a test was actually done or not for each analyte within a panel. That's still an ongoing process, and that'll take a little time to implement. So that's certainly something we're looking at doing, along with a couple other related changes to that. So that's in process already. Whether or not you change the regulations, that's something we've already starting to work on to help address one of the issues. As noted, the other states that, aside from Maine, all the other states have a process that, again, uses this, either it's just one lab, or has a central state lab in some cases, or has this subcontracting capability in it. And the way Metric is built around this subcontracting capability of being able to track, analyte specific tests sent out to one or more contractors. The system could do several labs underneath it, but it is still incumbent on Lab A to be essentially the general contractor.
The repository, right?
They're testing, they're testing to the COA, coming back, they're collecting it. Everything's tracked in Metric as well. So the transfer from Lab A to Lab B and Lab A to Lab C is handled exactly the same way as from the ME to the lab. So all those manifests and tracking is built into Metric in that way.
Commissioner Rowe.
I have a question on metric capability too. Are the ITLs required to put how they're testing, whether it's PCR or plating? What got me thinking about that is auditing, and it's difficult to audit now based on the current configuration with the zeros, but if we're able to eliminate that, and that will help the auditing process. If we audit also what type of methodology they're using, we can make correlations between certain methodologies and results. And have we done that? Would we consider knowing what every lab uses for their testing methodology?
So that's separate. That's different from what we speak of. So,
Right.
right, the standardization in terms of methodology is different. And so even if they were conducting different methodologies, whether it be PCR or plating, that is not indicated in the system. Maybe we could have a function.
That's what I'm asking that roundabout way.
Yeah.
Because there's my understanding, somebody could be using pathogen DX. Someone could be using version 1, version 2, version 3. That could yield more favorable results in certain versions. And in order to really ascertain what the picture of the reporting, I think we need to know the methodology.
Right, so that's a matter of standardizing the
Yeah.
methodology. So before we could get to the point where we extract and gather data based on the different method types, we'd have to standardize the methods first. And we
Not necessarily, because by standardizing, you're saying you all have to use methodology ABC. And that's a lofty goal, and I hope we get there. But in the meantime, we want to know what type of methodology they're using before we even dictate what type they have to use.
we do know what methodology they
We do.
Yes, we do. For every single ITL, we have that information on.
You know exactly the methodology.
We know exactly the method.
And so so by shoring this up, it'll help you see trends, perhaps. If you're able to get rid of the zeros, no more a la carte, one COA, I think it would just make your ability to audit more robust, correct?
So with that, right? With that type of assessment, we don't even, although metric is helpful in that sense, we actually don't need metric to do that assessment, right? Because we know, yes, for information gathering, right? Yes, we need that. But we actually know which methods are being used by the ITLs. We know which the laboratories are sending their test packages and what they're using because we have their SOPs, we have their processes. And so we could request a specific data set based on date ranges, based on certain particular, outlines, or it depends on what we're asking. So everything is task specific in terms of what we isolate and what we draw out of metric. But that information we can start to gather now, even without employing the system of doing the a la carte testing or removing the a la carte testing. That's something that we can extract now. In terms of standardizing our methods, we would like to do that as well, right? That's another piece to the puzzle. This is just one area that is specifically geared towards our metric systems and functionalities and how we can more accurately get to that space where when we do pull information, we can rest assured, we can have the confidence, right? Because confidence is directly associated with whether our system is adequate. Are we having enough tests to reflect what we're trying to get out of it and whether we need to expand on that? So this helps us to preserve our confidence in the information that we are extracting because we have standardized certain processes, because we have stated that this is the way we would like it to be done. These are the limitations with that, and so on and so forth. So it is directly tied into that. And hopefully we do get to a point where we speak to specific methods for our contaminant screening requirements.
Just as a follow-up. So having that in metric, that information in a central repository, if you will, as opposed to having to chase down SOPs or individually chase down. Remember, you and I had a talk a couple of years ago, and I said, "What do you mean you don't have access to COAs internally?" What? Like my hair got on fire. And so, like, to have you have that access now to them is easier, helpful, streamlined. So I don't know if there is an ability to talk to metric if it's not there now, how do we get it there?
Thanks, Chairman and Commissioner Roy, to answer your question, because what you're basically saying to us is that what we sort of need to do at this particular time, instead of having to rely on the SOPs and having to be the one to audit that information, we need to find a way to get a configuration done through metric if we can. And so we are acknowledging your request. We'll make sure that we'll coordinate with our chief technology, with Paul, to ensure that we bring that forth to metric and see if that's a capability that can be done. So, and then we'll get back to the board in terms of updates, because also INE moving forward, we want to be able to give different updates related to the work that we're doing here at the commission. So once we have that information and when we've touched base with Metric, we'll let you know if that's something that can be included.
I appreciate that. Thank you. And I think it would make your lives easier too, to have it all at one place, to be able to conduct those lives. I appreciate that
Yeah.
very much. Thank you.
Yeah, thank you.
Okay, and so, so with this process, I'd just like to also add that there is no additional cost to the commission if we employ this function, as it's a system that's already established, and we would basically be enabling a function. So that is a plus as well. Next slide, please. So we'll get into or elaborate more on the benefits, right? The benefits to this policy change. So we would significantly eliminate cherry picking for the laboratories, right? So the notion of laboratory shopping is such that you go to the laboratory that you desire because of an intended outcome or an outcome that you believe you will obtain, right? So if you're required to go to one laboratory and you must do a full panel, then this will significantly minimize the multiple test samples sent in for repeated testing, right? This will reduce the risk again for the transfer and the sale of incompletely tested or inadequately tested products. Generally, when we have a system that has its safeguards in place, that is thorough, that is concise, that is reliable, and we're able to develop different queries to isolate information and extract them with accuracy, right? This builds our confidence with the data we have, the data we can present, and the data we can make available to consumers and patients. Generally, if we employ this system, the COAs, as we discussed before, right? You'll have one COA, one set of reporting data. Now, all of the information, as Paul said, will be funneled through Metric just the same. It's just that the way it is represented, the way it is presented will be different. There will not be, there won't be 5 or 6 profiles for the same product type where you literally have to go through to see which one is more recent, right? Because then that also impacts the COA's report date and the expiration date, right? And then also moving along, we eliminate the option of having these default entries of the zeros, because the zeros could mean several things. And when you're extracting information, you could see where the discrepancy could occur, because if you don't have the narrative or the context associated with the zeros and what they represent, your data is basically not as accurate as it could be, right? It is accurate because you can trace it. It has a home, it has a source, it has an originating testing laboratory, but you have to go into Metric and see what it means and distinguish it from the other expressions of what a zero, the default entry of a zero could actually mean. You have our audit capabilities, right? We talk about reliable data. We're talking about the capacity to isolate, the capacity to develop queries, to isolate information and extract it. When you talk about auditing, it's important to have reliability. And more importantly, when you talk about developing queries such that we can apply it to different areas and functions within Metric, it has to be reproducible, right? We have to be able to reproduce this information and apply the same systems to extract the same information in terms of consistency. So it does simplify the data management in that way. And it does add a layer of transparency, right? So all these things contribute to why we feel that, okay, this is a benefit to the commission, this is a benefit to consumers, this is a benefit to patients. And, you know, certainly I can't leave it out. We reduce Metric cases because the Metric cases are directly associated with multiple test sample packages being created. When you have multiple test sample packages being created, unless all test packages are satisfied with a test pass status or some sort of testing to satisfy the batch testing requirement, right? For each product type, for each category, it remains open and it's hung up. They have to create a metric ticket. It comes to us, we have to resolve it, but it's not just a checkbox resolve. We have to spend time to look into the package, trace it, see where perhaps the tests weren't conducted or were conducted, but it may appear based on the search that they weren't conducted because of the a la carte, but it is. You just have to go in and do a trickle down trace and tracking, and it's work, right? We're here to do that. It's part of our routine task as a part of testing, but we want to have a system that's more efficient as best as possible, right? And with this efficiency, with this effectivity, we can minimize metric cases. And a lot of the metric issues is not just about metric and configuring and changing. Some of it has to do with education, right? So we know that metric provides training, metric provides educational material. We also have that as a requirement in our regulations that the laboratory receives metric training as applicable to their operations, such that they can maneuver and function and insert and upload as necessary according to their testing needs and result reporting requirements. So we want to, move into a direction where these things are more simplified, these things are clear, we have one set of reporting results, and even if we have multiple, it's presented in a way where the expiration dates aren't skewed. Things are clear about test dates, upload dates. All these things need to be clear instead of doing a whole research when you're just trying to find out one date. What's the expiration date? You have to look at 4 or 5 COAs. What is the true expiration date? We know that metric currently uses the most current COA, but is that really accurate? Because when you start to test a product, right, and you move away from the first test and you're counting it as the most recent COAs, then the ones that you did prior to that, their expiration date comes before that most recently tested. That's an issue, right? So, and that leads to consumer patient health and safety. We know that there's ongoing research that needs to be contributed towards expiration dates and the development of the expiration dates per product type. But until we get there, we have a standard of a year. COAs are good for a year. We want to make sure that that information is transferred and accessible, and most importantly, reliable, right? When we make it accessible to the consumers, to the industries, to the public, we want to, as best as possible, ensure that this information is reliable. So these are all the ideas surrounding why we think it would be beneficial to do this change, to employ this process for our laboratories, for the commission, for our industry, for product health and safety, for our consumers and patients. Commissioner Roy.
Commissioner Roy.
Thank you, and thank you, Janine. You talked about audits, and at any point, are you able to share publicly at a meeting a high-level synthesis of those audits, what trends you see, even if we, and I don't understand audits sometimes impact investigations, so I want to just say that with not ever compromising an investigation. Is that something, if you're seeing trends, let us know, because it lets the public know. And this change, I think we're going to have motion language, I believe, along this to ratify this. And my question, I guess, is to EC Gooden. Would it require any regulatory change down the road, number one? And number two, it sounds like we're going to have to update that, but I go back to it a lot, that testing protocol that we have, right? So are those the things that will need to happen?
Acting Chair.
Of course.
There was a lot in there.
Thank you, Commissioner Roy. Yeah, and I think just generally speaking, how we can kind of think about that. And I do know that so there is another slide too to get to that also has kind of some additional considerations relative to enforcement actions, relative to data transparency and the like for those pieces of what you're discussing. I think as it relates to regulatory changes or changes to testing protocols, all of those are definitely under consideration as we're kind of reevaluating the standards that exist right now. I do think those would be kind of part and parcel to the next steps of this process as well. And I definitely defer as well as it relates to regulatory changes to our general counsel and the legal team too, to kind of work through that process. But I think your point is well taken, that look at this as a kind of a first step in terms of bringing us in line with other jurisdictions, but also there's continual
More
work to do. Yeah,
right.
Exactly.
Right. Thank you.
Chief?
Commissioner Roy, and as far as trends and all that, I will defer to our CTIO to see if he's able to respond to your question related to trends.
Yeah.
Mm-hmm.
Thank you, Chair. So audits are a big term too. There's individual audits, the testing team will just, random audits, and then there's the larger data analysis. There's still a lot of work going on in the data analysis world. In one of the slides, we'll talk about kind of where we are in the process of still building out a lot of the data analytics of where things are. And the other point too is there's trends and then there's causation. Why is a trend occurring? And is what we're seeing. And we're still working through a lot of that right now. So I wasn't prepared to present that, but that's certainly something we could bring forth in future meetings, some more detailed on the analysis discussion.
Thank you.
So, yes, so I was actually finished with my portion. Just I hand it over to Tim now.
Okay.
Thank you. So I'll start on the next slide. I believe this is the last one. So Paul and I are sharing a slide here. But so just to begin kind of my portion of this, I'd like to just root ourselves in the law. And so, consistent with our enabling statute, consistent with the authority that is it was granted to the commission through our enabling statute. We are the agency that's responsible for licensing and overseeing ITLs, as well as establishing, baseline minimum testing standards for any products that are sold or marketed to patients and consumers. So at the outset, I do think that we need to recognize that the majority of any enforcement actions that would be related to this area, if not all of them, are going to be really predicated on our ability to review and effectively analyze that testing data and the data that we have. Through this, or under this, in accordance with this proposal, this, as Genevieve spoke about, is going to really simplify our data set and allow us to do that analysis and verification much more efficiently, much more easily. Additionally, this is going to allow us to better assess violations of any applicable law or regulations. So just as some background context, what my team will do whenever we receive a referral from either the investigations team, the testing team, our licensing team, we go through and we analyze the facts of that referral. We apply those facts to the law, and we determined whether or not there were any violations at issue there. When we're talking about any violations that may stem from testing of cannabis, as well as potential lab shopping, all of that is going to be rooted in that data. So streamlining, making that more easy to analyze is going to significantly improve and strengthen our capacity to bring and prosecute these violations to better promote public health and safety in this area as well. So really kind of just those initial points, I think, are going to all contribute to more effective prosecution of enforcement actions that are related to this area. And then I'll pass it over to Paul as well for to close us out with our data transparency and efficiency points as well.
Sure. Thank you, Chair. Thank you, Tim. As we've talked about, data is an important part of this, and part of this initiative will actually make it much easier to make this data more transparent to the public and to external stakeholders. One of the challenges is we've talked about just the zeros being one of many. The complexity rules of the way Metric looks at those 5 COAs, and then now we have a human interactions at times having to arbitrate. Are these tests in fact all complete? Those don't show up in an nice database easily. It's checked through, it's not marked as passed, but you give this data out to the general public, put it out there, it now becomes very hard to analyze. We have to spend hours working with some of the external analysts of here's what the data is, here's what it means, and get into how Metric works. This really makes the data much more clean on the testing, which makes it much easier to be much more transparent with the public, of putting this data on our open data platform and then making it understandable and not, I'm not saying more accurate because it is accurate, but more easily digestible. Commissioner, do you have, Commissioner?
Yeah, if you're not, you're going to complete that thought.
Okay. So, the goal is, we are handling tens of millions of testing records alone out of the Metric database. What we're working on today is moving from a data warehouse to a data lake, version 2 data lake, to ingest all that data from Metric. And making these changes will actually make that process easier for us and be able to use all our data tools, our analytics tools to begin, going beyond just research analysis and posts, but actually be able to do more proactive alerting of trends and hopefully, within the next year or so, look at things like AI on top of that to begin identifying trends as part of this. So getting this down makes this much easier on the investigation side, on the analysis side, and also on the research side, as well as we've heard about the efficiency within the overall operation, so that the testing team can spend its time doing not just answering tickets and verifying test results, but truly in the field working with our ITL. So that's the goal of this. Certainly, as we wrap up here, I want to thank everyone involved. This is really a cross-team collaboration between CIA and myself and everyone you see here, along with our data analytics director, Marian Sarkis, Dr. Sarkis, and many, many others. There's a dozen or more folks who've been actively involved in this process, spending many hours in meetings, many hours analyzing data, many hours discussing with Metric the pros and cons and understanding what's going on and how we should look at the data. So certainly make sure that everyone, I will not even try to name everybody because I know I'll miss more than a few, but there's quite a large contingent of the team here that's been involved in this process over the last number of months. So thank you for all of them. So that wraps up what we have. So it's obviously opening now to any questions.
Yeah, Commissioner Rowe.
Thank you all. And this is a multi-pronged approach. So for those honest broker labs that are listening and may be frustrated, this isn't the holy grail. This is a step. We're doing this multi-phased, multi-pronged approach. And this is one more step to try to minimize and eventually eliminate it. And people, producers of cannabis producers, send their product to a certain lab for desired results. And that's the definition of lab shopping, right? You're sending it to a certain lab because this lab is going to give me the desired potency or pass what I need passed. And so are we completely eliminating it with today? No, but we're addressing it in standardization. We're doing other things, right? We have goals of standardization. We have a goal of a state-run lab for confirmatory testing. So for folks that are frustrated, that are the honest brokers, we appreciate you. And we continue to talk to us, and we are working diligently to zero in on the bad behavior. And this team is extraordinarily dedicated to that. So I just wanted to share that this is a continuing process and a continuing effort. And this is just one more step in that. And when we get more data publicly available, and we will, that'll be another step. And, hopefully someday we get the funding we need for a state-run lab and we are able to standardize. And so I just wanted to share that this conversation doesn't end today. It's the beginning. So I just wanted to share that.
Commissioner Concepcion.
Thank you. I for this segment, I turned my camera off because I just wanted to take as many notes as I could. First, let me start by thanking. It's so good to hear from you all, Chief Kamalo, Chief Clark, Attorney Gooden, Director Hall. Whenever I get a chance to hear Genevieve break things down, I get a notepad out because I know she's really going to go into the intricacies and the details. It's really, really valuable information. You guys should really be proud of yourselves. This is really important work, and it's really telling what goes into this process and the amount of thoughtfulness that goes into the recommendations here. I wanted to sort of follow up on a question that Commissioner Roy asked. She asked about if this would require any regulatory changes. And I guess I wanted to ask sort of a similar question just to see if there was at least a preliminary assessment just to ensure that there's no existing rubs within our existing regulatory scheme of things. So I guess that's a question for Attorney Gooden, just making sure that we can continue to do this work. And we've already done at least, a beginning sort of assessment to make sure that we're moving in a direction that doesn't call for any sort of additional action.
Thank you, Acting Chair. Thank you, Commissioner Concepcion, and it's great to see you again as well. Just hello, welcome back. So that's an excellent question. So we did look into that, and there, in short, there isn't a rub here. There is no regulation that specifically speaks to an allowance here or a prohibition. So this would really be more of a change in commission policy. And as Genevieve had spoken to as well, this is kind of what would go into this is coordination with Metric to turn on a function that they already have widely available and is used in many other states. So there isn't necessarily a regulatory change that is necessary or I believe required here. But I mean, obviously, if I defer to the general counsel in his opinion, if there would need to be anything, any additional considerations. But I believe the board could vote to adopt a policy at this stage as opposed to changing a regulation or doing something along those lines. Perhaps in the future, it might be of interest to codify something along these lines, but I don't think it's necessary as we sit here today.
Okay, thank you.
Of course.
Go, Chief Kamala.
Hello, Commissioner Concepcion, good to see you and welcome back. So we also checked in with the Metric as well. This has been an ongoing effort that the INE team has been working on for some time. We did some due diligence review since sometime, from a year and a half ago. As a matter of fact, the configurations that were made related to lab test batches, there was an effort to try and look into lab shopping at that particular time, but it didn't come into fruition. So we have had ongoing conversations, with Metric to see if this is something, a function that can be configured, or do we have capabilities to be able to do so? And as a matter of fact, Metric had indicated to us that at the time when we did the configurations, we should have been able to, turn this into a rule or, to turn it into a policy, which is why we decided to come to the board because it really falls into a policy decision that the board would have to make related to this so that Metric can then go ahead and turn it on. It's just a light switch. It's a turn on, turn off type of deal.
Chief Kamala, you somewhat answered the next thing in my mind. I was just wondering about that. How long does it take to implement these changes? How extensive is that process? And it just sounds like it's relatively quick.
Yes, it is relatively quick. And what we wanted to do, because we have to put into consideration that our licensees and our ITLs out there, our licenses, including our ITLs and cultivators out there, it might be a situation where they need time because they have existing contracts and things like that. So it will take time for them to transition. So we are looking to see if the board can consider at least giving them 3 to 4 months or so, if this is something that comes to fruition, for them to be able to start working on, adapting to this and making whatever changes that they need to make. And then also it gives them an opportunity, if there are any follow-up questions or anything like that they have, it can help us develop, an educational bulletin. It can help us develop FAQs and things like that, depending on the inquiries that are coming in. So we'll definitely need to give our licensees some time to transition if this is voted on today.
Okay, thank you.
Any other questions, Commissioner Roy? Okay. I understand you're looking for a motion today to direct you to develop an administrative order for us to consider at our next meeting in December, our next public meeting in December. Any final thoughts, questions, comments you want to make? No? I mean, I can go down the line and ask you. All set? Go ahead, Chief.
Thank you, Acting Chair. I at the beginning of the presentation, Genevieve acknowledged that we have one of our ITLs here, and I'm not so sure if that, it seems like I'm not sure whether he wanted to ask us a question or anything like that, but it's up to you, Acting Chair, to see if there is a question from the audience.
I'm not sure. No. I don't want to.
Yeah, it is a little bit out of the ordinary, but certainly invite you to stick around if you want to talk to our team after the presentation. But any other comments or thoughts?
Since we went there, if I may, I did hear your presentation at NECAN advocating for transparency of data, and I never forgot that. And these folks can tell you I have been advocating for transparency of data, and they are making significant strides, and there's just no magic data button switch you flip and it's there. And then obviously you can see with the zeros that there were issues in making sure it was accurate or clean data, if you will, for lack of a better term. So, you know, even when we did HCA's sunshine, you know, I'm a big proponent in that. And so I did hear you that day, and I never forgot that. And, you know, it takes time. Government moves at its own pace, and it does take time, but we want to make sure we get it right and we don't rush it. And I appreciate everyone's due diligence. But again, there's more to come, and we are working at that. So I just want to acknowledge that sometimes people feel like it falls on deaf ears. It didn't.
Yeah, yes, Commissioner Roy. Also with data transparency, if the board does vote on this, this will definitely, you know, help in terms of ensuring that because other jurisdictions, it seems like they also have COA uploads as part of, you know, data transparency as well, right? So if we have a situation whereby the board does vote on this today and we no longer have to allow lab shopping, then that would also help resolve, you know, or bolster transparency as far as data is concerned. So that's also another item that we need to really ensure that we, you know, we focus on. And then lastly, Geneva sort of touched upon this, but the amount of human resources that's involved in reviewing all those tickets because, you know, of being able to do this partial screening, it is a lot. And we do not have enough staff to be able to do this type of work. The bandwidth is just not there. But what we've been doing is we've been working with the resources, you know, that we have, the limited resources that we have. With the team, the testing team has also been meeting with Metric on an ongoing basis now to sort of see how we can streamline the process related to reviewing these Metric tickets, you know, and all that stuff. So there's that element of ensuring that one, we eliminate human error, right? Because there's a lot of tickets to be reviewed. Two, we do not have adequate resources, you know, for the staff to continue doing this long term. So short term, you know, very proud of the team that for all these years they've been able to do this, but at the same time, it's not sustainable. So it's not like we're at a point is, you know, where we're able to hire additional staff or dedicated staff, because truly it requires dedicated staff to review those tickets. And we do not have the funding at this particular time to be able to add more staff, to be dedicated staff to review those tickets.
So, and don't take this like in the negative, but if there are some dishonest labs and we adopt this, they can send their whole panel to the dishonest lab still. And so, but now we're going to be able to analyze and audit the data in a more efficient way to help identify if there are any dishonest labs. Is that accurate?
Commissioner Roy, as far as compliance is concerned, this is something that's an ongoing effort anyways at all times. Auditing is part of it. As our CTIO alluded, there's a lot of work that's going on behind the scenes related to analyzing the data, validating the data, and all that stuff. So this is something that the commission is currently really, we're working on this. And if it means at some particular point, there's a way for us to be able to look into outside consultants or things of that nature to be able to assist us with this, then we will do so. And also, we are in the process of hiring a director of testing.
Yep.
We are hoping that when the director of testing comes on board, these are some of the things that we can be able to, you know, to look into and all that stuff. So this all goes into ongoing efforts and work that the team is, working on, collaborating with the data team in order for us to be able to come to that point of being able to say, yes, we can analyze, yes, we can verify, yes, we can validate, right? But auditing is part of an ongoing compliance effort. But as you also mentioned here today, if the commission is able to be provided funding for a standards lab where we can do confirmatory testing, then that would allow us to be able to go out there and do our own auditing, and we can bring the products and whatever else we need to do to test it ourselves, without having to rely on the licensees. So these are ongoing efforts that we are, that we're continuously, working on. We are listening to what the public is saying. We are listening to the constituents. We are listening to what the ITLs are saying, right? Because some of our ITLs have reached out and they have told us that they have concerns of either data manipulation or things of that nature going on out there. So, which is part of the reason, why we're also doing this. So we're basically saying to you all, we heard you, we're hearing you, and we're doing the best that we can in order for us to be able to address some of these concerns. But then again, a house was not built in a day. It takes time.
That's my point.
Right?
Exactly.
We're hearing you, we're doing the best that we can with the limited resources that we have. It is a staff of less than 10 people, approximately about 6 or so, doing this work, reviewing these tickets daily, right? And putting in a lot of time and effort to be able to be responsive. Because what's also happening is that if they're not hearing back from the staff, then they're reaching out to commissioners and saying the staff is not responding to them in a timely manner and all that. So to eliminate that, we really want to be able to streamline this, have a place where a centralized location related to full panel screening and all that. So this is really meant to do well. It's good intentions for everyone involved, for the industry and also for the voters of the Commonwealth of Mass.
And if I may.
Sure.
And I applaud all of you and everyone else that's not here at this table that is working towards this effort. And again, you think you started with this. This is public safety. This is public health, and this is what it goes down. And for if there is data manipulation, dishonest labs, they're in violation of our regulations and the law, quite frankly, because you're putting people at risk. And, it's unfortunate that we have to go to these great lengths to mitigate it, but this is the circumstances we find ourselves in. When we have somebody testifying, and I don't know the accuracy of what they had tested, but telling us that they had a pre-roll, that they did confirmatory testing and it came back with 500,000 colony forming units of mold, that's startling to me. And that is a huge public health risk. So it's unfortunate we have to go to these great lengths, but here we find ourselves. And I thank you because at the end of the day, this is what it really comes down to: public health and public safety. So.
I think Commissioner Camargo is online and can join us if she can hear us.
You have to turn off your mic so I can turn on my mic, I think. Hang on
just a minute, Commissioner Camargo.
I think. So is she still with me? She's still with me, but I'm gonna turn mine on. Commissioner Camargo, are you with me on mine? Oh, okay, let me turn up my volume. Okay, go ahead.
Okay, good. Thank you. First of all, thank you. I'm going to just ditto what my colleague said in terms of being grateful and thanking you all for the presentation and, being so thorough. I know that Chief Kamalo, I met with you and your team the past few weeks in terms of this topic in particular, and you were able to educate me on the process. I think Commissioner Concepcion asked the question that I was going to ask, which was, what is the time frame on this? I know it's a turn of the switch, but how much time do we give labs to kind of, restructure or, do what they need to do? So I think you kind of answered that. It sounded like 3 or 4 months. The other piece to Commissioner Roy's, comment now, it's unfortunate that we're here. I also think about, of course, there's folks that need higher potency when it comes to, our products, but I also, I think it's a good opportunity to educate the industry. I mean, which I think they all know this, but also it's also the quality of products. right? So I think sometimes, you know, I just myself, I'll say as a consumer and buyer at times, you're thinking about, okay, you know, potency and this and that, but you don't think about the quality and, you know, I'm glad that we're doing this and I think it allows us to also educate consumers as well, because at the end of the line, this is the front line. If these products are not, you know, tested properly, then, you know, why are we here? So I just want to thank you all. And thank you, Commissioner Roy, for calling me in. I had to step out, so I appreciate it. I've been able to listen to the whole presentation as soon as I walked out, so thank you.
Thank you, Commissioner Camargo.
All right, I'm gonna X out mine now.
Yeah.
Okay.
Thank you, Commissioner Camargo. I also want to add my thanks to the team. I think Chief Kamalo, to your point, the time and resources to go through all the ticket requests and go through the data. I know there are days that Director Sarkis literally gives up her entire day to try to feed through this information. So the transparency element of it is key, but also I think it's a bigger first step. But let's not gloss over, I think, how important today is in our discussion on this topic is to move us in the right direction of continuing to focus on transparency. And as Commissioner Roy said, can take another step towards safeguarding public health and safety through all this as well. So thank you all very much. Commissioner Roy?
I may borrow yours.
You may borrow mine.
Yeah. No worries. And we've had many talks internally, and another issue that I raised is perhaps looking at the pharmacopoeia, in the United States pharmacopoeia. And so we've had talks internally about that, make sure that we're in alignment with the testing methodology, is in alignment with our regulations, which are based on the United States pharmacopoeia. So that's another area, right?
Yes, sorry if I may, yes, Commissioner Roy, yes, we are, all those things, all of the above. This is something that the team we've been working so hard to ensure that we look at these USP standards. That's why we are hoping that when our director of testing is hired, he or she can be able to come in and look into where we are, right? Where are we and where are we headed, and what is the direction that the commission is taking. And then also they'll be able to also be play a big role in ensuring that we update our testing protocols and then also our regulations as well. Because if we look at 500, 160, it's so limited, right? There's not much there. Not that we're saying it should be dense, but at the same time, I think, there's certain things that can be done to ensure that, for example, we can incorporate some of our protocols within our regulations as well, just like how we have it for, other regulations 500 and 501, right? So there's a lot of work that needs to be done related to testing. There is, and we are hopeful that we can come to a point, and Geneva had alluded to this earlier, in standardization. But in order for us to be able to standardize, we cannot emphasize enough how important it is. It is very pertinent for us to have our own standards lab so that we can be able to, do our own testing, figure out what works before we can even create, these formulas and things like that. You also talked about the ongoing conversations that, our enforcement director of training, Armand, will be having with the ITLs.
Yes.
There's going to be an opportunity to get feedback, from the ITLs in terms of where things are, how things working, and then he'll be able to share that information back to the board and also to our director of testing and our executive director and all that. So we are making efforts internally and also trying to find ways to also foster an environment of collaboration externally as well. And that's where Armand, our director of enforcement training, comes in so that he can go in there as an intermediary, to sort of, gather the information, hear them out, because before we can even get to standardization, we need to ensure that we're all, sort of on the same page, right? And then also, as we know, science is always changing. It's not always the same all the time. But we want to be able to keep up with the trends and keep up with the times in terms of where things are. So we definitely hear you. This team has been working hard, diligently to really address all of the above, all of the things that have been discussed here today, and some of the information that we've received therein from the emails that we're receiving from the constituents, including our ITLs, where, you know, we are addressing that right now, and we're taking these baby steps in order for us to be able to be responsive.
Before you ask a question again, Commissioner Roy, a question from Commissioner Camargo, just status of the hiring of Director of Licensing, how close are we?
Director of testing, because we do have a director of license. Okay.
Sorry, Olivia, that wasn't you. Director of testing.
Yes.
Thank you. Long day. Go
Right. That's okay. Our director of testing was still in the interview process. We're still interviewing at this time. And, you know, we are hopeful that we'll be able to get a qualified candidate to be able to come into the position as the director of testing. So yes, we are currently conducting our interviews.
Or Director.
For testing, yes.
In case Olivia was still listening in. Go ahead,
Thank
Commissioner
you.
Roy.
And we glossed over Director of Training Armand Enos' role as far as meeting quarterly with ITLs, and you just touched on it. Can we kind of announce it? Yes.
Okay, yes, this is exciting news, actually. You know, our, Director of Enforcement Training, it's an interim role. But then while it's an interim role, we definitely, have seen that we need to have funding for the position and have a full-time position. He has conducted many trainings. He has collaborated with the other directors in conducting trainings for onboarding of employees, for continued training. Even with the implementation of Chapter 180, Armand has been very involved and worked with the EC and his team and other members and, and our current Director of Licensing, Olivia. So, but as part of that, there's so many elements. When we presented this position to the board, we had talked about the scope of the work that the director, would have to perform, right? So the ITLs did express, it's not just the ITLs, but others have expressed as well that they need to have meetings with the staff. Right? This has been an ongoing request, but it is difficult to maintain. It's impractical for us to be able to do that on an ongoing basis because we have to be out there inspecting, investigating, all these other things that we have to do. But our director will be able to do that. They'll be able to, meet with our licensees, because also outside of implementation, we want to see if what we're doing is working, right? That way we can be able to bring it back to the board. So that's, that's part of the scope of the work that our director, has to perform or be performing. And in addition to that, we have enforcement action where we have affirmative relief, right? This is something that's publicly known that when we have enforcement actions, there are certain things that we have to maintain in some instances where licenses have to be on some sort of a probationary period for some time and things like that. That's where our director also comes in to ensure that, in fact, those affirmative relief is actually being implemented and being met. So there's a lot of utility in that position, or also that there is a need. There's been an ask, from our licensees for us to continue to have ongoing conversations or engage with them, right? So as a response to that, we are committing, publicly today that our, Director of Enforcement Training, Armand, which most of them, they know, they're familiar with him. He started off here at the commission as an investigator. Then he has been an investigations manager. And then not only that, now he's our interim Director of Enforcement Training. So they're familiar with him. And I think this is really going to be good for the industry and also for the commission as well. He'll be able to inform us in terms of how we do our guidance documents, in terms of how we do our FAQs, in terms of how our educational bulletins and things like that. And so this will help us in terms of us to continue having that, continued communication with the industry, to have Armand be out there communicating with the licensees. We look forward to it.
Thank you. Great.
Appreciate that. Yeah. To your point, Chief Kamalo, the enforcement training has been a critical piece. We heard from the industry, obviously, as we bring, investigators on board, that can kind of consistency and just responsibilities as folks are going in and out of facilities all day long. First of all, you picked the right person. Carmen has been great and great to work with. Commissioner Concepcion, did you have anything else?
I did not, but thank you.
Okay, thank you. Again, with that, I believe I'll entertain a motion to direct staff to develop an administrative order consistent with our discussion today for the commission consideration at the December 12th public meeting.
So moved.
Motion made by Commissioner Concepcion. Is there a second, Commissioner Roy?
Second, talk loud.
There we go. Motion made by Commissioner Concepcion, seconded by Commissioner Roy. Any further comments or questions? I don't know if Commissioner Camargo can still hear us. Commissioner Camargo? Okay, Commissioner Concepcion?
I have no additional questions or comments.
She might be on mine, so can I recheck with her through
Sure.
yours and?
Yep.
Commissioner Camargo?
Yes, thank you. I only had one question, Commissioner Stebbins. I had put it in the chat. I know we just announced the meeting of the ITLs. And my question was just, is that like an indefinite thing? We're gonna, that's a new policy for the commission, or is that like a temporary thing? And I am also ready to vote, but I wanted to just understand that announcement.
Thank you, Acting Chair, Commissioner Camargo.
Can you hear her?
Can you hear me?
No.
No, she can
No,
hear
can
you.
Can you hear her?
I couldn't hear her.
Okay. Yeah, my microphone is on. Can you hear me now, Commissioner Camargo? Okay, all right. So now this is too close. I feel like I'm loud now. Sorry about that. Commissioner Camargo, so no, this is within the scope of the Director of Enforcement Training position. It's within the scope of their work to do outreach and all that. So yeah, so this is, and this one just before the ITLs is for all licensees.
Okay.
Yeah.
Okay, thank you.
Mm-hmm.
I'm gonna mute Commissioner Stebbins.
Commissioner Camargo, you voted
Aye.
aye. Okay. Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
and Commissioner Stebbins votes aye, 5 in favor, none opposed. 4 in favor, sorry. Wow. Getting a new job for Olivia, and I can't count, apparently, at the end of the day. All right. Thank you all. Appreciate it. Very well done. Appreciate the great work and the great work of the folks that worked alongside with you who might not be at the table with us today. Excuse me for just 1 second. The next item, no business not anticipated at the time of posting. I don't believe there is any new business. Our next meeting date right now is scheduled for December 5th. We will be back here in Union Station. That will be discussion and presentation of our social consumption regulatory framework. And then December 12th will be our December monthly business meeting. Any other comments or questions from my colleagues? Commissioner Concepcion, nice to see you. Thank you.
Likewise, and thank you so much, Chair Stebbins.
I'll entertain a motion to adjourn. Commissioner Concepcion.
So moved.
Commissioner Roy, you second that.
Second.
Motion made and seconded. Seeing no discussion, roll call vote. I don't know if
Commissioner Camargo? Yep. Oh, you voted. Well, can you say aye?
Aye.
Okay,
Okay, we got you.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins votes aye, 4 in favor, none opposed. We are adjourned. Thanks, everybody.
Thank you all. Have a good one.